All right, good morning, everyone, and welcome to the gorgeous Luxor Hotel and Casino here in Las Vegas for the Health 2.0 Conference USA 2025. I'm Jillian, and I'm thrilled to be your host as we dive into the dynamic and evolving world of healthcare over the next 3 days. We've assembled a stellar lineup of trailblazers, innovators, and thought leaders from all corners of the globe. Get ready to explore cutting-edge technologies, revolutionary approaches to patient care, and innovative solutions to some of the toughest challenges facing our industry today. This is the platform where every conversation, every session, and every interaction has the potential to spark change. Do remember to share your experiences and takeaways using the hashtag Health2Conf. Whether it's your insights from a panel discussion, a snapshot with a new colleague, or your thoughts on the future of healthcare, let's make our collective voice heard and inspire change beyond these walls. Before we jump into our jam-packed agenda, I'd like to extend a huge thank you to our sponsors for their generous support. Our silver sponsor, Centrifuge Inc., and our bronze sponsors, VitaWelt Apothecary, Regine Global, and Dr. Weiss Wellness, PLLC. We couldn't do it without you. Now, let's get ready to make this conference unforgettable and a journey of learning. Are you with me? Let's get started and make every moment count. Did you know that more than 1 of 10 adults worldwide has diabetes, with type 2 being the most common and largely preventable? The real question is, why aren't we doing more to stop it? In our first panel of the day, Preventing Type 2 Diabetes Strategies for Lifestyle Modification and Risk Reduction, leading experts will share how diet, exercise, technology, and policy shifts can actually change the trajectory of this disease. What interventions actually work, and how do we make prevention more accessible? These are the questions that we will be tackling. Let's welcome our moderator, Greg Bauer, the managing partner of Health Connections, and the panelist to the stage. Please welcome Greg.
To Las Vegas. We're thrilled to be here ourselves. I've got an esteemed panel with me, and we'll be addressing these issues. And as we were preparing, I will tell you, what's fascinating about this group is they all come at the disease from different vantage points. And we're going to have a very interesting conversation today about not just the dynamics, but we're also trying to uncover best practices and a few ideas that we can all follow going forward. One question I have, just to understand the audience a little more, how many of you are clinicians? Okay, we got a few. And then healthcare providers, working for a hospital, okay. And then investors in digital health, not so much. And health plans, payers. Great, okay, terrific. So with that, I'm going to introduce our panel. I'll just say, as I do in a moment with them, that we've all seen the numbers on diabetes, 38 million currently in the US with diabetes, and then another 98. We term it pre-diabetic, but as Dr. Gutman has apprised me, it's not really pre, because you are either a diabetic or you're not. Anyway, but the point is that 8 out of 10 of those people don't even know that they have the risks. And so from my perspective, this is where the core of the work is that we need to do. And so with that, I'm going to introduce, starting with Dr. Amy Gutman, talk with the group a little bit about yourself and your focus on and what your company, Tough Love Med, does.
Good morning. So my name's Amy Gutman. I am an emergency physician from Orlando, Florida, where it is a lot warmer than it is right here right now. And I have a private company, Tough Love MD, in that it is all the things I don't do in the emergency department. And it came out of me becoming very, very ill and not being able to fix myself, and then realizing 85% of the patients I take care of at night, and I only work night shifts in the emergency department, a little bit crazy, but about 85% have chronic disease, and they're there because of their chronic disease, which is absolutely preventable. I will happily have a gunshot wound to the chest every night, other than telling a 21-year-old diabetic, guess what, you've just had a major stroke, and you're in kidney failure, and you could have fixed that. So I spend a lot of time outside of the emergency department talking to everybody, but a lot of executive leaders as well, for their company's health, how to keep them healthy, everybody metabolically well for their body and their mind. That's Tough Love MD, and I'm very happy to be on this really interesting panel today.
Thank you very much.
Just talk into it.
Not quite.
Seemed to work.
Did it work? Oh, there you go. Okay. Next we have is Dr. Adam Perlman with Pendulum Therapeutics. You want to just an intro is good. Yeah.
Okay. Get the right program. Get with the program here. So thank you. Yeah, thrilled to be here. Adam Perlman. I'm an internal medicine physician by training, but I've done integrative and what's called functional medicine for 26 years. A little more of the holistic health, but typically within academic health centers. So I ran the health and wellness portfolio for Duke University, the Duke Diet Center, and Fitness Center. So I do a lot of lifestyle medicine as well. Most recently, I was at Mayo Clinic in Jacksonville, Florida, and including having a role as medical director for employee well-being. So I thought a lot about preventing diabetes and reversing diabetes whenever possible. Until about a year ago, I have a particular interest in the microbiome, the 100 trillion bacteria that live in our gut that influence pretty much every aspect of our health. This is sort of an evolving area of science, and was doing some research on type 2 diabetes and the microbiome for a company called Pendulum Therapeutics, which is a biotech company based out of Silicon Valley that's focused on the connection between the microbiome and human health, and have a probiotic blend that actually influences and has been studied in type 2 diabetics. And as a part of doing that research, sort of fell in love with the company. The chief medical officer decided to retire, so as of a year ago, I am chief medical officer for Pendulum, still based in Jacksonville, Florida, where I was at Mayo Clinic. So thrilled to be here and looking forward to the discussion.
Thanks, Adam. And then Arcella Burton, she's Vice President of Government Affairs at HealthX, very interesting health information exchange technology outside New York.
Hello, I'm happy to be here today. Tell you a little about myself and our company. HealthX is a health information exchange company, the largest in New York State. We have over 20 million patients that we collect data on. And what we're doing for diabetes and for all cohorts of diseases, but primarily for diabetes right now, is that we have a new program called Focus 360. So we collect all your health data from your doctors, even if you go to your nutritionist, your labs, your radiology, and we will send alerts to the doctor to let them know what your A1C is. If there's a change in your metabolic panel, we notify the doctor with an alert that let them know that. We also like to give the patient that information too. So we have an app for the patient called My Health Record New York. It's free for all New Yorkers, and it's a way for them to see what their numbers are. So when they're talking to their doctor, they can say, you know what, I don't understand why my numbers are so high today. I ate what I was supposed to eat. Do you know why it's high? So we're trying to empower patients to talk about their own diseases too. Thank you.
Great, thank you. And also with us is Dr. Bitlab Malo, who's with founder and CEO of an organization called STAPGen.
Hello, everybody. Good morning, and thanks for coming here. Thank you, Health 2.0, to inviting us in this, so distinguished panel. I'm a dentist by profession. I've been practicing dentistry for 25 years. And 3 years ago, I started the company called StabGen with a mission to prevent type 2 diabetes and see a world without diabetes. We developed a test that will predict your type 2 diabetes 5 years in advance, and we can recommend what step needs to be done in the next. We also developed a therapeutic. If you need it, we can supply it. And we have the test and we have the medicine. We need your help to implement it. Thank you.
Thank you very much. Also, we have another panelist who was not able to join us this morning. She will be around later. Her name is Dr. Isa Chalamet. She's from San Francisco, and she is the CEO of an organization called Yoga of Health. Without going into too much detail, her focus is really on the health of the liver and how we have to make sure we pay attention to that and keep it strong and clean, because it relates also in some ways to the whole health of the microbiome and the gut. So she will, I'll speak a little bit at various points, but I'm also going to have BipLab do some interjections too, because some of the things that he does around cleaning toxins relates to some of what she does. So I thought what we could do to start the conversation is just have a high-level brief about the dynamics of how diabetes gets how we get conditioned with diabetes and get sick. I thought that having a grounding of that might help us kind of establish a framework for the remediation plans that we're talking about. Because we know diet and exercise is important, but, and I'll ask each of you this question: is there a particular point of attack that you each must feel is prioritized for someone to reduce their risk? Is there something in the way you would prioritize that? I'll start with maybe Amy.
Sure. So, like all chronic disease, it sort of comes down to the fact that, especially with diabetes, inflammation, so insulin resistance, which is sort of the condition of when your sugars are out of control for whatever reason, whether you're born that way or it's acquired over your life, as most people who have type 2 diabetes. So chronic inflammation leads to insulin resistance. You have more and more sugar, and your pancreas just can't keep up. And the gut biome, which tends to react very poorly to chronic inflammation. So if you can attack, for whatever mechanism, not necessarily pharmaceuticals, not necessarily this particular product, not necessarily this specific, but if you can attack the insulin resistance at a root cause, and with functional medicine, it's the attack as well, if you can address the root cause, you make the chronic disease go away. That way you don't have to worry about a million different individual therapies, just the root causes. For me, it makes sense for ketogenics because it's a low carbohydrate approach. And if you take a diabetic and you put them on a low carbohydrate diet and take away the thing that's killing them, they tend to react very well to that because you don't need carbohydrates to survive. Fixes the gut, fixes the liver. You don't have to be on Ozempic the rest of your life, having diarrhea at weird points during your day, or bowel surgery, or going blind, all these wonderful things. But I'm a root cause kind of person.
That's great. Adam, anything you want to add to that? Because we talked about inflammation as well.
Yes. Well, what's neat about a panel like this is I think we're all bringing a different perspective. I think each one of us, and easy to sit here and say we need to eat better and exercise and all those sorts of things. I mean, at a very core level, building on what was being said, the issue is really, if food is energy, and it's really energy overload, and when the body doesn't know what to do with that energy, it stores it. And that creates issues with our metabolic health and insulin resistance and things you were just hearing about, and ultimately diabetes. And socioeconomic factors come into play, and you'll be hearing, I'm sure, more about that. I think the angle that maybe I would bring, just to sort of clarify, is I think what's really interesting in terms of the science is we're beginning to understand from a methodology perspective or a pathophysiology perspective kind of what is happening. So I know we were in a discussion earlier and we were talking about childhood diabetes, and which is obviously driven in parallel with childhood obesity rates. But and one of the comments that you made was, well, a big part of that is that people eat so much ultra-processed foods. And I think we all kind of accept that now, right? Okay, if we're eating a lot of ultra-processed foods, it's going to create havoc. Now we're beginning to understand the pathophysiology there, or what is going on. And so I'll try to do this in another minute.
No, that's good.
But a lot of it has to do with, and again, not to sound like a one-trick pony, we need to eat better, exercise, all the things that we need to do, but just to focus in on this one area for a moment, a lot of it does have to do with the impact on the microbiome. And so let me use GLP-1 as an example, okay? I know there was only maybe a smattering of clinicians here. So maybe if I said, what is the drug Repatha? Some of you may say, well, I've never heard of it, I don't know. But if I said to you, what is the drug Wegovy? How many of you have heard of that drug? Or Ozempic? I'm sure the majority of the hands, unless you just don't watch TV anymore, would probably even know the jingles, or some of the other ones that are out there. And so what's happening right now? Well, what is Ozempic and Wegovy? I've spoken to many patients on those drugs that don't even realize that that is a synthetic form of a hormone that our body releases naturally called GLP-1. And certainly these drugs have an important role to play. They are very efficacious. We don't have a lot of long-term data. They certainly have side effects. That's something we were discussing. And I think equally as concerning, what's the long-term plan? I mean, I had a friend of mine who was 53, wanted to lose 15 pounds, got a doctor write him for Ozempic, but then what's the plan? Is he going to stay on Ozempic for the next 40, 50 years of his life? Because we know as you come off it, typically the weight goes back on. So I'll try to be brief and explain that the way it normally works in the body is that you eat a meal, that many of us just did, and it's actually the bacteria in our gut, certain strains like something called Akkermansia, there's no quiz at the end, but these what are called next generation strains, meaning it's not the typical Bifidobacterium lactobacillus that we kind of grew up with that would be in a probiotic, but strains that they're newly being discovered and that have a profound effect on our health. They actually eat that meal, and they release signaling molecules that then bind to receptors on cells that line the gut in response to that meal. And that triggers the release of GLP-1. And then this GLP-1 hormone goes to your pancreas, tells your pancreas, you just ate, make insulin so your blood sugar doesn't go too high. Goes to your stomach, slows down your digestion, allows you to absorb your nutrients and feel more full, and then travels up your brain to the areas of your brain that control things like satiety, feeling full, and tells you to feel full and stop eating. Right? Shut off the valve because you've had enough. The problem is that there's so much that we do, like eating ultra-processed food or not getting enough sleep or not exercising enough, or even things like I just did, traveling from the East Coast here, where you have changes in time zones and circadian rhythms. All of this can disrupt the microbiome in a way that we can be deficient in these key strains that are that middle person that allows you to release GLP-1 effectively. And this is at least part of what's driving, mechanistically a lot of the sort of the epidemic that we're seeing in the rise of things like insulin resistance and diabetes.
That's a great clarification of the process. I actually, Ursula, might pass over you to go to BIPLAB because you're talking about toxins and how and where they play a role, and even to the degree that Dr. Chalamet talks about the liver. Maybe you can speak to the toxins and stuff as well.
Okay, sure. I will try. Now, on these panels mention that microbiome, yes, it does play a very big role. Now, there is an enzyme in your gut that takes care of the microbiome. I want to mention it because probably this is the most important enzyme in your entire life. Okay, and I mean it. Today, how many of you brush? Everybody. So who brush our gut? Okay, it's very simple. We found that it is in the intestinal alkaline phosphatase. So what happens, all the dead bacteria have cells and they produce toxins. And intestinal alkaline phosphatase detoxify that toxins. In a person who is healthy, it is a normal process. But in a person who does not have that intestinal alkaline phosphatase, it becomes a problem because you cannot detoxify those toxins anymore, and they go to the blood. Anywhere they go, they create the problem. Liver is one of the organs, kidney another. They keep us safe from different types of toxins, and that's the detoxifying in the liver comes. Now, our solution, very simple. It is based on discovery by my brother. He has been studying this. His name is Dr. Madhusudan Malo, MS Malo. In 2010, he and his colleague found a very interesting that intestinal alkaline phosphatase measures. Intestinal alkaline phosphatase maintains the homeostasis of microbiome, and it was published in 2010. Now 2015, 15 years ago. What happens that if you have low level of IAP, you develop a called intestinal alkaline phosphatase deficiency. The STAP test, stool alkaline phosphatase test, measures how much IAP unit you have in that stool. If you have less than 65 unit per gram of stool, we consider that's IAPD. And that is the risk point. Then if you have less and less, that means you develop even more problem. So we detect and quantify and measure intestinal alkaline phosphatase, very simple with a STAP test. And then, according to the risk level, we'll be prescribing if at all you need a next step or not. If you have high level of IAP, you will not develop type 2 diabetes. But if you have a low level within those I just mentioned, then you will develop type 2 diabetes. We have done the mouse study, we have done the human study, but we need a clinical trial to prove it. And that's why I am coming to all of you for your help.
That's terrific. And what I get from the discussion that we've had is that really you're talking about data capture. And with that, I'm going to ask Arcela a question about the data, because your organization basically traps A1C levels, and you have this continuum of data that you feed both clinicians and patients and health departments. And then you also incorporate data from the social determinants of health. And so can you speak to what that data management, capture, delivery, what that does to the care management?
Sure. So what we do is we take the data, and I'm going to give you a story because it's easier for you to understand it. We had a patient that brittle diabetic. Her son was a type 2 diabetic. She was going to the food pantry every single day. So we're connected with the food pantry. And what we would say to the food pantry is, after we saw it she was going to the food pantry for 7 days in a row. We notified the food pantry and said, something's wrong here. You're giving her this amount of food and she's going to the food pantry every day. We're going to notify her physician. We notified the physician. Physician said, well, her panels are really off and her son is not taking his insulin. So we said, okay, so what's going on? We went back to the food pantry and said, can you give us some more data? What kind of food are you giving her so that we can notify the doctor? They said, well, because she has the 2 kids, we give her the bread, we give her the milk, we are giving her some vegetables. But the food pantry said to us, but we never asked her, did she have a place to put her food? Did she even know how to cook it? So when we found this out, we went to her environment. So this is where social determinants of health really helped to put the pieces together for this patient. Went to her apartment. We found out that she was in a rat-infested apartment, heavily mold. So whatever they were giving her from the pantry, the rats were eating the bread. She had no refrigeration because the refrigerator didn't work, and she didn't know how to use a microwave. So we were able to place her into a different setting, even though she had housing. I always tell people, just because you have a housing doesn't mean it's the appropriate housing. We put her in a setting where she could have refrigeration, she had a place to cook food, and I was so excited when they told me, they said, Dr. Burden, guess what? That patient you were so concerned about, her numbers leveled off, and her son has no signs of diabetes. So that's where social determinants of health and the data we collect helps the whole health continuum.
You were also telling me the other day that you can look at very tightly boxed geographic populations, and you can look at the kinds of stores, food stores they go to, and if somebody is living in an area with a lot of fast food, pizza places, your organization will work with the state and give financial incentives to help them change their menu so that the menus are more healthy. Likewise, you went to Trader Joe's and you saw that Trader Joe's was underrepresented in these areas, and so you passed a bill that provided a financial incentive for Trader Joe's to put more stores in. Is that correct?
That is correct. So what I do is I go around the communities, and we go to the social economic communities with the lowest, I would say the lowest access to care. And just because we say access to care doesn't mean they can't go to the doctor. It's just that the access is not culturally compatible for them. So we also went to the stores, and in certain neighborhoods in New York, there's stores. New York is famous for its delis. Everyone likes that egg and cheese. $2. Well, it's not $2 anymore, but it's $2 egg and cheese. Everyone loves that. But there was no grocery stores there, nowhere to get fresh food, fresh vegetables. So what I do is I go around to neighborhoods, and people I work with, they hate to hear me talking because I talk about health disparities and I talk about health equity. I know I can't say equity anymore, but I talk about health access where people can't get the kind of vegetables that you and I are used to, fresh vegetables. Even frozen vegetables is better than canned. And what I do is when I find these areas, I go to the state. That's why I'm VP of Government Affairs. Go to the state. I lobby with my congressmen and my senators, and they hate to see me coming, and I said, we got to pass a bill. And I guess they pass the bills because they're tired of me talking to them. But it's actually helped a lot with places like Trader Joe and Whole Food, because the state is giving them tax abatements to actually put their markets in places where they normally would not be.
Actually, Dr. Chalamet made the point when we were talking that Amazon, as it relates to underserved areas, has created a whole series of online provisions for the delivery of healthier food. And they've created payment models for people to do that. Do you know much about the Amazon?
Yes, so Amazon, we use Amazon especially for our seniors. So we give them a Amazon allotment where they get fresh farm foods that are sent to their home. And there's also a new place in New York, it's called Rethink Food, where they will take these foods and they will make them culturally compatible for them. So, because most people say, well, I want my rice and beans. Well, you can have rice and beans, but with cauliflower. And we use Amazon and Rethink Food to do that for our seniors, and especially a lot of the newer immigrants that are in New York.
That's terrific. Now, what I want to do is go back now to something that you were saying earlier, Amy, and that is when you look at the delivery of primary care, and we can say to people on Medicaid and other places that are underserved, you need to eat better, you need to do these things. The challenge comes first with a health literacy issue because they don't have it. And that begs the question about, well, what is their primary care physician and primary care team doing to help them? And you had said that, a lot of people walk around with chronic conditions that are not really serious, or they're developing, but they're not life-threatening yet. But without having some kind of data and awareness, then an acute event occurs, and now the horse is out of the barn, and so on. What I'd like to do in the portion of our discussion left is really, how do we adjust primary care design so that we can apply population health management tools to improve one-to-one primary care for people and give greater access to more people. I have some thoughts, but I'm just curious if we just go down the line, what you guys might think about how we might do that.
Sure. So the average primary care visit for an adult is about 15 minutes in the United States. And that includes reviewing your labs if you've had them drawn, refilling your prescriptions. Really no time for preventative care at all. So there's different models. People go to functional medicine physicians for primary care, different types of physicians for primary care. I grew up in Detroit. We were not wealthy. We went to the doctor when our bone was sticking through our skin or something of that sort. And talk about a food desert, it's certainly gotten worse over the years. And one of the problems with primary care physicians is you don't have a lot of talk about prevention because nothing's a crisis until it becomes a crisis. And then you have the question of, is the primary care even giving good information? There are good doctors on bad days, there are bad doctors on good days. But since I think storytelling is actually a really very effective way of telling this, I had a patient the other night, and I've HIPAA compliant, of course, and I told her, I need to tell your story because it tells you about health literacy, not in patients, but of physicians, in that she was an insulin-dependent diabetic, very well controlled her entire life. And she came in with a blood sugar well above 800, diabetic ketoacidosis. What has changed? Well, she got a new doctor, and the doctor said, you're not eating enough fiber. So why don't you have some apples? She said, okay, well, how many apples? Well, you can have up to 10 a day.
Keep the doctor away.
And I rarely believe patients. I'm a night shift doc, but this woman was sincere. So she had apples, about 10 a day for a week. Ended up in the ICU, kidney failure. She developed a cardiomyopathy. Her heart enlarged and didn't work as well. She's going to have $80,000+ worth of debt that she didn't need to have, and progresses her neurovascular and cardiovascular health down a road she didn't need to go. because the doctor was like, you need to have more fiber. And it's not because the doctor doesn't care, he just sees one part of the issue. Whereas if we look at patients as a whole, from the social equity, you know, even having a Trader Joe's, can somebody afford to go to Trader Joe's? I looked at Trader Joe's the other day. It's super expensive. They're very nice, but super expensive. It's, if someone has $5 to eat, it's easier to go to McDonald's and get something processed, which is going to cause more harm than going buying a bag of apples, which if you're not a diabetic is not a bad thing to have. And so finding people who attack it from all different sides, preventative, dietary, education, pharmaceuticals, which I don't mean to demonize, but they patch a problem that we have to fix. So that is not just more primary care doctors, but primary care doctors who can take the time and who are educated as to fixing the underlying cause.
And at the beginning, what you just said is that the average physician can only see a patient for 15 minutes.
15 minutes.
For the doctors in the room, you all know about RVUs, relative value units. Adam, we were talking before about how do you create the value proposition and how do you work with the payers in order to adjust the system so that the doctor can get what should be properly redeemed, or how they should be redeemed properly, right?
Yes, we were. But let me answer that by stepping back a little bit, if I could, because I just want to build a little bit on what Amy was saying, and then I promise to answer your question.
No, that's fine.
Because I think what Amy was getting at is there are a number of, and what you're getting at is there are a number of fundamental issues. One is the whole pay structure. Another is shortage of primary care docs. But I'd even start with health literacy in general. And so, you know, it's easy for us to sit up here and say, hey, everyone should eat better, and everyone should exercise, and everyone should manage stress, and, you know, but how do we really do that? And it can be very confusing. I'm going to tell a story. My wife's in the audience, but I'm going to still tell a story about my father-in-law, who passed many years ago. At one point, you know, he was the classic smoked, and then he was told by his doctor, you got to quit smoking. He worked for Mack Truck his whole life and spray painted before he even wore masks, so he started developing some lung disease. So he committed to stopping smoking, and then, of course, put on the obligatory 40 to 50 pounds after he quit smoking. Again, this was 25 years ago. So he had a nutritionist through the VA, and he was trying to get more educated. But I remember I walk into the kitchen one day, and he was eating, I think, what were they called, Snackwells or whatever, those cookies that used to say low fat right across like the and the healthy cookie. And I remember I walk in and I go, and I knew, like we had just talked about, he was going to really try to eat better. And I go like, Dad, what are you doing? And he goes, what? This low fat. And I just took, like, they used to have one of those old-fashioned sugar jars, you know, in the kitchen. Like, old-fashioned, but we don't have as much. Right. We don't have one. And I went, he had one of those, and I went, Dad, there's no fat in that, but would you eat it? You know, and so health literacy needs to happen. We need more primary care physicians. But when it comes to the reimbursement model, I would say a couple of things. And this may be controversial. For a lot of what we need, I don't know that the physician is the right person to offer it. There's not enough of us, certainly when it relates to primary care. Quite frankly, we're too expensive. And we don't get educated on how to teach someone how to eat right, how to motivate someone to exercise, you know, other things. I mean, as you can hear, even looking at some of the social determinants of health, I mean, you get a lecture or two in medical school, but you're not really an expert. You don't really know how to intervene or even often, you know, implement or connect people to services that know what to do. So it can be very challenging. I think there is, within the diabetic world, certainly an opportunity. This is something I've been working on quite a bit lately for our company, where we have a probiotic that actually is approved and been studied in clinical trials to treat diabetes. So I've been working on this RVU model, and not RVU, excuse me, value kind of model for it.
Yeah.
And the reason I think there's an opportunity there now is because so many payers and self-insured entities are spending so much on the GLP-1 analog drugs, and they are desperate for solutions. And of course, and some of you may have diabetes management companies, some of you out in the audience, you know, I think they've been around for a while. I think they're very, very important and a piece of the puzzle. But I think there's an opportunity here to really push the concept of prevention and ideally keeping people off of these very expensive drugs. So I think that's one piece that really relates to the way we can look at the value proposition nowadays. And just a final comment is, I also think, building on what I was saying about the physician maybe not being the right individual, that we need someone else within the healthcare system who can offer this. From my perspective, I think it's a health and wellness coach. These are individuals who are trained in behavior change, trained in motivational interviewing, are typically not expensive, certainly compared to physicians or nurses or others, and are really more specifically trained to offer people guidance, to connect to what people's goals and motivations are, because often, simply just educating isn't enough. You need to understand what is behind, what really motivates someone. What's really going to motivate them? And it isn't necessarily to try to keep their hemoglobin A1C but below 6.4 or something like that. I mean, that isn't necessarily what's going to motivate them. It may be, I want to be around for my grandkids. It may be, I'd like to be able to walk with my spouse and not be short of breath. I mean, it may be, I don't want to die of a heart attack at 48 the way my dad did. There are ways that we can get at that through motivational interviewing, and this is what health coaches can do very well. Mm-hmm. A related piece to that is, I think one of the challenges there has been scalability, and that's where I think it's very interesting to see some companies that are integrating sort of digital coaching platforms, AI, as a way to make the approach more scalable and still have that same outcome.
That's great. So what I'm hearing you say is almost that by incorporating multidisciplinary teams, you can change the workflow so that the data gets captured by different people, and as long as the electronic records, can be connected, so you don't have silos of data, you can have everybody looking at the patient, and so the data is becoming more forward-looking about where you're going to be going, and that's where your social determinants of health become so important, because you have not just theory about what will happen to people. You actually have data that says, if your profile is this is what will happen to you. There's a woman I know formerly from the University of Michigan. She's an epidemiologist, and she studied through University of Michigan the 6 million people in Detroit and other areas, and she said we got it down to an absolute certainty in our advice to people. So I think your point is really well spoken about getting these disciplines together. And I think it does beg the question, ultimately, for all of us to ask I'm not sure I call it the medical community or the healthcare delivery system, to re-examine holistically the way primary care is administered so that we can hit triple aim type metrics. Now, one thing that's interesting is I'm consulting to a company in Australia called Ipsium, and they're in a prototype, and they're doing early clinical trials. They've taken allied health professionals and married them up with physicians to create, so they do like a health risk assessment to get a profile of the patient. And then the patient goes into these 10, 12-week programs to learn about their health. And then they develop a buddy system in these peer groups so that the AHP becomes the guide. And then from there, the teams learn how to hold each other accountable. Now, from a revenue perspective, what's fascinating is there's a referral system he's created so that the doctors who do this get paid more, because typically, as you may know, there's a 3-month waiting list for some of these care services. And by virtue of the way they leverage the allied health professional, they can triple, quadruple the number of people they can see, and they get paid on all of them. So it's sort of an interesting model that he's very early in it, and they're trying to bring it to the States, and we'll see how it goes. But so
can I just make one follow-up point?
Yeah.
Because I think you and I had discussed this. I'm now realizing the whole audience may not be aware of it. I mean, you might think that, don't all the insurance companies want to pay for prevention? Doesn't it make more sense to prevent the development of diabetes than have to treat it, and all the downstream costs of everything from cardiovascular disease to surgeries and the kind of risks that diabetes. And the answer, and I saw a couple of heads shaking no, the answer is no, and by and large. And the answer is no because, again, not in your world maybe so much, but in the typical world of a Blue Cross Blue Shield or United or Aetna or what have you, they're only keeping the average customer for 3 years.
Right.
So it doesn't behoove, and certainly doesn't behoove that CEO who may be worried about the next quarter, let alone 3 or 5 or really 10 or 20 years down the road, what the cost of that individual may be. It doesn't really behoove them to cover as much of the preventive approach today. And that's where I was going with this whole, until GLP-1. And then there's maybe an opportunity here within diabetes because they're spending millions upon millions of dollars. That's only projected to increase. 13% of the population at the moment is on a GLP-1 analog drug, and that's expected to continue to increase dramatically. And of course, the cost of those drugs. I think there is an opportunity here to look at that in a different model, in a different way.
Great, thank you. So I'm going to have one final question for the panel, and then we'll open it up for questions from you all. Great, thanks. If there's one point that you would like to leave for the group, each of you, what would be the one thing that you would say, okay, when I went to the Health 2.0, I went to that panel, and these are the 4 points that I got from it. What would you each think about?
For me, it comes down to it's simple, but it's not easy. If you can't pronounce it, don't eat it. If it has more than 5 ingredients, don't eat it. If you have to pull money out of your wallet knowing I'm going to be pulled out of the workforce if I don't fix my diabetes, I'm not going to be able to have sex and have babies because I'm going to be impotent. I'm going to have a stroke, I'm going to have a heart attack, and I won't see my kids grow up because that bag of chips is way too important to me than my kid. If I knew that I was going to have to make a choice between feeding my kid and taking my diabetes medicine, because there isn't somebody like Arcella to help me with those things, knowing that you don't have to spend $15,000 average out of your pocket for your diabetes medications every year, maybe that'll help you make the simple choice. So simple, but not easy. That's my take-home point.
That's terrific. How about you, Adam?
Well, I'll make a very focused point, which I think is whether you're a healthcare provider or, as most are in the audience, non-healthcare provider, you may not appreciate the impact that the microbiome has on overall health. I think it is the next great frontier of our understanding of human health. And I say that because it's an area that we actually can intervene as a healthcare provider or as an individual. Now, it's often through doing the things that Amy was just talking about, but maybe that's a takeaway for some of you that will be a new thought, that the science around the microbiome and how it's influencing everything from the development of diabetes to the development of Alzheimer's to various cancers is one of the next great frontiers of healthcare and something that's worth learning more about.
Great. How about you, Arcella?
I would say for all physicians out there and even people who are not physician, you probably heard the saying, don't judge a book by its cover. You got to look in the cover. That's where social determinants of health come from. That's where putting the whole person as the center, going back to patient-centered care. And don't think that just because you told them that they understand what you're saying. I think that we all have to look at people as individuals, not as a statistic. And that's what I have to say.
Terrific. And Biplab, how about you?
Okay, this is totally new, I believe. One thing, that's intestinal alkaline phosphatase deficiency, or IAPD. IAPD will govern the next century for chronic inflammation. For all those healthcare providers, that is the news. Thank you.
And so actually, to your point, it's not just about diabetes, it's about any chronic condition that develops from inflammation.
Yes.
Beautiful, okay. Well, I want to thank the panelists for your wonderful thoughts, and then I would kind of open up the floor to anybody who has a couple of questions. We've got probably 5 or 6 minutes left. Is that right? Okay.
12.
Well, it says 12, but he
Oh.
came over when it said 16 that we had 10. So. Yeah, go ahead. There's a microphone right here.
Just a quick question, Dr. Perlman. What's the name of the probiotic, or the can we?
Of course. So the name of the company is Pendulum Therapeutics.
Uh-huh.
And I'll give you the website to make it easy. It's pendulumlife.com. But the one I was referring to is called Pendulum Glucose Control.
Okay.
So that's what has the acromantia in it. We did a 2020 randomized control trial that looked at type 2 diabetics on metformin that showed improvements in hemoglobin A1C and glucose. And again, all through these mechanisms that I was only scratching the surface on.
Okay.
But, yeah.
So metformin is actually influencing the microbiome.
Metformin also has an influence on the microbiome. Actually, there was a study, I haven't even read the full paper yet, it just came out this week looking at the role, but we do know and do understand that part of the mechanism of metformin is an influence on the microbiome. But this was, just to be clear, the probiotic I'm just mentioning, this was people, type 2 diabetics on metformin who were suboptimally being, controlled. We added in these unique kind of next generation probiotic strains through this Pendulum Glucose Control product and saw significant improvements.
Thank you.
That's great. So, any other questions? Yep.
I have a question. We talked about the role of, let's say, the producers. We talked about microbiome, about Wegovy and so on. But what about the role for the government? I'm from Switzerland in Europe, and many countries in Europe have introduced a sugar tax in the previous years. And they have seen this has very good effects on even, let's say, incidence of obesity, overweight. It's good for dental aspects, but it's something for the government. So what do you think about this? Could this be done in the US also?
I'll make a quick comment, then I'm going to look this way, because this is, so if you look, and again, this is association, if you look in the US at incidence of obesity in the United States, there is a direct correlation with obesity rates were kind of going like this, and then it was right around 1980s. In 1980, you see this. And interestingly, it corresponds to the farm bill that subsidized corn and the introduction of high fructose corn syrup into the US market. I mean, it's amazing to see the way the curves parallel. So certainly in Europe and other countries, I think there's really interesting experience in sort of what we might say in the habit formation word, adding friction to eating unhealthily by either making it more expensive. Similar thing, too, is with cigarette smoking. So in the United States, what they did do is, and people may wonder about this, you ever wonder why when you go into a gas station, you have to ask the attendant to buy cigarettes? Hopefully none of you smoke, but if you did, you might say, well, that's because you have to be over 18 or whatever the age is. No, they have alcohol in the refrigerator. They just bring it up to the counter. The reason they did that from a public health perspective was to add friction, to make it just a little more difficult. So you had to go and ask someone to get it off a shelf and make it more difficult to then be a smoker. So certainly we've done some of that, but why don't I turn to any of my colleagues, maybe yourself, but if there's more. Thank you.
So I'm going to weigh in on this. What we try to do is have government help people here in the States and not deter them. So one of the things that we're doing in New York is we are deterring them. We have a ban on the vapes and the flavored vape, so you can't buy that in New York now. What they're doing now is, and this is one of the things that I can say that I actually helped do, is to stop with the sodas, selling those little cheap sodas at the store, at the deli, where they're $1. So there's no more sodas. So now you can have juice. There are some places that will still sell them, but it's really a ban on the sugary sodas. And we've actually lobbied the beverage community to reduce the soda. I know you may have seen where Coke Zero has 0 sugar and it tastes like the same Coke. So this is something that we do to lobby to get people to be healthier, because I will tell you, one of our old commissioners of health said, people don't know that they're not eating healthy unless you tell them.
And in regards to the corn, as you well know, in Europe, the crops are very different than the crops here. But also with the processed foods, in regards to corn, the number one user of corn in the United States is, people don't make corn muffins out of it. It's used to essentially for ultra-processed foods. In regards to the things that are killing livers, so non-alcoholic fatty liver disease, it's fructose and glucose. It's not fat, it's not alcohol, it's fructose. And when you look at corn and soy and the industrial solvents that make up our food, Diet Coke is, to me, it's even worse than Coke, because at least Coke is sugar. Okay, sugar is horrible, but now you're adding sugar alcohols to it, which directly affect liver processing. It affects the microbiome, all of those sort of artificial sweeteners and things. So if corn was just corn, no one would have a problem with it. But corn isn't just corn in the United States, unfortunately. It's corn syrup and corn starch and all the things that are, again, directly causing diabetes.
I mean, I would say you kind of emphasize the point that it really does. I mean, you went back to it kind of takes a village, your comment earlier, with the healthcare team. I mean, issues like what we're talking about, whether it's sort of the obesity/diabetes epidemic in this country, worldwide, et cetera, it does require the healthcare systems, the political systems, you know, to really come together to ultimately tackle the issue.
And I just want to piggyback on that and say that when we talk about corn and fructose, you have to understand that's economics. Mm-hmm. And you don't want to mess with economics. People make a lot of money on it. So when you want to have this battle, you have to pick your battle to fight. So one of the things we did was we said, let's take all sugars out of Coke Zero. Let's take all of it. We don't want any more of the artificial. Just have it natural flavor and see if people like it. And that's what they're doing now. So they're taking all the sugars out. Unfortunately, it's not selling that well, but I will say I can see a difference in people if they're on a diet. Instead of having that artificial sweetener, get a Coke Zero if you must have a Coke. Get a Coke Zero. Yeah, but it doesn't taste like anything. Yeah, but try it.
Thank you. We had one question, but I'm getting the hook. So why don't you come on up and we'll answer your question offline. And anyway, thank you all for listening, and thanks to the panel for great discussion. Thank you.
A big thank you to our experts. It's clear that the diabetes prevention isn't just an individual effort, it's a societal one. Now let's shift gears from health prevention to innovation in the healthcare leadership. The most groundbreaking ideas in healthcare don't happen in isolation. They required vision, investment, and flawless execution to bring them to life. But what does it take to turn an idea into a real, scalable innovation that impacts lives? In this thought-provoking keynote, leadership plus capital plus execution equals innovation. By our bronze sponsor, Justin Zenenko, the CEO and co-founder of Centrifuge, Inc., and a certified public accountant with extensive experience in corporate finance and entrepreneurship, will break down how the right combination of leadership, funding, and strategic execution can turn cutting-edge research into market-ready solutions that redefine the future of healthcare. Please give a big round of applause for Justin. Please welcome to the stage.
Good morning. Good morning. Am I being heard? Okay, perfect. Can't tell up here sometimes. So the power of leadership, capital, execution, and driving innovation in healthcare is something that I have a little bit of experience with Centrifuge. Before we get into that, though, I'm going to share a couple of other stories that kind of parallel a journey of innovation and kind of talk about how does this relate to eventually healthcare locally, the United States, and then globally. So we have leadership, capital, execution, and innovation. And these coming together is what gets us, the collaboration of all this coming together gets us to innovation. So raise your hand if you've ever been to a national park. Sure, quite a bit of us have been. Well, what's interesting about national parks is national parks came about because of the leadership of one man by the name of John Muir. John Muir was a naturalist, and in 1903 started this journey. In every walk with nature, one receives far more than he seeks. And in 1903, here he is with Teddy Roosevelt, and they are going through the landscape of Yosemite National Park. And here, Roosevelt is representing capital and execution. And here is John Muir leading Roosevelt through the lands of Yosemite National Park. And what's really cool about this story, which I didn't know about till about a week ago, is that these two together is what led to, in 1906, the protection of over 230 million acres in the United States, which millions of people around the United States, but globally, have been able to experience because of these two coming together. And to date, you'll see here, these are all of the areas where we have parks today, from the Grand Canyon to Yellowstone. And that all happened from a trip in 1903. So here we have leadership with John Muir, capital with Teddy Roosevelt, execution was the national parks, and the innovation is conservation for mankind, and that led to other national parks around the world. So now, to do one more story before we get into Centrifuge's story, we're going to go about leadership, capital, execution, and innovation for another one that started here in the United States and now is felt around the world. Does anybody know who these two brothers are? Does the animation help? Well, you might have guessed it. It's Walt and Roy Disney. These two brothers came together, Walt with the leadership, the businessman being Roy, who put the vision, the reality behind the vision of Walt to bring Disney to life. And here's Walt embodying leadership. If you can dream it, you can do it. Here's Roy representing the capital. And the execution in 1955, Disneyland came into existence. After years of persistence and setbacks, together they were able to bring Disneyland, which people from all over the globe get to experience today. But it didn't just stop there. Eventually, Walt wanted to expand and have a hotel that complemented the park. And that required creative financing, where they came up with a 99-year lease and an oil tycoon to back it. And then the Epcot Center was a vision that came about, and this is for Disney World. And what had to happen is Roy went in and formed all of these LLCs. These LLCs were the LLCs that bought up the land before land prices skyrocketed. And today, you can still see this today in the windows of Disney World. So today, you have Disney, a global powerhouse in animation and theme parks, that came together because of two brothers having the vision and the tenacity to go after a goal. And today we still feel Disney World. So then how does that lead to Centrifuge? With leadership, capital, execution, and innovation. Well, again, I went a little ahead of myself. Walt Disney was leadership, capital, Roy Disney, execution was animation and parks, and joy for mankind, where millions of people experience it today. So now, how does that lead into centrifuge? So who here knows what this is a picture of? Yep, back pain, low back pain. Well, the numbers are staggering. Over 90 million people in the United States suffer from low back pain. Over 1 million back surgeries occur per year, and millions of patients are prescribed opioids. So here's a picture of opioids, and one of the staggering figures is over 100,000 Americans die annually from opioid abuse. Half of those Americans suffer from low back pain or claim to be suffering from low back pain. And what's a very staggering figure is 1.5 trillion costs from opioid misuse just in the United States. So this is our story. Centrifuge began in 2018, and with our doctors here and spine surgeons, we came up with an innovative solution of addressing low back pain and leg pain for spinal fusion patients by bringing in stimulation to get them off of opioids and addressing the pain at the point of surgery, not years of suffering debilitating back pain. So it started off with the founder, Dr. Nazmi Payman, a pain physician who wanted to find a better way to treat back pain than just opioids. We had a neuroscientist in Dr. Greg Molnar, who's an expert in neurostimulation. Dr. Michael Park, a neurosurgeon from the University of Minnesota. Myself in finance. And then finally, we brought on Dr. Rohan Lal, who's our spine surgeon, who's here today, our chief medical officer. And by coming together, we formed a company, we formed an innovative solution to tackle back pain for spine fusion patients. So we started off in Minnesota, expanded then to Indiana, and we completed our 15-patient proof of concept study. And the states that you're seeing that are being filled out in green, those states are the states that are where we're going to be looking to expand our pivotal trial. And then once we have FDA approval, well, that did not. We had a map here that showed going to the globe, but that's okay. Patients, so what this is ultimately about is how do we get patients back to their lives? How do we get them so they get back living day to day? So what we have is we have an example of one of our patients, Jason, who's back to full-time construction. Before he had the surgery, Jason was disabled and was on opioids. At 6 months, he was back to full-time work and off of drugs. Here we have Sarah, who was a nurse and didn't want to go down the addictive path of opioids. And she, before the surgery, could not attend her son's Little League game. Now here she is with her family attending her son's Little League game. These are things that we take for granted if we're not dealing with chronic back pain. And then finally, here's Dawn enjoying a motorcycle ride. Before this, she could not even go out and be on a motorcycle, let alone walk. So now what we're going to do is we're going to hear a little bit from the patients themselves that made the news.
And while this is just the beginning, results from the device are looking promising.
In our 12 patients that we've done between Minnesota and Indiana, the device is able to help patients with decreased back and leg pain after surgery and at long-term time points as we get further out.
I was only on pain meds for 5 days following that big surgery. I was back to work and seeing patients at 6 weeks, back to my normal job.
Avoiding long-term pain meds also motivated Sarah's trial decision. Her medical background showed her the negative side of the opioid epidemic.
Being a nurse, I knew that I didn't want to start the narcotics and opioids.
Greiser believes this procedure could shine a new light for those suffering from chronic pain as it continues to reach new phases.
It just makes sense. Spinal fusions aren't new. Spinal stimulators aren't new. They've both been tested and have been found effective. But the great thing is that now they're doing them at the same time.
We're early on proving the concept, but the initial results are unmistakably good.
So to bring this to fruition to where we are to date was a $23 million of capital investment. And there will be more investment that will be required for the next phase. But what this is showing is in order for us to get to the execution of having patients, you have to have the capital with the leadership and the execution to actually improve patients' lives. So here for leadership, to recap, we have Centrifuge, $23 million of capital invested. The execution was 15 patients proof of concept study, which was just completed recently with the University of Minnesota and South Bend Orthopedics. And then finally, what is the main point of health and wellness? It's how do we improve the quality of life in patients? And that's what we seek to do every day at Centrifuge. And that's one of the things that when it comes to leadership and innovation, it's bringing together the things that are necessary to advance these therapies. Now, we have a little bit of time for questions, if anyone does have any questions. But if not, I want to thank the Health 2.0 Conference for having us and appreciate you guys having us here. Thank you.
Thank you so much for that presentation, Justin. It looks like it is time for a networking session. We are going to take a few minutes to exchange business cards with the people sitting at your table, and we will get right back to it in just a few minutes. All right, welcome back. I hope you enjoyed that networking break. Now, speaking of bringing ideas to life, what does it take to transform a healthcare startup from an idea into a thriving company? That's what our next panel is all about. Every groundbreaking healthcare innovation starts as just an idea, but turning that idea into a viable, scalable product, well, that's where the real challenge begins. Funding hurdles, regulatory roadblocks, and fierce competition make the startup journey one of the toughest in the industry. So how do founders navigate these challenges and successfully bring their innovations to market? In our next panel, from the idea to market, navigating the startup journey in healthcare and wellness, our leading experts will share firsthand experiences, key lessons, and strategies to further dissect this crucial topic. Joining us on this next discussion is our moderator, Jennifer Kane Berkmos, the co-founder of Viva Valet Inc., and the panelists. Please give them all a warm welcome to the stage.
Thank you so much for that beautiful warm welcome. We are absolutely thrilled to be here with you. I've got one question. Do we have Molly in the audience? And we don't. Okay, so again, thank you so much. Just as we just heard, many of you are sitting in the audience today, and maybe you've sparked an idea on the way to the conference, or maybe over the course of this week that we're here together, you may have an idea. And so we're here to unlock the absolute genius that's on this panel to speak about what happens when you go from that little idea at the breakfast table in the shower, and how do you make that into a company, and what are the key things and watch-outs that are along your journey, and how do we support you with how you're going to make that idea go from idea to life. So I have this extremely distinguished panel with me here today, and I'm so thrilled to introduce you to Krista Moon, who is the president of Ascend Business Growth, who is a partner of HubSpot, a CRM system. Welcome to Kristen. Give it up, everyone. I heard you talking, right? I'm also super thrilled to introduce you to Howard Lim, who is a business and brand architect and leader and CEO of How Creative. We've got Howard here. So we have another entrepreneur in the house. We have Jasmine Nelson, who is the CEO and founder of Umber by Jay Lene, who's right over here. Thank you for coming. And you've already had an introduction to Justin Zdenko, again, CEO and co-founder of Signer Fuse Incorporated. Well, welcome Justin back to the panel. All right, so I'm going to move this mic so I don't sit on it. That would be awkward. All right, so we're going to get started. We're so glad that you're all here. Thank you so much. So on this entrepreneur's journey, we may find that you have an idea, and then all of a sudden, going from that idea, how are you going to start, and what did you start? So Jasmine, I would love to start with you, if that's okay, to ask you about your cool idea. How did you create this or come up with this idea? And then once you had the idea, how did you start your company, and what is that company?
Sure. So how many of you know what PCOS is? Okay, I see y'all. So polycystic ovarian syndrome. So I have a symptom of that. It is called hirsutism. And that is where I could grow facial hair on my face and look like a guy. It could be real intense. So what happened was in my teenage years, I started developing a lot of facial hair, and at some point I did electrolysis and I did laser, and it just did not work out for me. Matter of fact, it stimulated more hair growth. So not to say it doesn't work, it just didn't work for me at the time. So what happened, I had a lot of time on my hands. I was a stay-at-home mom, so I took advantage of my time, and I started doing a lot of research. I started looking at holistic and Ayurvedic ways to reduce this hair naturally, and I came up with a product that is a natural, all-natural hair inhibitor for women like myself that have hirsutism. Now, I'm gonna be 100 with y'all. I was not trying to start no business. This was on accident. But what happened, I made my product for myself, and my sister also has hirsutism, and my mother and my grandmother, so I had them use my product, and they motivated me to start a business and help a lot of women around the world. Been in business for about 5 years now. Very successful. I'm happy about that. Again, that was a surprise to me, but thank you. And so that's how that started, on accident.
Wonderful. Thank you for giving us the introduction to that, Jasmine. And I know we're going to hear more about her journey about bringing that company to life along our panel. So Justin, I know you already gave a talk, but would you like to speak a little bit about what sparked your interest to go into pain management, company in pain management? Thanks, Justin.
Yeah, so I actually was looking at investing in a restaurant that ended up failing during COVID, and I did not do that, thank God. But when I was there, I met this pain physician who was talking about this problem with back pain and how there was that there was nothing really that could be done. What if we could do a surgery at the point of before these patients failed from their back fusions? And then that sparked the journey to, okay, can we actually do this? And what we found out was that back fusions have been around for decades, spinal stimulation has been around for decades, but never have the two been brought together. And the question was, why? Well, the reasoning that was given to me was it had to do with money. Well, in my background of finance and raising capital, and I asked how much to do a proof of concept study, and it was $1 million. And so I said, okay, let's do that. $23 million later, we're to this point. So as you can see, sometimes not always your plans work out the way you wanted to. However, when you see the end results with patients' lives being improved, it was worth every penny.
That's beautiful. Again, scratching your own itch, we say, right? I'm also an entrepreneur on this panel, and I'm going to speak very briefly about my own journey. And both like my two fellow entrepreneurs on the panel, I was also trying to solve a problem, or maybe what I call a wicked problem, in that I live thousands of miles away from my aging father, who's 88, and I know as he gets older and wishes to remain independent, I was having a very difficult time finding products and services and support to enable him to live at home independently and live safely at home independently. And so I actually have a co-founder, so I know that Justin's also a co-founder. I have a founder who's actually based in Malaysia, and she came to me and we were trying to solve the same problem, which is when we're living thousands of miles away from our elders, how do we really bring together a very fragmented market that provides non-medical services that enable elders to live at home. So our idea was, gosh, if dad or mom have a crisis, how are we going to solve that? And so we have a couple of different customers. Some of them are adult children, like many of us in this room. Some of them are elders themselves. So I was really trying to solve a very desperate, urgent problem that I had, just like my other fellow entrepreneurs on the panel. We'll hear a little bit more about that as we continue on our panel. So as you can hear, the three of us who are founders and co-founders have solved a problem that we have on our own. And on that journey, I know that none of us did it alone. We started companies boldly. We had a lot of help along the way. And each of us has now developed a brand that customers love. And it's really a delight to delight those customers. So this is the word brand, a brand that customers love. So many entrepreneurs fail to think about branding as a strategic, early thing that we do in the life cycle of building a company. So we're super excited that we have this brand expert. I mean, guys, he's like done branding for Disney. So like everybody pull up a chair and listen. Howard's gonna talk to us about what is a brand and why my entrepreneurs wanna do it early in their entrepreneurial process.
Sure. So, let me just show of hands if you think you know what branding is and if you could just shout it out. Are you, okay, you have your hand up.
I just see some fingers doing this, like little itty bitty baby jazz hands. I saw some hands over here. It's okay, you guys, you can share.
Do you want to go up to the mic and share a little bit? Yeah, yeah, sure. Let's just start with that.
For me, branding is like the message that you want to put out, that you want your product to represent. And so I guess for my brand, it's about forging your own path and own it. So when you think of your own pathway, it's like own it. So that's what brand means to me. It's like, what do you want people to know you by? So like Nike, do it. You see a sign, you're like, yep, that's Nike. So that's what brand is to me.
That's great. Good. That's very, very good. So yeah, a lot of people don't know. That's a great answer, by the way, and that's definitely part of what branding is. There's actually 37, I should say, ingredients, DNA ingredients to build a Fortune 500 company. That comes from my background. It's like representing Disney, Apple, HBO, Xerox, so forth and so on. The point being is that branding's for everybody. Here's the thing. Most people right now are branding without even knowing it. In fact, if you have a product or service right now or information that you're sharing, you're branding. Here's the question. Are you doing it successfully or not? Unfortunately, over 95% of companies are not branding in a way that's actually working for them. It's actually working against them. Okay? So there's three major components to branding. There's what's called the strategy. What is your positioning? So this is for you guys. I'm not here to talk about me. It's about you. So think about this and write this down. What do you feel is so unique about your product and service that's so distinct from everybody else? Let me just give you an example here. It may not always pertain to the health space, but nevertheless, it doesn't matter what industry you're in, it's applicable. So when FedEx came out, they had to distinguish themselves from the post office, right? The post office already had an image that and they still do, that they're not reliable and it takes forever to get your mail, and a lot of times it gets lost, correct? So FedEx decided that there's an opportunity to differentiate. So another element to branding is to differentiate. So what they decided to do is to create a system where they could deliver a package knowing that men and women, specifically businessmen and women, can get their package or letter overnight, especially when it comes to contracts, right? That they could get overnight guaranteed. So their core position was absolutely positively guaranteed overnight. By that itself, being that clear with their message, what you're talking about message, but it first has to start with the position, they got known very quickly of how they differentiate from everybody else. Now, why is it important more than ever before to be strategic and think of the strategy first about your position? Because there's more products and service out than ever before. The shelves are super crowded for everything. So I remember back in the 70s, we buy cereal, there might be 5 or 6 different brands. General Mills would be one of the bigger ones, right? Now you look all the different products out there around cereal in itself. And that's just one small category or segment within a bigger category, right? So the point being is this: you gotta first distinguish yourself, and you have to think about what is your positioning and how are you going to frame it. What she's referring to is your core message. What core message are you going to use to help speed up the acceleration of what makes you unique and different from everybody else? Colors, there's 2 parts. There's a part that is the tangible and intangible, but they all build up what's called brand equity. So the first part, like I mentioned, is the strategy, which is about positioning and framing who you are and coming up with your core message, which distinguishes you from all others. The other thing, another key component, is what are you going to promise people? And you got to be consistent with that promise, and you have to deliver on it. Let me just give you a quick example with Nike. So Nike, the reason why they came out with a tagline, "Just Do It," is because they realized that all the famous athletes, especially like, let's say, NBA or whatever it may be in sports, these athletes are wearing Nike shoes, and you have direct access to the same shoes. You have no excuse but to get off your butt and just do it. That's where that came from, okay? So, but in fact, Nike, Phil's, the gentleman that actually owns Nike, didn't even understand branding, and he didn't think it was necessary. But of course, after the first years of advertising his position, it rocket shipped his brand, okay? So just because you don't understand branding does not mean it's not important. In fact, if you talk to any big company, branding is going to be your most important asset you could own.
So
Okay.
Howard, I've got 2 questions for you on this. So as this is a conference around health, and many of us have ideas around starting up companies that are health related or wellness related, do you see that there's a difference in how a company would do branding in health or in the other industries that you've talked about, like in FedEx or Nike, sportswear, FMCG?
It's all the same. At least the motto I use is first, what is your position that's positioned you from all others in your industry, whether health, whether food and beverage, whether technology. The second component to this, okay, is what kind of identity you want to create that separates you from all the rest. Like Apple products, it's very distinct from all the other PC products that are out there, right? Okay, it's based on a philosophy which is minimalist design, okay? So it's actually timeless. It's actually brilliant what Steve Jobs had created. So no, it does not matter. The point being is like, how are you positioned, and then how are you reflecting that position with your identity, meaning like your website, the company name, the tagline, the colors that you're using. So here's the thing I see constantly. A lot of people, I don't know, I've helped out literally over 100,000 entrepreneurs the last 38 years. Here's the point being, it's the same thing I see over and over and over again. They tell me they have the best things in sliced bread, right? But I go to their website, they're telling me like an 8, 9, 10, 10 being best, but their website looks like a 3 or 4 at the best. Guess what kind of signal you're sending, right?
I have one other tiny question, which is because we're talking about startups. So again, maybe startup founders like ourselves don't have a lot of resources, or we never have time, right? Is this something that we should do at the beginning of our entrepreneurship journey, or is it something that we do later after we've raised our multiple millions?
What you want to do is you really want to start with branding first, because branding is about connecting. There's several components to this. The third part to this, by the way, besides the strategy, reflecting the identity, the third part and the most important component of this is it connecting to your target audience. You have to consider that at the very beginning, because what happens is that most companies, when they consider and they think branding is the same as marketing, and it's not. Branding is the long haul, looking at the foundation. Marketing is a totally essential, and that is the tactical to actually broadcast the brand, okay? So for startup companies, entrepreneurs, you really want to think about the brand at the very beginning, because what it will do, it'll cut through all the clutter and get you more known to all your stakeholders. And that means investors, by the way. And investors start to see that you're differentiating, and you actually show your prototype, how it differentiates, how it cuts through the clutter, because it's created as a brand, not as a product. It changes your relationship, quote unquote, to all your stakeholders.
Excellent. Thank you so much. So that's super edifying for all of us. Thank you. So we're talking about creating, from idea to startup, a brand that customers love. And as you heard, we love our customers. And we know that both Justin and Jasmine and myself, we've created brands that our customers love. And we love our customers, right, Krista? So one of the things we want to talk about is in loving our customers and understanding and listening to them and really demonstrating that, there's this thing called customer relationship management. Now, Krista is an expert in this, and otherwise known as CRM, if you're not familiar with the term. Krista, what is CRM? What is this thing?
Yeah, so I use this tool called HubSpot. So once you have your idea, and then you have a brand, which I'm 100% in alignment with Howard, that you need to do that first, because companies will call us in and say, oh, we want to get more customers. Oh, we need to let people know we're here. We need to increase awareness. Can you help us? Because that's what our agency does. We're a sales and marketing agency, and we help companies push the brand out. And so then the first thing I ask is like, okay, I need your brand guide. What is your positioning statement? What is your messaging? Because I can't do any marketing. I literally cannot do any sales or marketing unless I have the information, and they frequently don't. And so then we're struggling, and then nothing turns out as well as it could be if they would have had that at the beginning. But so we take your brand information, your identity, and we help you put that online in the way that Howard was saying. Create your website. I would work with a brand manager to create the logo, the graphics, the colors that align with your identity. And then we put them on the website. That's one step. On your social profiles, in your email newsletters, like make it all cohesive. And then the main thing, though, is you need a CRM, because the whole purpose of the whole reason we have a business is to connect with customers, to connect with people. And this is the lifeblood. This is the gold of your company. And I don't think a lot of startups realize how important this is. If you're trying to manage this on a spreadsheet, I'm going to list all my investors on a spreadsheet, and then I'm going to mark on a column the last time I contacted, if you ever do that. Or I'm just going to go into my email, and I'm going to say, when was the last time I contacted this investor that said 3 months ago to contact him because he might be interested in investing once I have X, Y, and Z in place. Like, trying to manage all that without a CRM is going to make you insane. And so we help you figure out, how do I take all these contacts, put them in a system, organize them, and then how do I follow up with them in a way that makes a lot of sense, that's very efficient, because as entrepreneurs and business owners and small sales and marketing teams, we don't have a lot of time. And so to try to dork around with many different technological tools like a WordPress, a MailChimp, your spreadsheet, your Google Analytics and all these things, then you're jumping all over. You have to learn all these tools. It's really difficult. So that's why a tool like HubSpot is so great, because it's a one tool that does everything, but then you need to learn how to use it, right? A tool is only a tool. That's just all it is a tool, but you have to learn how to use it. And that's where a team like us would come in to help you get set up, learn how to use it, and then manage it over time and as a fractional model. So as a startup and entrepreneur, you don't have money. You can't afford a full-time CRM administrator, full-time marketing, full-time VP of sales, and all these people. It's way too much. So a fractional team like us, we can come in and bring all the resources, and you can just hire us like on a quarter time or a half time. And you don't just get one person. It's so cool. You get like all the people you need for the price of one to help you get all this technological and then things set up to launch your brand. So I would just say in the wrap, if you don't have a CRM, or you have a CRM and you're not using it very well, to take a look at that in 2025 and how can you really streamline that, because it's going to help you get a lot more customers and a lot more relationships and awareness.
Yeah. So I want to say thank you. And again, at Viva Valet, we actually use HubSpot. And I will say that being a brand that customers love, where we have raving fans, some of the feedback that we get is when you pick up the phone, or when we pick up the phone, you know who we are, you know the history, you know me as a customer. And I think that's made us a huge differentiator in the market, because we are loved and we love our customers. This is how we demonstrate it, by having a really well-functioning CRM system. So we're grateful. And I want it, because CRM sounds expensive, and I know that Krista already mentioned that you have programs for entrepreneurs, but I know that you have sliding scale programs, I think, for entrepreneurs when you're starting up. Maybe you could speak to that.
Yeah, I think that's a really good thing to know as you're coming in. Like, how much is all this even going to cost? Because that's a big, big question, especially when you don't have a lot of money. So I just sold to I work with med tech devices, so I helped a med tech company. They had a $2 million seed. They hired me to come in. I set up their HubSpot, their whole website, did everything, their CRM, worked with their sales. And then 3 years later, they got a $25 million Series A. So that was really cool. But yeah, so that's amazing. But so when you have your phone at this conference, like I had a data person go out and look at all the speakers, for example. And then he got all their LinkedIns. I had my CRM specialist on my team import them into the database. And so now here at the conference, I have everybody's name in my phone, on my CRM. And so as I'm talking to different people, if you see me on my phone, I'm taking notes on their contact record that we were just talking and that I might want to follow up and what we did. So it's so helpful, even if you're small. Like HubSpot starts at a free level, and then they can tier up. So you could get into it for one person, like 100 or 150. But just if you're going to do all this, in terms of price, we're talking You want to do it right. You're going to want to have a team like us on a fractional level, $3,000 to $10,000 a month in services. Ongoing, is this what's going to get you the best? And then you're going to have your brand cost up front.
Thanks. I think that Howard wants to jump in.
Yeah. By the way, like you, I have a scaling service. 30% of my clients are pure startup, and many of them we've taken to IPO. But I have an offer for people that are in here, and those are only that are interested because I work with you one-on-one. I usually charge $2,500 to do a full assessment, your business, your brand assessment. And what I do is I look at your logo, I look at your website, I look at your business model, and we spend an hour and I record the whole thing on the internet using Zoom, and I'll tell you exactly what is missing and what to improve immediately to create a huge shift. So if you're interested, I actually have application forms. I only charge $500 if it's through this convention today versus $2,500. So if you're interested, I have an application. It's $500. And you can come see me.
I would totally do that.
So again, Howard Lim, we can find him at the bar or on the side afterwards. Fantastic.
Some whiskey.
Remember this space. He's got discounts for his fractional. So by the way, we're throwing around this term called fractional. It's a fancy word for part-time, just so you guys know. We're all on the same page. So we talked about seed. We heard these words like money, resources. So in order to start something, you got to have some money, right? And I know that both Justin and Jasmine have had very unusual and unique pathways to raising money, as have I and Viva Valet. So I would love to hear Jasmine speak about that, because I think you have a way to inspire people in the crowd for how they might raise money for their companies.
Well, I will say my way was a little bit different. I've been bootstrapping this business the entire time, except for recently, which was last year. I was a finalist on Bet on Black, and I won $50,000. So that was my first time getting anything different. Yes, thank you. Thank you. But for the most part, I really started off by flipping my birthday money. I just kept reinvesting back into the business. I think in general, when you are a startup or you just want to start something in general, it is really important to know how to manage your money, because I know a lot of people who are like making money from their businesses and they're just going off to buy clothes and just trying to look nice. But I'm like, no, you can't do that, because there's going to be times where you're going to need to hire somebody and you just can't afford it. So you might want to just lay off on your clothes and go to the thrift store. So, but in general, I would say like joining like a cohort or some kind of group to where they can manage and help you or assist you with growing your business. There's always funding that way. Of course, there's grants of, if you could figure out programs that actually fit your niche, that's a good way. I mean, there's a lot of pitching competitions. I personally don't do pitching competitions because that's just me, but people are really good at being able to tell their story in person. Y'all may not notice, but I am a little nervous up here. But for pitching people who are really out there, that is a really great idea. What are other ways? Oh, and I feel like the best way that I was able to get funding was telling my story. That is going on to the branding. Telling my story was the most important thing. I am a part of a different type of generation where I have been relying on social media, and now I'm trying to break from that, because how long is that really going to last? But telling the story and spreading the awareness of what you do in a way to where you can relate to your customers, I think that's number one. So
that's a beautiful thing. I would say that finding a way for the founder especially to tell the story, because each of us have talked about how we're connecting to a problem that we're trying to solve. I'm trying to solve something for adult children and for olders. So really staying connected to the passion you have for that vision really helps with funders. Justin, do you want to share a little bit of your journey? I think you talked about venture funds, right?
No venture funds. So we've raised over 23 million, close to 24 million now. So I was never able to convince venture funds or private equity to invest in any of the ideas that we had. So the way that I started out is I started out writing my own checks and then asking my friends and family to join me. And our first start was, can we get some IP? And that was kind of the little piece. And then it was all seed money, common stock. We just did a Series A of over $12 million, and we're going to finish another $4 million. But it's all been literally just going out and leading by example. And the way that I was raised from my family, which is just, it was made a lot of sense to me, was you can't ask someone to invest unless you're going to invest yourself and lead by example. Because if I'm going to put money up, it forces the other people who are going to put money or try to, what normally will happen is if I'm talking to somebody that has a lot more capital than I do, they will say, well, you need another $10 million and you need a discount year round. And I have millions of dollars already from over 100, 200 investors. So their money is just as good as my money. So therefore, you need to come on board or you're not going to participate. And eventually, by showing proof points, you get there. But we also have recently brought on broker-dealers. So this is the way people raised money back in the 80s and 70s. So basically, going to brokers, and the broker-dealer networks are very good too, because no one's going to invest in your company unless they believe in you as the CEO and want to join you. No one's going to try to usurp you, which you hear the horror stories of venture capitalists or more recently private equity. But we've just done it from simple common sense and then broadening the network, and as you get more and more milestones and proof points, then it makes sense. But we're not an investment for everybody, and that's fine too. And you have to be also willing to walk away if someone wants to take over your company.
Go ahead, Albert.
Yeah, so we helped out a lot of entrepreneurs from ground zero. And so you're exactly right. First thing I say is like, put together a one sheet, like an overview, exactly what problem you solve. And then you want to look at people that are specialists, that are experts, that don't do what you do. But the point being is this, that you want to look at if you have a product, you want to create a prototype. And now with 3D rendering and 3D models, it makes it so much more easier to create a prototype. I need to give you a real example. Optic Watch, they're a client of ours, and they're all over the world now, and it's over the course of like 7 years. They started from zero. And so the first thing that he invested his own money, right? And then he had run a business, so he created a business overview. And what we did that was different and distinct, instead of raising more capital from VC money, that we decided that we wanted to keep 100% of the company. So we created two different things. We created a franchise and licensing agreement. And a licensing agreement was done for overseas in other countries. And then for franchising, we did for the US market. And what that gave us was control over the company without giving it away. At the same time, we didn't have to raise as much money. But we did have to prove that the product worked. So Optic Wash, what it does is it washes your glasses. It's a kiosk, and it's the first in the world. And it washes your glasses, and it dries it, and it's very entertaining. We want to make it entertaining. By the way, you're going to have two ways to brand. Transactional, which is basically you're going to get beaten up in price. You got to think of yourself like Walmart, where it's based on bulk volume, or by experience. So let's say like Tiffany, right? Okay, so that's an experience. You have to choose one or the other. There's only one when it comes to price value versus quality-driven value. So we want to create an experience. The point being, too, is then looking at identifying all the different trade show events that are going to be, quote-unquote, a good fit for that product. And then when you go to the trade show, it wasn't about going to trade shows, it's actually having a booth that resonate with the people that you're looking for. In this case, we went to Spree, and we're looking for the 3 biggest mall owners in the world. We had 5 of them come by that said they wanted the product. So it's all about positioning your product, but showing that your product works is really, really important when you're talking about a product. And there's also a way of doing services. But I just want to tell you, there's different ways of raising money, of getting your product out there and still keeping control of your business.
And again, thank you for anchoring on the power of a brand, not only for really the selling and the marketing, but also for the raise, because a powerful brand is most likely to reflect the founder story, like the two of you have identified. I know the same with us in Viva Valet is that our founder story is one that many investors relate to. So I'm often looking, I'm on the other side of the table with a fellow adult child who has aging parents that they're trying to solve the caregiver problem for and to provide service for in their homes, or even digital solutions that are accessible for them. And so I know that having a really solid brand helps us in our fundraising round. So we spoke about, and I love the heterogeneity of how we're doing this, of how we're raising money about these very cool ideas that have become companies that customers love. So let's say Jasmine started with flipping the birthday money. I think we all need to remember that, right? Flipping the birthday money, family, friends, really, and also as quickly as you can get to monetization and to be sustaining. Self-sustaining is really the dream. Other mechanisms that we are using or other entrepreneurs are using, if you didn't get that TV spot like Jasmine did, for example, wink, wink, is that you can use grants. So many state and federal grants are available, especially in the health and wellness area. That's what this panel is all about. So if you are especially developing work around AI, digital health type of work, there's a lot of grants that are available, again, state and federal. And again, that's early seed money. It could be like $5,000 to do a proof of concept. So we're talking about, you spoke earlier about prototyping a concept or a product. Even if you're going to develop software as a service, that's also a medical device. So you can get a little bit of seed money to actually develop that as well. And again, those grants don't require you to pay the money back. So that's really nice for those of us who have ideas in the room and want to develop those concepts. And again, really high net worth individuals, or otherwise known as family offices. This is another mechanism that we're using, and I know other entrepreneurs are using. And I think to that, there's many women in the room who I'm sure are sparking ideas that want to start a company. What's very interesting with the world of family offices is many men who run those family offices are unfortunately leaving this earth. They're passing on, and they're often leaving the family office administration and management to their surviving wives. And so what we're seeing is a huge transformation in how family office money is being spent. So Justin, for example, said watch out for VCs and also private equity, because they're very strict with how they're actually arranging how they put their portfolios together. You have to fit into a very tight category. But if you're looking for something under $500,000 or less, a family office is actually far more forgiving. And they're also looking for something that's more purpose-driven. And ladies, we can all agree, right? Because very often if the women are leading this, they're actually reinvesting their portfolio into more purpose-based and often health-based businesses. So I think that's really encouraging for all of us who are thinking about that. I think you had another comment, Howard?
Based on what you're saying, she's right on the money, by the way. Purpose-driven is more important than ever before, because I don't want to break it down, but we have 4 generations that are buying power. And you have to talk to their psychographics right now versus demographic. But the point being is that when you have it purpose-driven, you got to think about another key component to branding, your philosophy. The philosophy is what gives you purpose. And she's actually right. And it doesn't have to do with money. It's like, what difference are you trying to make with your product? You get that? When those are the ones that when investors want to invest, they're investing in you and your purpose and the way that you're driven, based on what is your philosophy. Why are you doing why you're doing it? Okay? What are you doing and why are you doing it?
Thank you so much. Justin, you want to jump in?
Oh, the only other thing that I would add to everything you're saying is, if a lot of my investors, they want to know what is the exit strategy. And, what gives them a lot of faith in what we're doing is I'm the largest shareholder, largest investor in the company. And I've put myself purposely aligned with my investors. So therefore, I'm not going to do anything that's going to hurt me or put them at a disadvantage. And I think at the end of the day, investors want to know that you're not going to just, take the easiest way out or deal. They want a return on their money. And if you are purpose-driven, if you are aligned with your shareholders, it makes it for a very, it makes it for a purpose-filled journey that doesn't just end with a number. It ends with how are we going to get there and making sure everyone gets a return.
Fantastic. Go ahead.
I just wanted to jump in real quick, not on the money part, but Justin, you said you had 200 investors that you're trying to manage. These are a lot of contacts, okay? There's investors, there's money, there's communications. You have to give them information. You might newsletters. You might want to send them something once a month or once a quarter. A lot of things that you need a CRM for. Even if you are only at the investor stage, you can get it for free. It doesn't cost anything. I just don't want you guys to struggle with trying to manage all of these relationships.
Yeah, thank you. That's super helpful. Thank you for adding that, because I was thinking the same. Wow, how do you manage the 200? But again, this particular brand and other brands of CRM can really easily manage that for you. We're talking about culture, purpose, and of course, companies are run by people. We're founders here, and then there are people that help us run our businesses. So I wanted to speak to Justin and Jasmine about people as a driver of culture in the companies that we founded, and also where are you finding those people? We talk a lot about fractional or full-time folks. Where are great sources of talent that you're finding for your business?
It's definitely trial and error, because I've fired quite a bit of people. Like if you're in here and you're thinking about starting a business, really vet the people. I mean, when you're going through the interview process, people gonna fake it till they make it. So, I mean, I would give them like a 3-month trial, honestly. But in general, yeah, I find people on Fiverr. I find people through mutual contacts. I find people just talking to them out in public. I mean, there's a lot of ways, but it would be good to find someone who is able to adjust to all the changes that's going on today. For example, like I mentioned social media. I use Meta, and that changes all the time. So if you could find someone who could adjust to all the changes easily, that's one you should keep.
Say again. We've got 10 minutes left. We're gonna get to Justin, and then we're gonna go to questions. Oh, you have a suggestion? Okay. Do you want to go ahead and say that now? There's a microphone right here.
Yeah.
In the center.
So everyone can value from your questions.
Yeah.
Or
it's
your
right.
answers.
Okay. Speak very loud.
Get through it, it's still an interview. So you don't have to hire them. You pay them their stipend per day, and now you've done your first interview. Now you've done that. You see if they match your culture. They see if they can do what you need them to do, and then you don't have to worry about hiring the ones that don't know how.
I will be grabbing your card, sir.
Again, we'll meet you in the bar or right out here. Justin, you want to talk about talent?
Yeah, so my approach has always been through my own network, and if I get a reference or a referral from someone that I know and I trust. But in our industry, it's heavily regulated by the FDA, and we work specifically with spine surgeons. We start off with pain physicians, and spine surgeons are a unique individual who, are very talented, very good. But what it really comes down to is the chemistry and the trust with the people. And I have my chief medical officer who's here today, and he's in the room, Dr. Rohan Lal, who is a top spine surgeon at M Health Fairview. And it just so happened that we clicked on chemistry, because if you don't have chemistry, it's going to be a terrible experience through hell, because you have to be able to trust that person, you have to be able to rely on that person, and you have to have tough conversations, and it's not pretty stuff how the sausage gets made. But at the end of the day, if you have to see these people at nighttime and take them away from their families, you better have a good relationship and working relationship with them. Otherwise, it's not going to work, and before you know it, you'll have coups d'etats on you, which I've experienced multiple times. But the reality of it is eventually you get to the right people who believe in your vision, and together you make something really special. And that's worth going through the trial and error. And don't be afraid to fire quickly. And if people have a problem with it, that's their problem.
I think that's like a great mantra: hire slow, fire quickly. In some cases, hire fast and fire fast too. Right.
I've done both.
We've done both. So just thinking about what we do in Viva Valet is we have used 3 different platforms. We use Indeed, we use LinkedIn. That's our primary recruitment channel, which is very useful. And I think like many of us have had the problem where we get so many candidates, it's actually extra work and very difficult to sort through them. There's a relatively new, within the last quarter, platform that started called Mission Hires, which we've started using for recruitment. And I'm just going to fangirl over them for a second because we're doing current recruitment through them, because they will do scanning globally for your talent if it's a remote job, because many of us are actually hiring remote workers to support our companies. And they actually do the AI interview, and then they give you a video of them as well, and they score them. And Mission Hires is the name, and because they're very much looking for mission alignment. And again, we're all very passionate people about our businesses where we're solving our own problems. We want our people to solve our problems too and be committed to that mission. So they're really actually great at finding people with aligned missions. I really love that. Now, I realize I'm just going to do a time check. Is it 5 minutes? 5 minutes? All right. I am looking out in this audience, and I am so impressed, and I'm so grateful for your engagement. Like, you're all really paying attention, and I'm so grateful for that. And does anyone have a burning question for the panel that you'd like to ask in front of everyone, or you want to save it for the bar? I see a hand. Yes, please. Sir, can you go to the microphone here, please?
Hi, this is to Howard. You mentioned about branding services. So my company, we do a lot of services. So how would you brand a service? I'm sure branding a service is probably harder than branding products. So how would you brand a service as well?
Yeah, so branding service, product, or information is basically the same. It's, again, how are you positioning yourself uniquely? Can you tell me a little bit more about your service, what you plan to brand, or just get an idea of who you are?
So I'm what's now called, I'm an innovator to what's called psychology, and I'm working on, it's a form of mental health care that deals with a more spiritual side of helping people on a mental level, as well as through ailments as well. And so just trying to work with, trying to put that out there now to where people can take that approach as well as everything else that they're doing.
Great. Let me ask you real quickly, what is the #1 benefit of what you do versus what others do?
The #1 benefit is allowing someone to go within themselves to help themselves, to heal themselves.
Got it. So it allows them to go within deeper in themselves.
Right.
Okay. And then what would be a result of that?
The result would be self-healing and to be able to overcome their mental conditions.
Wow. See, that's cool. So what I just did was got to the heart of the matter. What is the result of what he's providing as a service? Did you guys hear that? It's pretty darn cool.
Like, we're a full-service panel here, right? Like, we are doing all the work for you.
That's cool.
Thank you for having the courage to ask the question. It was fantastic. Yeah. So I think we're coming to the end, and I want to encourage all of you to reach out to us in the program. You have our names. Please reach out to us on LinkedIn. I'm going to ask each of my panelists to end with 3 words that if only you remembered 3 words from each of us, what are those 3 words? Justin, can we start with you?
Well, that's good. Start with me.
Or anyone. I'm so sorry.
No,
I didn't mean to volunteer.
No, this is good. Right off the top of my head, it's vision, loyalty, and perseverance.
Can I say my 3 words and do like a quick description of that?
Does it have a dance? Because
No,
we'd love to have a dance.
I don't dance on here.
You
Anyway.
could sing it. Actually, sing it.
No, we're not doing that either. So I'm gonna take Nike's thing, just do it, because if you have an idea and you're just sitting on it, it's literally very easy to just start. Like, I wish I had this idea for like 15 years. I could have started this 15 years ago. Just do it. If you're sitting on it, just start it.
Oh, I would have to say 2 words, maximum potential.
I would say love your customers.
I'm going to square that, and I'm also going to say love your customers. We're so grateful for all of you coming today, and thank you to the panel. Everyone, fantastic contributions. Again, we are here. We're around. You can find us in the program if you want to link in with us. we are all part of this massive community to serve our customers and love them, right, in the health and wellness space. So we hope that this was of value to all of you, and thank you so much for your time.
Thank you. Thank you.
Thank you.
Well, thank you, panelists. That was an excellent discussion. If today's panel has shown us anything, it's that success in healthcare innovation isn't just about having a great idea. It's about persistence, adaptability, and knowing how to navigate the ever-changing landscape. Before we dive into our next session, let's take a moment to recognize the change makers who are already making a lasting impact in the healthcare world. Before we move forward, let's take a moment to thank our esteemed sponsors and their invaluable support. Now I would like to invite Dr. Andrea Sasha Ortez, Chief Mental Health Officer at Texas Integrative Healthcare, to the stage to present the certificates. Please join me in a warm round of applause. All right, we have an update. Our first award presenter is going to be Tandria Collins. She is an award winner at the Education Conference, and she has an exhibition hall with a booth with the company name Language and Literacy Academy for Learning, Inc. Please welcome her to the stage. Thank you for being with us. All right, I would like to call our silver sponsor, Justin Zenenko, CEO and co-founder, Centrifuge Inc., to the stage for your sponsorship award. Please welcome. Congratulations. And our bronze sponsors, Stefan Wall, pharmacist for Vital Well Topocathan. Congratulations. Our next bronze sponsor is Dr. Ronnie Costello, strategic advisor from Janine Global. Our next bronze sponsor is Dr. Goni Weiss, CEO and founder, Dr. Weiss Wellness PLLC. All right, a heartfelt thank you to our sponsors for your unwavering support. Now let's give a round of applause to our pioneers in their industry for their relentless dedication to transforming, and we will start with our awards next. I have quite the list, so I want to make sure that you get a moment to speak. If you accept award, just if you'd like to say something quick, feel free to, but be prepared for that if you are. All right, our first award is for Abe Reichen for Health 2.0 Conference Visionaries Award. Clinically trained in social work, Abraham is the owner and founder of the Trauma Academy Northwest LLC. He has successfully worked with children, families, and adults in various settings. He brings knowledge and experience to the training, consultation, and outpatient therapy programs. Congratulations, Abe. And some people aren't present, but we do want to make sure we acknowledge them as they might be watching from home via our video feed. All right, our next award winner is Dr. Adam Perlman, Health 2.0 Conference Excellence in Healthcare Award. Dr. Perlman is Chief Medical Officer at Petlum Therapeutics, a biotech company focused on the microbiome and its connection to health. Alongside, he is an internationally recognized expert in integrative and functional medicine. He has formerly served as the Director of Integrative Health and Well-Being at the Mayo Clinic in Florida. Congratulations. Yes. That one's probably not on.
I'll just say quickly. Page 89 in the book if you want to learn more about the company.
Our next award is for Dr. Ad Toro Ofrio for Health 2.0 Conference Excellence Healthcare Award. As Vice President and Chief Pharmacy Officer of Total Healthcare, Inc., Dr. Ofrio provides comprehensive leadership. Specifically, she oversees pharmacy operations, develops specialized clinical programs, and optimizes 340B compliance. Her expertise is built upon over 15 years of experience spanning independent retail, long-term care, and 340B program management.
Hello, everyone. I just want to say thank you. Thank you for the recognition. It's truly an honor on behalf of myself and my organization, which is Total Healthcare, a federally qualified health center that's located in Baltimore. Thank you once again for the recognition.
Our next award winner is Andrew Pakistan for Health 2.0 Conference Excellence in Healthcare Award. As coup of all care provider, Andrew combines his engineering foundation and business expertise to create holistic care at home. His journey into healthcare leadership was inspired by firsthand experience with care at home. Known for his empathetic approach, Andrew creates an environment where every team member and patient becomes family.
I'd like to thank Conference Health 2.0 for giving me this recognition as far as all care provider. I was very proud to be up here. So thank you so much.
Our next award is for Christy Hogue, Health 2.0 Conference Excellence in Healthcare Award. Dentist and founder at the Mouth Mirrors LLC, Dr. Hogue is also an author, researcher, and the host of an educational podcast, Aging Pearls. Under her leadership, her team of experts provides education and consulting to bridge the gap between different knowledge bases, which assists in treating the whole patient. Congratulations, Christy. Our next award winner is Devaki Thalvarjah, Health 2.0 Conference Visionaries Award. Data transference as independent volunteer, Devaki has almost 10 years experience in clinical trial transparency and disclosure. At Independent Volunteer, she oversees the delivery of high-quality open access content and chairing events. Additionally, she was appointed to the leadership role in 2022 at Fuse.
Hi guys, I just want to say thank you for the recognition. It's really a pleasure to be here with you and inspired by just everyone in the audience. Thank you so much.
Our next award is for Aswar Alar, Health 2.0 Conference Outstanding Organization Award. Akium is revolutionizing therapeutics with Yachty ML Squared, the world's first AI-driven trillion protein screening platform. By unlocking undruggable targets where antibodies and small molecules fail, Akium pioneers next-generation protein therapeutics for cancer, immune disorders, and beyond. We have Eswar, the co-founder and CEO, to receive the award on behalf of this organization. Our next award is for Evangeline May Bauer, Health 2.0 Excellence in Healthcare Award. Evangeline, MSW, LCSW, registered play therapist supervisor and certified autism specialist, is the CEO, founder, and owner of ComePlay STL. She holds a bachelor's degree in social work from Concordia University in Chicago and a master's degree in social work from Dominican University.
I just want to say thank you for the recognition, as well as thank you to our patients who trust us day in and day out, and for my team that executes with precision. I'm so thankful.
Our next award is for Dr. Ezekiel Nelson, Health 2.0 Conference Excellence in Healthcare Award. Dr. Nelson is a metaphysician and certified body worker at Heavenly Healing. Dr. Nelson has over 11 years of schooling and training in holistic and spiritual care as a metaphysical minister with a master's degree in holistic health. Dr. Nelson is equipped to provide comprehensive support.
Hey, everybody. Thank you. Just want to say thank you for this Health 2.0 conference, for this opportunity and this recognition. Just a little nervous, but I'm grateful and thankful.
Our next award is for Fatima Golsarat Palavina. Congratulations. Okay. Our next award winner is for Garai Udanawalker for Health 2.0 Conference Excellence in Healthcare Award. Garai is the Senior Vice President of Operations at Daybreak Health. In this role, she leads all post-revenue operational and clinical teams grouped under diverse areas. Garu has led multiple operations teams through periods of intense growth and change in her roles, first as a clinician founder and then as a senior operational role. Congratulations, Garu. Our next award winner is Jasmine Nelson for Health 2.0 Outstanding Organization Award. Umber by J. Lena is a beauty and wellness brand that provides natural solutions for excessive hair growth, ingrown hairs, and dark spots. This popular brand offers plant-based products as an affordable alternative to laser and electrolysis. We have Jasmine, the CEO, to receive her award on behalf of the organization.
Thank you, Health 2.0, for recognizing me. This really made my day. And also, you guys, thanks for being so supportive and engaging in the panel. That really lightened the mood for me. So thank you, thank you, thank you.
Our next award is for Jill Weiderman West, Health 2.0 Excellence in Healthcare Award. Jill M.A. is the CEO of People Incorporated Mental Health Services. Her professional background and experience include healthcare operations, management, and service development. Before joining People Incorporated, she was the Chief Operating Officer at Halsden Betty Ford Foundation. Congratulations.
I want to thank Health 2.0 for this recognition and for continuing to foster these important conversations that get us closer to health equity and sustainability. Thanks.
Our next award is for Leila Mokros Sissis. CEO at Leila Maroka Sissis LLC. Leila Maroka Sissis is a transformational coach, award-winning journalist, and breast cancer survivor. She founded Whole Soul Happiness and the Like-Minded Ladies Network, supporting women in business. Her podcast, Breast Cancer Unleashed, tackles all aspects of the breast cancer journey.
I just want to say thank you for this recognition. I am so honored and humbled to be around all of you. I'm kind of going like, why am I here? But I have a lot of information that we're going to take back to New Orleans. We are woefully behind in healthcare. And happy Mardi Gras, y'all.
Our next award is for Ms. Maria Burke, Health 2.0 Conference Excellence in Healthcare Award. Maria Burke, RN, owns Celtic Angels Home Health Care. She has earned her nursing degree from LeBurn College in Milton, Massachusetts. Under her leadership, her staff provides diverse services, including skilled nursing, homemaking, and many other in-home healthcare services. Congratulations.
I just would like to say thank you to Health 2.0, and truly it's such a privilege and an honor to be here amongst all of you. And also a big shout out to my team at Celtic Angels, who takes care of all our patients every day through crazy times. Thank you.
Our next award is for Dr. Mary Joyce Maleba for Health 2.0 Conference Excellence in Healthcare Award. CEO of Joy Skin Products, Dr. Maleba is a physician in the Philippines who has her training in aesthetic dermatology. She is certified to practice medical laser aesthetics in all provinces in Canada. Combining Western and Eastern medicine, Dr. Joyce is now working towards becoming a licensed naturopathic medical doctor in North America.
It's an incredible honor for me to receive this Excellence in Healthcare Award from the Health 2.0 Conference. Thank you.
Our next award winner is Mirko Colombo, Health 2.0 Conference Outstanding Organization Award. Colombo Personal Health Coaching is an innovative center specializing in preventative health coaching. The center offers an integrated personal approach to wellness and weight loss. Utilizing the Colombo method, the center aims to re-educate clients on daily habits. On behalf of this organization, we have Mirko, the founder, to receive the award.
Thank you very much. I'm very happy and I'm very happy and proud to receive this award. This award is the start for me to bring in the Colombo method in the United States. Thank you very much.
Our next award is for Molly Woodhull for Health 2.0 Conference Excellence in Healthcare Award. Molly is the founder and CEO of Woodhull Wellness. Leveraging her expertise, Molly partners with customers globally to solve all employee wellness needs for commercial, healthcare, education, government, and nonprofit organizations. Molly received a Bachelor's of Science from the University of Denver.
Thank you so much for this award. Hello, everyone. I'm honored to be here. You know, at Woodhull Wellness, we really strive to support the mental health and well-being of people in organizations globally, and we've gotten to do that, so thank you for this.
Our next award is for Molly McElwee Malloy for Health 2.0 Excellence in Healthcare Award. Molly RN CDCES is the VP of Metabolic Health for Locus, where she overlooks the integration of diabetes and metabolic health for the EMR. Before this, she was the senior MSL for Tandem Diabetes Care and clinical outcome manager for behavioral sciences. Our next award is for Nadij Pater, Health 2.0 Conference Excellence in Healthcare Award. Nadij is the founder and president of Hopeful Minds and Counseling Services Corp. to help clients who have experienced trauma and supervise other clinicians. Nadij is pursuing a doctorate in counselor education and supervision, focusing on trauma care. Nadij's academic background includes international studies and clinical mental health counseling degrees. Our next award is for Dr. Peter James, Health 2.0 Excellence in Healthcare Award. Dr. Sebiger, a business owner of Cognitive Performance and Health, holds dual PhDs in biochemistry and molecular biology and an MD. He and his wife, Veronica Sebiger, an RN and BSN and board-certified neurotherapist, established their private practice in 2012 to offer direct primary care with a specialized focus on the mind and the body.
It's just important to know that there are really dramatic ways of helping people to provide durable remission, and we are all striving for that, so thank you.
The next award is for Dr. Quang Uni Tran for Health 2.0 Conference Excellence in Healthcare Award. Dr. Tran is the CEO and owner of Perspective Physical Therapy. Dr. Tran is a passionate about innovation and individualized care and seamlessly blends cutting-edge methods with compassion to empower patients. Leveraging his expertise, Dr. Tran aims to change the rehabilitation landscape.
Hi, y'all. I'm just really grateful to be here for the 2.0 conference to putting on. All of y'all for being in this room. I don't know any of y'all, but y'all are here. And I think everyone can agree that, like, you don't do this alone. So I just want to thank God, number one. He's everything I do through him. My parents for instilling the hard work and giving me the opportunities to get where I'm at. And then my beautiful wife there, I wouldn't be here without her. Thank you.
The next award is for Robert Andoska, Dr. Robert Andoska. Congratulations. The next award is for Ryan Zolmut for Health 2.0 Conference Excellence in Healthcare Award. Ryan is the co-founder of True Point Healthcare, who pioneered grassroots healthcare initiatives in the post-acute sector before excelling in military healthcare. With a national footprint, Ryan recognizes in launching startups, driving financial turnarounds, and implementing value-based care approaches. Congratulations, Ryan. The next award is for Yves Ducat, Health 2.0 Conference Visionaries Award. Congratulations.
Yeah, I just want to thank everybody here in the organization, but I want to dedicate this to all the silent workers, the silent heroes who help us achieving all these breakthroughs. Thank you.
That's yours. Our next award is for Gabriel N. DeKong for Health 2.0 Conference Excellence in Healthcare Award. Congratulations, Gabriel. Our next award winner is Brian Lindquist for Health 2.0 Excellence in Healthcare Award. Congratulations, Brian. All right, a huge congratulations to all our honorees. Your passion, dedication, and innovation inspire all of us to push boundaries and to rethink what's possible in healthcare. Thank you to our presenter as well. And great ideas do happen over coffee, shared meals, and unexpected conversations. Take this time to refuel, meet fellow attendees, and explore new connections that could lead to future collaborations. Make sure to visit the 2.0 Conference's exhibit booth to discover upcoming events in 25 and 26, including editions in Dubai, Singapore, and the USA. Please meet with Japtine, our representative, to book your place at our next future events. Seize this chance to stay ahead of the curve. We'll be back at 1:30 for more engaging sessions, and until then, enjoy your lunch. welcome back. Did you guys enjoy your lunch and conversation? Yeah, good. Well, I hope you were all fueled up and ready to pivot to our next keynote, Revolutionizing Mental Health, Regenerative Healing with Phototherapy and Stem Cell Nanotechnology. The future of mental health treatment is unfolding now, with phototherapy and stem cell nanotechnology pushing the boundaries of neuroscience. What once seemed impossible, cellular repair, targeted healing, and even reversing neurological damage is coming to life. Our next keynote speaker and bronze sponsor, Dr. Goni Weiss, board-certified psychiatrist and diplomat of the American Board of Psychiatry and Neurology with 20-plus years of experience, and the CEO and founder of Dr. Weiss Wellness PLLC, is at the forefront of this revolution. So without further ado, please welcome Dr. Goni Weiss to the stage.
Thank you so much for the warm welcome and introduction. Thank you to the Health Conference. Thank you to my team, Christy Dada and Genevieve. And thank you all attendees for being here. I hope you enjoy the next half an hour. We're going to go through a lot of fun information. I hope you find it helpful. And we also have a booth set up, so if there's any questions after, if you want to meet, we're right next door. All right, so let's get started. Are you guys good after lunch with the energy? All right, so, okay, just a little disclaimer. This presentation is for educational purposes only, not used to cure, treat, or diagnose, and always consult with your doctor. If I'm your doctor, you can consult with me, but safety first, anyhow. A little bit about my practice. It is a holistic, integrative, regenerative psychiatry practice. We complete evaluations with genetic testing, scales, self-reports, and really go for a holistic approach, not a medication-focused approach. And hopefully have many happy patients. We treat ADHD, anxiety, burnout, depression, poor self-esteem, PTSD, stress, and overwhelm. And here are the services we provide. So a little bit about me. The first 6 years of my life, I lived on Freud Street. So that was kind of the first sign that perhaps becoming a psychiatrist was one of my callings. At age 6, we moved to the States. It was a bit of a culture shock, a little bit of a hard adjustment, but love it now. Along my journey, it was at times, tough adjusting and experienced some hardships. I was always interested in what factors help a person overcome adversity, what makes people more resilient than others. And of course, I've always loved the brain, the mind, the body. And so I made my way to medical school and was trying to decide between pediatrics because I love kids and psychiatry because of the love of brain and behavior. But during my psychiatry rotation, when I interviewed patients, I just felt like and knew in my whole mind, body, soul that this is, what I'm meant to do, and this is fulfilling, and this is how I can actually make a difference. So in 2011, I'll go a little faster. I was introduced to an energy healer. Her name was Pamela. She helped me through another, life learning chapter. But she really opened my eyes to epigenetics, neuroplasticity, quantum physics, and all the great aspects of healing that are not taught in medical school, and that actually give hope to patients that whatever you are struggling with now need not be chronic. We have neuroplasticity. We have epigenetics, which is just the importance of the environment impacting gene expression and proteins and our neurotransmitters. So that was huge game changers. And ever since I've been obsessed or passionate about anything mental health, longevity, the blue zones, and and the slide didn't go. Oh, this is a clicker. Huh? Oop. It was on the slide. It's going a little slow. Okay, so yes. What's that? Okay, perfect. All right. So being passionate about health, and every day with a mission of finding better and better treatment for my patients, I was just overjoyed and moved when I was introduced to the stem cell nanotechnology that I will be sharing with you very shortly, that I hope you love as much as I do. So a little bit about the objectives. Basically, the healthcare system, mental health, we need a revolution. There's a stress epidemic, mental health crisis are at an all-time high. And I will share with you a shift in perspective from traditional treatment approaches and mainstream biology to electromagnetic biology, which is where healing really occurs. And I hope you find it interesting. So, why do we need a transformation in the way we do medicine? There has been, and again, there has been a shocking and upsetting rise in mental health disorders. In 2019, 1 in 8 people globally were living with mental illness. That's 970 million individuals. The most common disorders, anxiety and depression. So it's a lot of people. In 2022, 1 in 5 US adults experience mental illness. That's almost 60 million people and more than 20% of our adult population. So, not good numbers and too many suffering. Our current treatments are, unless you are holistic or multidisciplinary in your approach, the medications are, from my perspective, prescribed way too much. They lead to way too many side effects and way too many problems. So the stress epidemic, the World Health Organization has called stress a health epidemic of the 21st century, with stress, as you know, having awful detrimental effects on health. 74% of people in the past year have been so overwhelmed that they have admitted to being unable to cope. So 3 out of 4 people. We are here to make this number better, reduce stress, because as we know, stress, chronic stress leads to inflammation, leads to disease. So, must change our ways, unless, we're thinking out of the box. So quickly, the top 5 chronic stressors, stressful events, COVID obviously being the most recent, stressful jobs, the workplace environment has to change. I get so many patients asking me to write them letters for leaves of absences because their work is just too demanding. So we need to go into those workplaces and tell them, if you want to succeed, you must treat your patients well, your employees. Number 3, financial concerns, the political climate, and electromagnetic fields all contribute to stress, inflammation, disease. So, obviously, the chronic stress affects mental health, physical health, sleep, nutrition, concentration. We know this. And here's a nice little illustration showing the progression from stress to disease to inflammation. I won't go into this as much, but we will be providing a webinar that goes much more into the chemical reactions and the biochemistry. But today is kind of an introduction to how we can revolutionize mental health treatment. So why is the traditional approach not good? So mainstream biology bases its treatment parameters off of a false assumption. So what is that false assumption? The false assumption is that a reaction or influence can only occur by physical contact. It fails to recognize that, first of all, the body is an electromagnetic field, and that healing can be done at a distance. It takes into account magnetism and electricity. And this is huge because of stem cell technology that I'm sharing with you in just a tad is based off of this principle, the electromagnetic biology principle, rather than mainstream biology. Okay, so here's a nice picture showing how we are electromagnetic beings. And again, I go into more detail in the webinar. Dr. Deepak Chopra said one thing modern medicine got wrong is the human body. He also follows the electromagnetic biology principles. A wise man, Albert Einstein. He was also with electromagnetic biology and said everything is energy. So, everything, which is really energizing. Our thoughts and feelings affect our energy. So our thoughts, let's say our self-thoughts, which become our core self-beliefs, which are, okay, I'm going fast. Yeah, which become our kind of boss in our subconscious, and put there, from age 0 to 7, they really ultimately determine how energetic we are. So if as a child you are told you are a bad person, that becomes your core self-belief. The feeling is sad and energy low. So it's kind of a CBT model. So well-known holistic practices, we all know meditation calms the mind. How many of you meditate? All right, got a healthy crowd. And we know that a mindset of gratitude it helps. Knowing one matters is important. And when I first learned that, we are made up of atoms, and atoms make up matter, I said, oh, then I matter. So we all matter. And what's that? So, yay. We all, yes, every one of us matters. Every one of us has a unique purpose. And lastly, for mindset, there's a beautiful book called Kindness Matters, The Rabbit Effect, which just shows how important being kind is in spreading kindness and helping health, to have a healthier world. So other things, quickly, you guys know this: yoga, gluten-free diet, olive oil, 10,000 IUs of vitamin D with K3 a day. There's a huge vitamin D deficiency, especially if you're in the Northeast. I don't know where people are coming from, but vitamin D with K is huge in impacting energy. And positive environment, that goes with epigenetics. We're all positive people here. So we have a better prognosis of being happy, be out in nature, and all that. Okay, I just want to mention two things. Have you heard of The Body Keeps Score? Yes. Yes, so tremendous book, tremendous work by the doctor. Here he is. He also follows electromagnetic biology. We all know, if you've read the book, you know kind of the effects of trauma. If you haven't, highly recommend it. Highly recommend The Body Code by Dr. Bradley Nelson. He uses incredible energy healing techniques to remove trauma from the body, find misalignments. Yeah, it really beautiful, beautiful treatment. And now we have the X39. And how long do I have? 5 minutes or so? 4. Oh, okay. So X39, has anyone heard of X39? All right, and you love it. Okay, so stem cell nanotechnology, invented by genius David Schmidt, who was asked to make, help the Navy SEALs get off their high doses of stimulants, anxiolytics, help them with all the trauma that they were going through in Afghanistan. And he geniusly created this patch. So this patch, I have it, it is a circle Band-Aid patch. It is made of organic adhesive. In the middle, it's 4 centimeters. In the middle, you see the white, is a proprietary blend, so secret to us, of amino acids, salts, and or sugars embedded in a crystal lattice that act as a mirror to the infrared light that we emit, and it reflects it back into the body and works magic. And I think I only have 2 minutes. I was going to show you this beautiful video, but I'll have everything at the booth, so please come. And this is not forwarding. Yeah. So the stem cell patches, they use phototherapy and our body's own innate healing mechanisms to activate stem cells, turn on genes, 4,092 genes, reduce inflammation, help with mental clarity, stamina, incredible with depression, because depressed, low energy, and it's all inflammatory. So it helps not only with depression, anxiety, with every disease state because it's anti-inflammatory, antioxidant, regenerates stem cells that were dormant. And I just want to show one more slide, and then I'm out of here. That's David. That's the Navy SEALs. Patents, 150 patents. There are 11 patches in total. I'd love to share them all with you. The 49 works slightly differently than 39. It works to activate mitochondria to make ATP, whereas the X39 works to increase the tripeptide GHK copper, which is associated with anti-aging. So there's beautiful patches. More time to, oh, here's a few patches. David, the other David. Michael, Serena, she's so strong. This is what I would say. I want to, another time I can talk about stem cells, differentiation. Oop, and it's going very fast. But the one before just said some stem cells decline with age. But, is that, oh, here we are. Okay, so look at how much they deteriorate. This is going on auto. Okay. So this is just an incredible holistic aid that is just what I have been hoping for in my years of practice. There are many studies, research trials, double-blind, that all show how the X39, which is a stem cell activation patch, increases the GHK copper levels, improvements in depression, anxiety, wound healing, even used with autism. It has kids going from nonverbal to verbal. So just tremendous. It is preventive. And so it's FDA recognized, not FDA approved, but it feels like science fiction, but it's real. It's science nonfiction. It is real. And when I was first introduced to the patches and first tried it, and I was like, is this placebo? Like, what is going on? I felt more mental clarity, energy. You know, we get a little burnout in this field, but I was just feeling energized and so energized and so happy. And that's our time, and I'll be right next door, so I hope to meet all of you, and thank you so much for coming here today, and have an amazing time.
Excellent. And again, she does have a booth out front, so if you have any questions, you'll be able to find her. So mind-blowing stuff there. Thank you so much for that presentation. Now let's build on this momentum and talk about how we can personalize mental health care beyond standard diagnosis. For decades, mental health treatment has largely relied on the Diagnostic and Statistical Manual of Mental Disorders, DSM, a standardized guide that classifies and diagnoses mental health conditions. While the DSM has been foundational in the field, it adheres to a one-size-fits-all model, which often overlooks the unique variances in individual mental health. In our next panel, Beyond the DSM, the movement towards personalized mental health care, panelists will explore the shift toward more customized approaches. This discussion will cover the emergence of tailored treatments, genetic-based therapies, and AI-driven diagnostics that prioritize personal experiences over traditional textbook definitions, marking a significant evolution in the mental health care. To explore this paradigm shift, let's welcome our expert and panelists and moderator Mahesh Natran, CEO of Heal.mx. Welcome them to the stage.
Can I ask you a favor? Can you ask people to get in here? We all live off the DSM like a matrix, so this room is empty. That makes no sense. Would like one person from each table ask somebody to come in here? Or no? No? Okay. No? Okay.
Oh, okay, that's better. All right, thank you for that. And thank you for the introduction. And also, can we give a big round of applause to the Health 2.0 team for making this happen? Thank you so much. This has been incredible. It's only day one, half of day one. Hopefully you guys are all fed, doing good. So we're going to start this off by asking everyone a simple question. Look around you for a moment. Just take a moment, maybe a few, just look around. And I know there are empty chairs in here, but recognize that every fifth person or every fifth missing chair over there has been diagnosed with a mental health disorder. And this is real. This is affecting us on the daily. This is affecting every one of us, regardless of what end of the spectrum we're on. And so in that line, we are here to talk a little bit about what the diagnosis is in terms of the DSM, or the Diagnostic and Statistical Manual. And I'd like also all of you to give a big round of applause to our panelists, our esteemed panelists who've flown all the way from everywhere. Thank you, guys. And much like all the other panelists, or all the other panels that I've heard speak, we're also a diverse group of people here. We have licensed clinical social workers, we got autism service providers, professional counselors and therapists, psychologists, healthcare operators, and so much more, just in the five of us. I'm the outlier. I'm a hardware engineer, and I come in here from a different way through purpose, and we'll talk about that. But before me, I'd love to pass on the microphone to everyone here on the panel and just introduce yourself. And in doing that, I would really like for you all to at least give us a little bit of insight into what your purpose is, what drives you into what it is that you're doing, and what brings you to the conference as well. Do you want to start over there, Dier?
Okay, hello everyone. My name is Dier Dikaha, and I am a licensed clinician and the owner of 7P Healthcare Services Incorporated and 7P Consulting. So 7P stands for Proper Prior Preparation, Prevents Piteous Poor Performance. The more that you're properly prepared in anything in life, it will help the outcome for being pissed or poor, okay? Everyone has a mental disorder, or every fifth person. I have a mental disorder, I'm OCD. But instead of crying over it and being boo-hoo, I use my mental disorder to my advantage. And I had to teach this to other people. So 7P Healthcare does mental health, wraparound case management. We work with substance abuse. We have a Suboxone clinic. We're in Ohio, DC, Maryland, and North Carolina currently. And I would love to team with anyone in this room in other states that we're not in, and I could teach you how we can bring the same concept to that state. But I'm a caseworker that turned therapist. I went to school 10 years after as a caseworker. Why? because the clients were telling me all their information. I was getting all the tea before the therapist was. They was talking to me more than they was talking to the therapist. So 10 years later, I decided to go to school and get my master's to become a licensed therapist. But what does license mean? License means insurance company. So we're going to talk about the DSM and why the DSM is here because of licensure for billing purposes. But when you get down to the grit of what someone's problem is, it's because you have a relationship, you have an understanding. So 7P doesn't worry about the schematics or the problem. We're focused based on the strengths. We know everybody got something going wrong, but what do you have going good? What are the positive? What are the strengths base that we can pull from to get you out of your dysfunction, your unlevel, your level of dysfunction that's currently not allowing you to live daily without therapy. So thank you.
My name is Brett Warner. I'm from Miami, Florida. I own an autism services company. We're tri-county, multiple, like 60 staff, 70-something clients. We do in-home, in-center. We're building our own centers in school. Our big thing, though, is not working with the kids, it's working with the parents, okay? So we have a separate wing of the company called Expanding the Spectrum. So if you're a parent and your child gets diagnosed with ASD or on the spectrum or Down syndrome or something like that, we now have a group of trainers that are going to teach parents what your kid is capable of while we are working with your child to get them to that skill level, right? Now, I'm going to circle to the DSM, right? As many of you know in here, I probably think you do because you're on a healthcare conference, Asperger's doesn't exist anymore, right? PDD, NOS doesn't exist anymore. Now it's just ASD, right? So I'm giving you one example of DSM, right? So you get a 299.0 code on your face for the rest of your life, no matter if you're Elon Musk or a kid that's running into the wall every 5 seconds. Same diagnosis code, right? So how does the payer know, oh, I'm poor, no, I'm super rich, oh, I was abused, I was this. The DSM doesn't have any of that, right? So in the DSM, we just say 3 numbers, a letter, this, that, a modifier, but really, that one doctor that gave you that diagnosis is not calling the specialist, right? Are they? When you go to the specialist, did they say, oh, your doctor called me, I already talked to him, we know what's going on with you? No, right? So the problem with the DSM is that one doctor will diagnose you with a code. Another doctor will diagnose you with a code. You'll come to me with 500 different codes, right? And we're all just, sorry to say it, in the Holocaust here, right? We have just codes on us. It doesn't work. So I guess at the end of this, we're going to try to find a way and get you guys involved, please, of how do we make a coding system work for diagnoses that are on spectrums, right? Clinical depression, you could be super depressed or you're going to kill yourself, or you could just be a little depressed because your company didn't make enough money, you missed a paycheck, right? But it's the same code, right? Totally different. So we're going to talk about that a little bit. I think we could get through that.
Hi, my name is Evangeline Bauer, and I started Come Play STL about 8 years ago. And it came from a need of one of my clients. She came in with a diagnosis of ADHD. And I quickly realized, as we were doing different play therapy interventions, this child could not read, this child could not spell, and they would often flip their letters. And so I quickly realized this is not ADHD, this is a learning disorder. And so when I went to her parents and I said, I'm so sorry, I can continue doing therapy, but I am the wrong therapist. This is the wrong diagnosis for your child. I sent the child away to another psychologist and got diagnosed with a learning disorder. She got the right treatment, and she's thriving today. All of that to say, I started the company Come Play out of a need of having medical professionals as well as behavioral health therapists all at the same table making diagnosis for children. So that's what I do.
Good afternoon. I'm Jill Wiedemann West. I am the CEO of People Incorporated Mental Health Services. People Incorporated is the largest community-based mental health provider in Minnesota. We serve somewhere around 14 to 15,000 discrete individuals a year. About 2/3 of them receive more than one service. Our clients are largely disabled by their mental health. These are individuals that are living with multiple barriers. I approach this with a little bit of a different flair. At People Incorporated, we believe that not only do we need to be an excellent service provider, but we also need to be a thought leader. We need to be thinking about what it is that we're doing out there to promote health equity, meaning breaking down the barriers, whether it's language, it's trauma, whether it's an individual that doesn't even have the word mental health in their native the culture that they came from, which we see a lot in Minnesota. We have to find a way to break down those barriers, and we have to find a way to make healthcare available and accessible, because healthcare is one of the great equalizers, right? And if it doesn't exist, it is a much bigger problem. So in addition to our thinking about services and making sure that our clients are in fact moving towards recovery, whatever that recovery means for them, we are also incredibly passionate about moving towards a sustainable healthcare picture and creating an equitable sort of scenario, not just in Minnesota, but everywhere. So thank you for inviting me today.
Thank you. And as go for it. And as I mentioned, I'm the outlier. I'm the engineer. And I came in here through my personal struggles with severe anxiety. And it's really interesting. I asked you guys to do the little social experiment earlier on about looking around and finding the fifth person. We didn't plan this, but the fifth person from the air is me, and we both have had struggles with mental health. And in that line, and in my adult life, struggling with anxiety, struggling with asthma, as well as with sobriety, I really came into meditation and mindfulness about 15 years ago along with yoga. And one of the things that I really got to learn from that is how it was helping me with my anxiety. And as I started looking into research back in the mid-2000s, I realized there wasn't much. You know, there were some studies being done by a doctor named John Kabat-Zinn. And so in talking to him, what I realized is he was doing some research with monks. These are people who are practitioners who've been out in the mountains doing their thing, and it really didn't help me understand how it was helping me. But I stayed with it, and it did help. But it was when I introduced sound into my practice was I truly able to overcome my ailments. And that's what my purpose and my drive for being here outside my comfort zone. I could be talking about technology, but I decided to be here because this is really important for me, because what I learned in overcoming, in dealing with my anxiety, as you can tell, is that we have to persevere, right? We have the ability, the inner healer within us, and we just have to invoke it. This is not about finding something new. This is about recognizing it's here. And in that, we've created a new treatment modality which integrates sensory immersion as a tool with CBT and DBT. We're funded by the California State. We're in prisons, we're in jails, we're in adolescent treatment centers, recovery centers all over California and Oregon. And so in line with that, and thank you so much there for giving us a little bit of an insight into what a DSM is. Is everybody familiar with what the DSM here is?
Is everyone diagnosed?
Okay.
Sorry, I have to bring some comments.
That's good, yeah. So the DSM is the Diagnostic and Statistical Manual. This was something that was created back in the 1950s as a way of classifying mental health disorders as well as brain-related illnesses. And through that, you know, in the biggest change from then on, from the 1950s, was in the 1980s when they shifted to a major medical model that is more scientific backed as well as with diagnostic criteria as they originally planned. And then moving on from then, into 2013 was the DSM-5. That's when they introduced a more dimensional approach, removing all kinds of, or including a bunch of subtypes within them. So as we started learning about how these disorders are actually affecting people, they started adding more subtypes, more criteria. And moving into 2022 with the DSM-5, the TR, which is what we are in right now, they've been moving away from the categorical identification of all these different ailments into more of a spectrum-based ailments, one of them being autism, the other being schizophrenia. And I'd like to pass it on to the panel here to talk a little bit about the DSM itself in what you believe is working as it is right now. And also, what parts of it do you believe needs mending?
I can speak. So I believe that the DSM right now works to get you a diagnosis if you have an insurance company, that you have a plan, an active plan, which may be not active tomorrow, we don't know, right? Or you have Medicaid, which might not be active tomorrow. The DSM code is supposed to get you treatment, correct? Now, if you have a DSM code for a spectrum of a disability, right? 299.0. I'm sure that if you raise your hand in here, you know what that is? 299? We know, a couple people know. It's autism, okay? The DSM-4 had Asperger's as a diagnosis, okay? Had PDD-NOS as a diagnosis. When they made the DSM-5, they got rid of those. So that means that how does the insurance company or Medicaid or any payer know what the difference between you, who has social skill issues, okay, 299.0, or a 4-year-old who is banging their head bloody into their parents' wall every morning as 299.0? There is no way, right? So the insurance company is going to go, oh, it's 299.0. They're going to do an assessment, they're going to do all that, but they have limits for the 299.0, whether that's a 21-year-old or a 3-year-old, right? So you run into that problem. Same thing with every other diagnosis that's a spectrum. You get one number put on your head, and that's it, right? What if you were abused as a child? Okay? What if we don't look at the whole person? What if we're just looking at that diagnosis number, okay? And we don't go deeper into it? Because you could be diagnosed, 2 people could be diagnosed with depression, but one person could have been abused as a child, lives in a poor area, does this. Should the DSM lay that out so that they get more services versus somebody else? Maybe they should get the same amount of services. What I'm trying to say is that when you give one code to millions of people that are all different, how are you determine how much they deserve or they're supposed to get, deserve, right, in this country, or how much health care are they supposed to get if they all have the same code, right? So that's my personal issue with the DSM-5. The 4 was easier in the mental health world because it actually broke things down. Mm-hmm. But now, a lot of mental health is just one code. You get the same treatment no matter what, no matter age, whatever, you know, unless you have someone to fight for you. And that means that you can't be on Medicaid. You have to be on something else. You know, you have to have money to have that. So that's just my thing about the DSM is that when we have 500 clients come in and they all have 299.0, they are not all the same. There are kids that are trying to jump off cliffs. There are kids that are here. There are adults that are doing computer programming. There are people in college that are 299.0. But they all are looked at the same way, right? So it's a black and white versus a gray DSM. And I think that that is where it has to move. If DSM should even be here anymore. I mean, you know? So, I mean, if anyone else wants to.
Well, so I would say that my problem with the DSM is probably sort of akin to my problem with healthcare. It is a codified world that is intended to bucket very specifically an individual. You know, I'm old enough to remember that we used to call that labeling, right? But that's what it is. It's a codified world. The reality of it is that that's not the world we live in. The world we live in is filled with all kinds of factors that contribute. I often think about how many people, just in my neighborhood, that never really thought about mental health, never thought about mental wellness. But boy, during COVID, they went, wow, I think I'm a little bit more fragile than I thought I was. Love my family, but kind of tired of them. Really love my solitude, but really need some people. And I feel funny about that. I feel anxious, and I feel sad, and I feel all kinds of things. Well, welcome to the wonderful world of we all have mental health, right? And I think the DSM, in that strict codification, does not take into consideration what healthcare really needs to be thinking about in general to create more sustainable roads, to create better outcomes for patients, and to also, of course, create more equity in the system. And that is to create that integration. The integration of understanding that I can see you, I can do therapy with you, I can diagnose you, I can give you medication. But if you're going back to a homeless shelter, if you're going back to an abusive environment, if you're going back to a non-supportive or somewhere where you don't have food security or any of those, some of those social determinant factors, the likelihood that you're going to be successful, that I'm going to be successful, is non-existent. You know, when you go in to have cardiac surgery, and it's a major invasive surgery, right? Whatever it is that you're doing, the doctors constantly ask you, are you depressed? How do you feel? Do you feel safe? Do you feel happy today? Why do they do that? Because they know that if I do this heart surgery and I send you off to do cardiac rehab and medication adherence, and you don't feel happy, you don't feel safe, you don't feel secure, you're not going to have a good outcome. So it seems simple, but clearly it's not. But that would be my point.
I think the only comment that I have to add to it, having both medical staff in my office as well as mental health staff, oftentimes the DSM says, you know, you're going through the criteria to diagnose for anxiety or depression, and it will say, is there another medical condition that could be more applicable to this patient than just this mental health diagnosis? And so with us, we have the luxury of having the medical staff right then and there to go through what are the medical conditions, how does that look, what are the behaviors of that medical condition, or how would that affect a child in this way. I think for a lot of clinicians who don't have that luxury, they're just, I don't think there's a medical condition, so they diagnose the child with ADHD or depression, but they're not looking at the whole picture because they don't have everyone at the table that needs to be at the table.
So add to it for like 10 seconds, I promise. I think that's the whole idea here, right? Is that if you have a mental health problem and you ignore it, you're going to have a physical health problem, okay? So where does it all start? It starts in mental health. But if you get into a bad car accident, you get physically messed up, right? Then you're going to start having anxiety, depression, all that stuff. They are together, right? So the DSM should not be a book of codes of broken leg, this, that, depression, this. It should be combined codes, because depression causes anorexia, which causes, you know, malnutrition, which causes you to end up in the hospital. Now, no insurance companies are here, but I'm sure that we could really help them out. If you start with the mental health issues and you help those, the physical issues can't, or the opposite way, right? So anybody that's been in a bad accident or something like that has PTSD in here, I'm sure. I'm sure that a lot of people in here have PTSD, right? So why aren't we treating that, right? Are you treating it? No, because we don't think that we should. So that can eventually cause you to stop eating, to stop doing this, to stop interacting with your kids, with your grandkids. This is just all connected, mental health and physical health. That's, I think, where the DSM goes wrong.
Okay, and my take on the issues with the DSM is the labeling, like we talked about. So I've been doing this since 2001, and I work with several schools from North Carolina to Ohio with the IEP and the 504s. And the children are being labeled, and the parents don't like it. You're labeling my child. My child is bouncing off the wall. He's getting suspended every week for the same thing. The teachers are discriminating against my children. So I sit down with the parents and I say, okay, let's look at why your child is getting suspended. Let's look at the issues that we're having. And if you don't hit the criteria of this checklist, you shouldn't qualify for ADHD. So I have a problem with this checklist because I was labeled ADHD. And I have my mother that's sitting here, and she decided, thank God, I'm a child of the 70s, not trying to tell my age, but I'm almost 50 years old, and they wanted to put me on Concerta. They wanted to put me on Adderall. And thank God she had the fortitude and the initiative to say, wait a minute, he's just a little active. He shouldn't be put on medication. Okay, he needs to be stimulated, all right? So give him another assignment because he finished the math assignment too fast. Okay, give him another task. Don't label him. So I think the DSM-5 and the DSM-4 was easier, as Brett said, because the labeling, the criteria wasn't as hard. So the DSM-5 tried to make it harder to qualify or to be classified as ADHD, schizophrenia, bipolar, okay? But I wanted to share this, and then we're going to get on to the good things about the DSM-5. If a person, a football player, an elite, an athlete, gets traded from the New York Giants to Miami Dolphins, that's separation anxiety. He just had to take his whole family. Even though he has all the money in the world, how do we know that he's not dealing with some issues, but he doesn't hit the 6 out of 9? So his therapist might not label him with anxiety disorder. But what about that foster child that's 8 years old that got beaten or got abused by their parent and now they're in foster care? That's separation anxiety. So, and I digress, but we can go on, but that's a few of my issues with the DSM-5, because if you don't hit the checklist, okay, I'm not any better than anyone, and I say this in my trainings. Therapy isn't new. Therapy's been going on since the beginning of time.
Since they built this pyramid here in Las Vegas.
But the relationship building, you get results if you have a relationship with the client that you're dealing with. So when you find out that, okay, he's only 3 of the 9, dang it, he needs 6. Forget the DSM-5, let's talk. What's going on? What happened at home? What happened at school? And then you realize, okay, he is borderline, so I would write a unknown or unspecified. And when they took that out in the 4, that's what made it harder to label them. So I think that's some of the benefits.
Well, thank you for that, everyone. And one of the things that I think is a common theme here is the labeling, the branding, the identification for the rest of your life, right? Because once you're in the system, and if you are, then you know difficulties that everybody's facing here. And in that line, let's talk a little bit about how the DSM came about in terms of like who is the one that has created the DSM, right? Because somebody has to sit up top and say, you know what, these are disorders, these are illnesses, these need to be diagnosed, and these need to be treated, right? And so when you think about it, it's a 27-member task force that created the DSM-5. There's 13 working groups, 160 clinicians, and 300 advisors. And this has been created by the APA, or the American Psychiatric Association. And so if you look at the formation of these groups, these task forces, and these advisors, you really look at it and say, where is the representation from the patient? Where are the patient groups coming in to talk about what it is my clients need? So moving into this conversation, looking at what the DSM is intended to do, the standardization of diagnosis, the utility in reimbursement with insurance, the categorization for being able to structure the entire content so that it can be presented to everybody out there, including the psychiatric drug regulation agencies, the health insurance companies, pharmaceutical companies, legal system, policymakers, psychiatrists, psychologists, clinicians, therapists, the individuals, the family. Everybody needs to talk about this in a certain way. So there's a lot of factors that go into why it is the way it is. And now, moving forward, in terms of what it is that the DSM should look like, right? And again, the question may be even down to whether it should be the DSM or if it should be a completely different model. The DSM group has already identified this, saying that the way that it is, in the way that it's progressing, there needs to be some basic changes at the grassroots level, right? What that looks like has not been identified, and let's talk a little bit about that, shall we? All right. So in that, we talked a little bit about what it is that we liked about the DSM, though there wasn't a lot of that. There was more about what is broken with it, which is fair, because you guys are in it. The other part of it comes to, moving forward, what are, if any, other models that we can look at and say we could take some of these ideas, concepts, and then essentially either transpose it to the DSM or to completely revamp it and improve it? So, any thoughts?
Denmark. I mean, I hate to say it, but Google on your phone Denmark's health system, okay? They don't have labels for people. There are diagnoses. Everyone gets treated the same, right? In this country, the DSM, in my opinion, and anyone here, obviously we're on a panel, can disagree, and any of you can raise your hand and disagree and get a mic. But I think that the DSM, if we're gonna have a book that literally puts a code on your health, right? There should be modifiers on that code, okay? Where are you from? What's your family like? Before you go see a doctor, if they diagnose you, they should be asking you, in all the pages that you have to fill out online, on alma.com, on whatever you're going on all those online websites, see a doctor in person, right? Talk to them about everything that's going on. And if they recommend you to another doctor, tell them to call that doctor, sign the release of information, okay? Tell that doctor everything that's going on with you. If we start that way, maybe eventually the DSM will have some modifiers on there, okay? So I go into the doctor's office. I've been really depressed this year. Okay, depression code, boo, 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 okay? But then if the doctor says, why have you been depressed this year, right? Do I send you to a psychologist or a psychiatrist, right? 5 minutes. If we send you to a psychiatrist and they put you on 5 medications in the first 5 minutes that they see you, which, raise your hand if you know psychiatrists that do that, okay? Everyone does, all right? Then they're addicted to drugs. Then they're on medication. The psychiatrist doesn't know how to take them off it. Yeah, their anxiety is gone because they're taking meds, all these things. The DSM should not just say anxiety, code blah, 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 because then your doctor's going to send your psychiatrist, they're going to give you a benzodiazepine. And then you're going to get up and up and up on it, and then you're going to have a seizure and end up in the hospital, right? So the DSM needs to be fixed in a way where there are not consequences for what another doctor will do when they see your diagnosis. That's all I have to say.
Okay, we got 5 minutes. The DSM needs to be more culturally context-driven, okay? Raise your hand if you think a book can tell you how to raise a child. So how the HE double hockey sticks can we look at a book to tell us how to treat a person? Understand? So it needs to be more culturally centered around each individual's different. I gave you the example of the football player who has anxiety disorder, and I gave you the example of the 8-year-old. They're two different spectrums. So it can't be cookie cuttered. That's my take.
It's important. I think everyone should raise up for this.
So brain science is still so at the beginning. And I think when we create this definition of the beginning, the middle, and the end with a diagnostic code, what we really do is we stifle our ability to truly understand what we are capable of in the area of brain science. And so the idea of modifiers, the idea of creating those functioning and assessment pieces that are part of it. Let the diagnostic and statistical manual be the beginning of a grand effort to create a middle that ultimately creates an end that teaches us something.
And I'd like to sort of take this opportunity to say where I am and what it is that we do with sensory immersion. We take every individual as a person that doesn't have a diagnosis, because as they come into our sensory rooms and into our sensory pods, and as they walk in walking out feeling a little more integrated into whatever it is that they have, because one of the biggest things is coping. Whether it is the difficulty that you're having with what you're facing, or whether it is the improvement that you are having, right? Really understanding and saying, this is really happening to me, and it can happen to me. Being able to say that, walk out of there, and say, you know what, I want to do something about this, right? And so that part of the bottom-up approach towards treatment also needs to be looked at, versus somebody coming from up top and saying, this is all you have, and this is all you can live with for the rest of your life.
Sounds like the economy.
Just kidding. Guys. Question.
Please.
We're gonna hear
I think this has just been a great panel, and I really appreciate your comments, and I hope everyone internalizes what's been said here. Just by way of background, my name is Edward Anselm. I've been Chief Medical Officer of a number of health plans, and as a student, I did attend some DSM-3 discussions. So I have a much more direct understanding of how DSM is written and how it's used, right? And it's the diagnostic and statistical manual. It's not the treatment manual.
Correct.
Right? So the flaw is not in the book. The flaw is in how clinicians use it and how our culture uses mental health care. We don't value mental health care. We're in a profound state of denial around mental health care, and the challenges that you articulate and describe are representative of what every clinician faces in trying to get things done. So the issue is not the DSM, it's how we structure mental health in our society. Thank you for a great panel.
Thank you so much.
Thank you. That's great. That was awesome.
Right to the point.
We finished with time, but to comment on what he said, it's 53 people I just counted in this room. If this was a book club and we all got the same manual, the same book to read, we would all perceive it different. So that's also the problem. It's perception as a clinician from Florida to New York. Why did I say that? Because a New Yorker is different than a Floridian, so Floridian. So that also takes into accountability of us as clinicians to dissect and perceive with the empirical images this book and these categories that we're reading on how we can treat the client.
And a New Yorker at 34 is different reading the same book as a New Yorker at 76, correct? So,
Thank you, guys.
Same
Thank
story,
you,
different
everyone.
meaning.
Thank you,
All right, excellent. Thank you so much for that excellent presentation, panelists. And speaking of the future, our next keynote will take us even deeper into a transformative power of regenerative medicine. What if our bodies could heal themselves? The concept isn't science fiction, it is a reality of regenerative medicine. Stem cell therapy is reshaping how we treat chronic conditions, accelerate recovery, and even rebuild damaged tissues. In this next keynote, Regenerative Medicine, the Transformative Power of Stem Cells, our keynote speakers, Dr. Ronnie Costello-Gonzalez, CEO of Gaia Impact, who is also our bronze sponsor, and Dr. Maria Laura, scientific advisor of Regine Global, will explore the cutting-edge applications of stem cell technology, from repairing spinal injuries to regenerating heart cells after a heart attack. The potential is limitless. Are we on the brink of a healthcare revolution? Well, without further ado, let's welcome our next panelists. Welcome Dr. Gonzalez and Dr. Laura to the stage.
Hello, thank you very much for the opportunity. My name is Ronnie Castillo. I'm a doctor, but I'm a doctor in economic sciences, not in medicine. So Maria Laura Jimeno is a doctor, a scientist. She's a biotechnologist. Maybe she's coming soon. And before entering into the topic, I just want to reiterate, a little key terms that I think would be useful before getting into the topic. And it's about the evolution of society in the last maybe 50 years, where we began from a capitalistic, kind of way of thinking into introducing a term that is called sustainability, and that happens maybe after the Kyoto Protocol and after Rio 92, and after that, maybe in early 2000s, we began to talk as a humanity about being resilient, resilience. And lately, maybe 2010 to now, we're talking about regenerative approach, And those approaches are not only related to medicine. I'm also a rebel guy, I have a lot of tattoos. And what I think is that one of the most rebel things you can do is, stop trusting the system and trying into getting yourself aware about the things that really matters, So right now we are seeing a lot of disruption in many aspects of life. One of them is, for example, regenerative agriculture, We're questioning the way we produce our food and how we can have a better way to feed ourselves. There is another concept that is very popular right now, and it's about the regenerative finances and all this crypto thing going on, And another thing is regenerative medicine, So these are my three favorite topics to speak about. So let's speak about regenerative medicine. So regenerative medicine is kind of a new thing in health. It's not even recognized by the authorities in many countries right now. Maybe some therapists doesn't. But what is undoubtedly is that it's transforming a lot what the approach of medicine is being held. I'm from Costa Rica. In Costa Rica, we are tolerant into this kind of therapies, as well as Mexico, where the company that I represent is from, and some other places in Latin America and Europe, for example, Turkey or Middle East. This is something that is booming. In the States, there is some pathways where FDA is trying to facilitate these therapies, but it's not yet mainstream. Understanding a little bit about stem cells, stem cells began when were discovered the embryonic stem cells, potential, and there is a little ethical and legal considerations about this, because it involves fetus, destroying. So we're not going to talk about that, but we're going to talk about a little bit more about, adult stem cells extraction. And adult stem cells are extracted from different parts of the body. You can find it in blood, you can find it in bone marrow, you can find it in fat. And from this universe of adult stem cells, there is two kinds of stem cells that I want to bring into the conversation today. One of them is the mainstream or the cornerstone of regenerative medicine, which are mesenchymal stem cells. This has been in market maybe for the last 20 years, 15 years, maybe with a little more power the last 10 years, And it has a lot of potentialities on how you can treat different pathologies with a different perspective, So, and there is something else that is something new that we are promoting here, and the scientist here, Maria Laura Jimeno, literally wrote a book about this. There are like the Muse-AT. Muse-AT are a special kind of stem cells that are pluripotent, and we're going to talk about the difference of multipotent and pluripotency, a little bit soon. But the important thing here is that there is a lot of potentiality on regeneration of tissues, So this been applied, especially the mesenchymal stem cells, been applied a lot in mesenchymal tissues, that's bones, cartilage, skin, heart, regeneration of organs. but they're not that effective into neurodegenerative diseases, which MUSE-AT are, you know? So they're like complementary stuff. You cannot say one is better than the other. It depends on what are you treating, you know, what you want to accomplish with. So there is also another appliances for these kind of therapies. For example, diabetes is one of things that are being researched a lot. As I told you, bone and cartilage repair. And there is a big promise on anti-aging. This is one of the big topics of the world right now. And I don't know if you are aware, but you know there is $100 million prize in California for the guy or the company that unlocks the potential of anti-aging. And for sure, stem cells is one possibility here. So let's speak a little bit about the mesenchymal stem cells, which represent the cornerstone on regenerative medicine. And this is because it has more time on market and also has a lot of more research and investigation related to different pathologies, you know. So mesenchymal stem cells are very good because they have been matured and how they are extracted and sourced. There is a lot of versatility on applications related to this specific therapy. And there is a lot of clinical applications that have been documented in the last 15 years. So right now, if you go to maybe 95% of stem cells clinic applications, what they're gonna give you is mesenchymal stem cells, and they are very, very good. We also sell those, so. And this is a new kind of product, the MUSE-AT. The MUSE-AT has the difference between the mesenchymal stem cells that they are pluripotent. The mesenchymal are multipotent. You know, that means that differentiation they can achieve is different. The mesenchymal is more in mesenchymal tissues. When we speak about MUSE-AT, because of different technical reasons, one of them is the size. You know, it's maybe 8 to 15 micras versus 20 to 30 micras on the mesenchymal stem cells. That means that they can pass different barriers that the body has. One of them is the lungs, for example, or the encephalocranial barrier. That means that if they can pass those barriers, they can go to the brain. They can treat neurodegenerative diseases like, for example, Parkinson. And that's very important because Parkinson is a disease that is very popular in the States right now, and there is a lot of research investigation related to this. What is very interesting about this is that we have actually held a research in Costa Rica with 40 patients with very good results in Parkinson. A publication is coming very soon related to this specific therapy. And what I can tell is that we are not trying to substitute at all, the treatment that the people has currently, but they want to complement them and see results. And the results have been very promising in this specific pathology. There are here some clinical studies, case reports, publicated in official magazines that are, globally respected related to this specific MUSE-AT. We are, launching the sale of this new therapy just this year. So we're very proud to offer this to different doctors, and we have a very limited availability of the therapy, but right now has been very successful on the collocation and on the applications that we have. Let's speak a little bit about the anti-aging properties of stem cells. And this is because, many people or the previous way of thinking was like, plastic surgery, look good on the outside, because we like what we look. But right now we're thinking more on healing the inside, and if you heal the inside, you can look good at the outside also, So that's the thing here, tissue reparation. enhance the cellular function, you know, work on these telomeres and all these keywords, you know, that are being talked about this right now. And it's very important that there is not a magic trick here, you know. There is not a magic recipe to be young forever, you know. What we are promising here is not that you're gonna live for 200 years. What we're trying to promise is that you're gonna live well as you are alive. So in order to achieve that, it's not only to apply stem cells and forget about it, it's about to having a wellness approach. It's about having a balanced life, you know? So there is no magic recipes, you know, stress management, eat well, you know, adequate sleep, make exercise, you know, it's plain vanilla recipes, but they work. And they work if you complement it with the right medicine and the right lifestyle. So that's the message that we have to give the people today here. There is also something very important that I think that is the key thing about the importance of having this kind of research right now, and is that the health systems are, you know, collapsed. We know that not only health systems, but also pensions are collapsed. And we are living in a moment of humanity where we are getting old at the same time. So the overall aging population, you know, average, is making that having a lot of stress into the system. And we cannot rely that we're going to have a pension, or we cannot rely that the health system is going to treat me the way that I want. So that's why it's very important to find ways on how we can take out the pressure from these health systems. And stem cells is one way of achieving that, because the idea here is that how we can get old together healthy, you know, at the same time. So we cannot gonna give that pressure into the health systems. And this is the key topic about here, you know, how we can make a way of being more healthy, of being more conscious about how we eat, on how our body, you know, behaves. But we are a machine, you know, a biological machine. So we have to give the good resources to that machine in order to achieve that thing, you know. Otherwise, we're going to be in a big trouble in maybe 20 or 50 years as a humanity, you know. So I really think that the preparation that we have, that we should have as humanity for an aging population, is key in order to have peace, you know, in order to live in a way that make us proud as a humanity. And that's the big promise of stem cells. It's not only, you know, healing this or that, but trying to, you know, get a wellness approach in humanity and in communities, you know. And to achieve that, I think it's very important to be conscious of ourselves and not rely exclusively on how the health systems and the food systems are built, because they are built to get us sick, you know. They are not built to get us healthy. So I am very grateful for your attention on this topic, you know. There is some, you know, everything innovation has some challenges that we have in this case. One of them is, you know, it's something new, so we need a lot of research and investigation in order to validate our hypothesis here. We need also to get a standardization and, you know, involvement from health authorities, so they can validate the treatments, because there is a lot of people, a lot of companies that are selling things related to regenerative medicine and stem cells that are not necessarily stem cells, are not necessarily regenerative medicine. So regulation is very important. And I think that regulators, especially in these times, should move more quickly than they are, you know, not only in regenerative finance, in regenerative medicine, but also regenerative finance, also in regenerative agriculture. They have to move forward, you know, because they are behind. So I think it's very important for us to put this topic on the top of the importance, so regulators can follow up, you know, the possibilities, and we can work this in an ethical way. just a little reflection. The future of regenerative medicine is about, how we deal with these technical struggles, how we can promote a healthy lifestyle, and how we can get standardization on how these treatments are, offered to the public, I'm proud to be Latin American, but I'm also very conscious about, how things work in Latin America. And I think that as soon as we can, put this topic in the top of priorities of stronger jurisdictions, it's going to be about mainframe in the near future. So thank you very much for your attention. If you have any technical question, I'm here with the doctor that wrote the book, and there is our contact points if you want to contact us at any moment. So thank you very much for your attention.
All right, thank you so much, Dr. Gonzalez. Now let's shift from medical breakthroughs to a heated debate in the healthcare industry, the tension between patents and patient access. Now, our panel of experts will tackle this ongoing debate in our next panel on patents versus patients, navigating the tensions between innovation and access. How do we protect innovation without making essential treatments unattainable? Can we reshape patent policies without stifling research? Finding the balance between profits and patient care is no easy task, but it's a conversation we can't afford to ignore. Please welcome our moderator, Crystal Booth, the CEO and Executive Director of Wings of the Future, NFP, and the panelists who are here to break down the complexities of healthcare access and innovation. Welcome them to the stage.
Thank you, everyone. Thank you, everyone, for hanging in there. I know you guys have been waiting all day to, be a part of every part of this presentation today. So I'm going to just go down the line and have everyone introduce themselves, and then we'll go from there.
Hi, my name is Yves Dicat. I'm a founder and CEO of a company called Biolingus. And we do drug delivery, oral drug delivery of peptides, proteins, and vaccines.
Hi guys, I'm Devaki, and I do data transparency within clinical trials. I work within the drug development industry, and I've had various experience in other areas as well. So I'm really glad to be here and so honored to be surrounded by all you great people.
Hi, it's actually great to see you, in person, because we connected online before. My name is Olga. I'm from Slovakia, so I have a little bit of jet lag. Sorry for that. I'm co-CEO of AI Dental, or AID, because we are moving beyond dentistry as well. And I'm also co-founder and CEO of Next Generation Healthcare Alliance in Europe.
Hello, everyone. I'm Ishwar Iyer. I'm the co-founder and CEO of an AI and biotechnology company called IKIM. We try to make new medicines with ChatGPT-like AI. So the goal is to make cheaper, faster, better medicines for diseases where you have there's not enough access to medicines. So pleasure to be here. Thank you.
Thank you so much, everyone. Ladies and gentlemen, welcome to our panel discussion. One of the most pressing dilemmas at the intersection of healthcare and intellectual property, the tension between patient and access to medicine. At the heart of this issue lies a fundamental conflict. On one side, patients are crucial for incentivizing innovation. So we need to start incentivizing some innovation there, I guess. They provide pharmaceutical companies and biotech firms with the exclusive rights to profit from their interventions, thereby motivating the substantial investment required to research and develop new drugs, with the promise of patents, many of the groundbreaking therapies and medical technologies we have today might not exist. On the other side of this equation is access. Patents can lead to high prices. Patents can lead to high prices for new drugs, potentially putting them out of reach for many patients, particularly in low and middle income countries. This exclusivity can delay the entry of more affordable generic alternatives into the market and exacerbating global health disparities. This tension raises critical questions. How can we balance the need for companies to recoup their investments and fund future innovations with the ethical imperative to ensure that all patients, regardless of income status, have access to life-saving treatments? Throughout today's discussion, we will explore potential strategies to navigate this complex landscape, such as alternative intellectual properties models, international policy reforms, and innovative pricing and licensing agreements that aim to enhance drug accessibility while still promoting robust drug development. We look forward to this dynamic and insightful conversation today that tackles these challenges from multiple perspectives. So let's get started today, you guys. Thank you. So we have a few questions. I want to get started today. The first question that I have, and whichever one of you guys feel that you best can answer this question, you let me know. But how can we strike balance between protecting intellectual properties through patents? So how can we strike a balance between protecting intellectual properties through patents while ensuring life-saving medicines remain accessible and affordable to patients globally? So how can we do that? It's a very complex balance between the two. So here we have the patents, and then we also have the fact that we need to get those things delivered to the patient in a manageable way, and in an affordable way, because as we all well know, patents are quite expensive. People who work in the field of science and medicine are quite expensive. However, we still need to be able to actually get this to the patient. So I want to kind of go ahead and ask, can you go ahead and answer that for us today? Can you start the discussion?
Sure. Happy to give perspective, but so at a high level, the question is, how do you balance between, innovating and sort of protecting the innovation and giving more access to better medicines? Is that right? So at a high level, the way the industry works is companies, small startups, they discover new medicines. The process average takes about 10 years and maybe $2 billion for it to get to the market. So patents, in some ways, come in that where it protects, at least prevents others from following that invention and gives some exclusivity to the person who's invented it, enabling investments to pour in, and as a result, you can make medicines. But as a result, naturally, the medicines become expensive because they've taken as much time and money to be made. So I think in the new age of sort of technologies, you expect that with the new innovations making drug discovery process cheaper, faster, better, that's probably one of the ways you can make the innovation more accessible. You can also try making the lifespan of the patent from, 10 or 12 years to shorter, but there is a risk. A company that's investing in it may not have time to reap the benefits out of it. So it's a fine balance that you have to reap. I have filed many patents in the past and have sort of experience in this. For certain things, patents are important for bringing that investment, but for certain things, it stifles others from practicing it. For example, generics are a great example. Once the patents expire, many companies come and make generics, which then bring the price significantly lower and so on. So that's my thought. I don't know. You're also in the same in the same space.
Yeah, I can add to that a bit. I mean, what we're discussing here is one of the biggest problems we have in the pharmaceutical industry. And so it's a simple question, but very hard to answer, and no one actually succeeded in answering that very clearly. But what I want to emphasize is indeed patents are necessary. So I lead a small company. When I want to have funding from VCs, one of the key questions they will ask is, what's your patent situation? When will they expire? What's the protection in different countries and so on? So it's absolutely necessary, and without that you can't survive. So how can we solve that? Actually, I think a bit a pessimistic look. For me, what we're discussing, let's say the tension between patents and patients, it's like the Grand Canyon of the pharmaceutical industry. What is bad about it, the canyon is getting wider and deeper all the time. There are forces driving that in the wrong direction. We can discuss that a bit further, but on one hand, regulatory requirements are getting more difficult, clinical studies are getting more complex. So these things. So how can we solve that? I do believe that the solution lies in technology. With technology, we can build a bridge over the canyon, actually. In many ways, I will give an example from my own company. So we develop drug delivery systems. For instance, for COVID vaccines, normally you all had your COVID shots, I assume, or most of you. So we can develop a small pill which you put under the tongue, so you don't need the injection anymore. We actually developed the system together with funding from the Bill Gates Foundation, so that's an example of a public-private partnership, actually. What's the advantage of that? Well, a pill is much cheaper, much more affordable than an injectable. Second thing is, if you have an injectable for a vaccine or insulin or whatever, you need a cold chain. So it's hard to reach remote areas in the world. If you have a pill, you don't need the cold chain. So access is much more easy. So this is an example how technology can help to close the gap, actually. But there are many other examples, and I think we can discuss that about potential solutions. So I don't believe there's one solution, but we have to have a multiple of solutions to bridge this gap, actually. So I let the word now to my neighbor.
Thank you so much, Yves. Just to clarify on that point, I completely agree, and because patients are at the forefront of what we're trying to, our primary goals, so we need to create better systems for access to these medicines and to also expand on health literacy as well, which was touched upon in an earlier panel discussion, which was really great, and I see some potential areas for collaboration there. I know Olga specializes in AI technology. I think you've got some really great points to share as well.
Thank you. Well, I have been in pharma for some time, but now I switched to software as the medical device. It's a term for developing a medical device which is in the shape of the software, which is directly integrated into the clinical practice for diagnostical or some other purposes. But in my times, because I can talk about the patents in medtech, but here we are mainly talking about patents in life sciences and biotech. Well, in pharma, it's usually like you're planning your business runway based on your portfolio of patents. So basically, you have to look forward for 5 to 20 years and plan your market penetration based on how long you will have the patents. But I think what might help us is to support the systems how to differentiate or to help smaller companies which are developing some innovation, whether it's in biotech or medtech, to hold the position or to penetrate the market and not be driven only by corporations which are then holding, as per my recent research, up to 97% of the patents. So that would be my takeaway here, to somehow shape the systems, somehow is a broad term still, to allow more smaller companies to penetrate market when it comes to the innovative solutions. And we are not there yet in terms of legislation and in terms of the regulation systems.
I'd like to see if you'd like to pick up where she just left off. And
I got a no? Yeah. Winner. Okay. Sorry, I came from one panel, rushed to the next. Thank you for allowing me to join. And I want to touch on the patient access, right? A lot of, big pharma controls a lot, and it's revenue driven, and a lot of great products are not accessible to the majority because of cost, or it's new on the market, or it's now addictive, and so on and so forth, right? Always coming out with more and more and more. I am a big fan of reaching out to the smaller, right, newer companies that are going to look at innovative ways to be more holistic in their approach, innovative and less, I call it farmy, and be person-centered. There has to be a big shift because I'm a patient advocate. I run a recovery wellness center, and so many individuals come to me because they are addicted to one pill or the next, or this substance or the next, or they got really sick, right? They're in liver failure because not just because of the substance, but because of medications they were taking alongside. I do a lot of research on the new upcoming, more the devices and such, and they're working on their patents. And I'm one of their biggest cheerleaders because I want to see people be able to get off of opiates. I want to see this new change, right? All the ancient wisdom that went out the door many, many moons ago because of this new pill that came out that's a quicker fix or this and that, right? We need to start incorporating that more in the forefront and seeing a real change and making it accessible to everyone. We are all recovering from something, right? And we all deserve wellness. And I think that this new technology and new innovative ways, devices that are working so hard to get funding or get patented just to prove themselves so people can really look into it. Because if you don't have a patent or if your name's not up here, then it must be no good. So I'm a huge advocate in working on that, but making it accessible to everyone because we need to get well. So
that is amazing because I was just thinking, did you want to say something? Go right ahead.
I don't want to interrupt, sorry.
Okay, well, I was going to kind of piggyback on what she was talking about as far as access, being that I am a licensed clinical social worker, and I do work in the greater Los Angeles area. That's where I started anyway. I've expanded from there, but I do tend to work with patients that they know that there's Medi-Cal out there, they know that there's Medicare, they know that there's those different resources out there. They even know that there's therapy because if you go on social media, most of the time you're going to see a lot of, information about mental health. People are posting constantly about that topic. It's a very interesting topic, and drugs and things like that. As soon as they come out, a lot of people are posting about those kind of things, but they still don't know how to make that transition from the knowledge to the actual, sitting in front of the therapist or sitting in front of the clinical person that they need to get that service from. And so kind of what we were talking about on one of the earlier panels today, well, actually I was doing a keynote on one of the panels, and one of the things that I was talking about, one of my topic was about the apps and about using apps and about using AI. And that was what my topic was for today. And I kind of want to spin off on that a little bit and say, using apps, a lot of the times, most of the times, most people know and understand apps because we have so many these days. And I think that's a really great tool. And I wanted to see if any of my other panel people, what have they learned about that, being as they're more on the tech field and I'm more in the the service part of the industry. Did you want to say something, Olga? Or
I
was it
just wanted
something else?
to comment a bit on the earlier phrase or speech. Actually, as part of our competitors' landscape scanning, we identified one company which developed the patented innovation in the diagnostics and AI and was purchased by the large corporation, and that corporation killed that smaller company just in order to maintain the position on the market, which is like it's a life, we understand, but that's also how we got to discover deeper how sometimes the innovative solutions are actually not getting to the patients at the end of the day, because sometimes they're just getting killed by bigger companies, which is, of course, how the business operates so far. Yes.
No, I liked something that you said, Heather, which was, kind of threw away a lot of the old time-tested medicines out of the window. I think there's currently, I speak as a scientist, as a technologist, as someone who's sort of pursuing medicine with AI. I think it is true that, there's, millennia of wisdom. Sometimes there's a bias of immediacy bias where we think that we are the smartest that have been there, and then this is basically the most, useful. We have gone deeper into certain things, but certain facts about, certain medicines are there that sort of have been shown to be useful. I mean, the common things, whether it's Chinese or Indian medicine, or go to any of these, traditional, ancient sort of cultures, there's always some wisdom hidden there, and maybe there's false positives there and so on. But dismissing it is probably not the right thing. But on the other side, for a company to take that and do something with it, they need to, again, have investment, and they need to have a patent. And that drives the need for sort of either isolating two reasons. One is to make it more efficacious and more potent, and also more specific to certain populations. There's a drive to make it better, so there's a need for sort of isolating the exact compound and productizing it. But that productization is important for driving innovation. That also takes away from that generic nature of things. I personally know of a hospital that treats a lot of things with these ancient medicines, often for free, and there's a lot of, but nobody has ever heard of this hospital. I've seen many people who have gotten sort of in my own family or others who have been sort of benefited from this, but that's the thing, because their incentive and the motive structures are different. They just do it for doing it. But if you're decided to be a company or corporation sort of trying to have this identity, once the investors come in, investors are in because clearly there are two things. Of course, they may be purposeful, but they put in X money and they need Y money out, and they need to have a clear line of sight. So that's kind of how the ecosystem, there's nothing evil in it, but it's just how the ecosystem churns. So just a small perspective.
Sure, thank you. Okay, I think we
and can I touch base on your question when you're talking about the apps, right? And the AI, and there's a lot of the wellness apps, and you can retrain your brain, and you can, there's so many different great modalities via the phone, but the phone sometimes is the problem too, right? But it's not forgetting the human connection. It is bringing a lot of the education and awareness and accessibility to all, and I think that there needs to be more, and I've seen more and more, a beautiful blend between Eastern and Western medical modalities, because there's space for all, and teaching somebody grounding techniques.
Absolutely.
Right?
That's what I was
teaching somebody sound healings, teaching them how to use these stress coping modalities, and even healing modalities alongside with doctors' prescriptions with any ailments, right? Because there's space for both. My mother-in-law passed away, not yesterday, it sometimes feels like yesterday, last year with cancer. And she did the regimen, she did the special research, right, at MD Anderson, but she was missing so much of the soul component and what she can do in between the treatments. And she lost herself. And then she lost the will to fight and to live anymore. And she would rather just say, I'm tired, I'm done, right? So I think that even though the research and the different, it was becoming accessible to her, but there was also that other component that was missing, right?
Absolutely.
And so incorporating that and making it more, I think talking about it more. I love that there's a hospital that specializes. I want to know about it. I want to, because I will send people there. I'll go there myself. Like nobody knows about it because they don't have the big high dollar capital to shout from the rooftops, here I am, or the big shiny big logos that are everywhere, right? But they have incredible work and solutions, and they're healing, and more people need to know about it. So I think that having more people being bold and brave to talk about it and saying this is accessible and giving people the power of choice can go a long way.
Yeah. I would like to add something to the use of apps also.
Okay.
I became an advisor to a company that developed an app for patient care in oncology. So if you're diagnosed with a type of cancer, it's really like a shock. The purpose of this company, it's actually a company from Singapore called Medicia AI, so they're specialized in this. And once you're diagnosed, they support the patient through the whole treatment, actually, in all aspects. Normally, what people will do, they will look on Google and so, but they may have misinformation. And this app is really made by doctors. It gives all the right information at the right time to the patient. Also, there's not one type of cancer, there are 100 types of cancer, so actually the selection of the therapy is very complicated. And that app also uses artificial intelligence to help with the therapies, but of course the decision is always with the doctors, not with the app. And it goes until survivorship, so that's a really a unique example where an app, I don't like to call it an app because an app sounds a bit too cheap to me, but where an IT system can help, which is made by doctors, but supported by the most, let's say, active artificial intelligence to give very good support to patients. And it's now already used by 30,000 patients in Singapore, actually.
Wow.
And we're rolling it out now also to United States. There's a study ongoing with the Mayo Clinic to implement it there, and I'm also helping it to introduce it in Europe. But that's where very sophisticated technology can help to bridge the gap by giving better treatments, which are more founded on data and so on.
Yeah, I really agree with that, and that's kind of the reason why I kind of focused on that, because I thought it was something simple. That's been a big deal. When I first started my clinical practice in California, I immediately said, what we were taught at USC was like, you got to get delivery of service. Like, forget you do great services, it doesn't matter. A lot of these people are marginalized populations that are using these services, and they can't get to you. They have to catch the bus. I mean, this simple things like that as far as delivery. And so I got an office in Pasadena, I got an office in downtown Los Angeles, and then I got an office all the way out in the Antelope Valley. This is like, okay, 3 offices. If they have to catch the bus, they're going to get there. And no matter what, they're going to be able to get their treatment, because a lot of them have never had therapy. Therapy was typically something that the more affluent people were able to access. And so that was my whole idea. And so lately I realized that obviously we've moved over to teletherapy now. Teletherapy is really another major delivery service that has transformed healthcare, and I love it. I absolutely love it, and I advocate for it every chance that I can. And so that's great. But then there's some people that think, they're a little bit paranoid about that. I know about the marginalized populations because that's the population that I typically serve. And they'll tell me things like, well, someone is going to hear me, and maybe they have a home. They're the Latino population. They may have 3 generations living in the same home with them. So how are they going to do teletherapy? Because someone's going to be listening to me, and I'm actually talking about them. So it's those simple type of things. And so I said, I thought the app would be something really good that they could take in their room or even in their bathroom or whatever. If they're having a panic attack, they can use the app to do some sort of coping method that can, remind them of the coping method. Obviously, I always tell my patients when they're sitting with me to, get some pen and paper. I'm going to tell you some things to do. We're always going to, I'm going to likely give you a little bit of homework. It's not going to be hard homework, but it's going to be a little homework for you and things like that. So I thought that the app would be something really cool that they could have, that they could download it on their phone. Most people have a smartphone or some sort of phone, and they can use it, or if they have a computer or something like that, and they can go on there and you can manage between their sessions. This is not to get rid of the therapy, because the therapists, that hopefully they should be seeing their therapist at least twice a month, if not once a week. That's my recommendation to my clients. But yeah, I thought this was be something to bring up, and hopefully, maybe we can continue this discussion even after this panel. So anything else that you want to say?
Yeah, I just want to say, to your point as well, these apps and information systems, they shouldn't replace that human element, but they're there to enhance what we already have. And it's also like fear of the unknown, that it just helps educate the general population a bit more. So I really like that discussion that it supports.
I just thought it was something, because we're talking about access, and like I said, that's always been my thing. Like from day one when I decided to open a clinical practice, I was like, I got to find a way to get this to them. I know I grew up in this kind of situation, and I know the biggest thing for us was transportation. We could not get from point A to point B. A lot of us didn't have cars back then. Now it was a little easier to get a car, but back then it wasn't. So, I thought, let's try to think of ways. We're could probably consider the great minds of the world. So why can't we do things that make things easier for people who may not have the education, or they may not have the access to the resources that we have? So I wanted to see if there's any more input on that, or did you move on?
Olga, did you want to go?
Yeah, just maybe a bit related to the patents. So we are also facing with the same questions, like what are we patenting, what are our IP strategy from investors and so on when we are fundraising, and we are fundraising now, as always. I think that's never-ending story. And we are now switching from the venture capitalist and grant schemes from the governments and so on to actually fundraising from our customers, because of course they are interested in the return on investment, but they directly understand the need, they directly understand the potential of the solution we are building, and they are not that much in need to see the actual patent on the hands, because they want this solution to be integrated into their practice. So that's my bit kind of thinking so far, how we can not be so much focused on the patents and calculating the years we can be on the market with the patent.
That's a great point. In fact, I was going to add to that. I don't know, some of you or many of you may be tracking the latest situation. During COVID, there was a huge boom in biotech market, and then after that, there was a huge bust. So the biotech market, it's very hard to fund. So because venture capitalists have burnt a lot of money, and for them to show return on their funds, they need to perform better. So they're very risk averse. They want to take known entity and risk. So as a result, it's much harder to fund. On the other side, we also have from the government a lot of the funding that's getting cut from NIH and others, which have funded some of the blockbuster drugs, right? So that, while it's very negative, has a silver lining, which is it's going to focus people on collaborating more and perhaps focusing on fundraising from your customers, or getting to a product sooner so you can start fundraising using that, making something, rather than waiting for the typical biotech scenario would be, okay, I have an idea, let's raise some money, and then after that you do series A, B, C, D, E, and then you take it public, and then it takes time. And even if you don't have a product, it might be public, and it takes a while. But now with this pressure, now you have to get to a product sooner, faster, better. I think there's a silver lining. And all the hospitals and others are going to focus on collaborating with each other, from what I'm hearing in all the other meetings that I'm in, because it's hard for one entity to take care of all of these things. And so they're going to be more liberal with their revenue sharing and all the other IP, because they know that's almost survival. So I think there's a silver lining to all of this. On the other side of things, technologies like AI, some of you may be familiar with DeepSeek R1. Raise your hands if you have heard of DeepSeek R1. Okay, some of you have. So ChatGPT, many of you have. So it took billions of dollars to get this, and then there's a Chinese version that did this in 6 million, maybe some more. The same kind of technological shifts are coming in biotech. Those who know. Those who are not aware, it's going to sort of, be observable. But fundamentally, those, generating high quality data, sharing data more, freely with people, and sort of the licensing and so on. So what took much longer is going to take shorter. Now, this is going in a little more detail, but usually in a clinical trial, you have phase 1, you do the early discovery, and once you have a molecule, take it to phase 1 clinical trial, where you show safety, and then after that, phase 2, and so on, and then you bring it out. You have this advantage primarily till phase 1, because once you get to phase 1, then you have other regulatory people that take care of it. This is where the government has to come in. And that is a part, doesn't matter whether it's $1 billion company or a small company with a few $1 million. They all have to be in the same queue for the regulation. So that's something that has to come from the government on improving the regulation, and then that accelerates the whole field of moving faster. Keeping in mind the safety of people, so that people don't come up with snake oil, but at the same time, make sure that safety is addressed, but have more of the pipeline. So I think that's a silver lining. Good things are happening is how I see things.
That's amazing. That's amazing. I want to kind of move on to the next part of our discussion today. How do you see AI transforming the landscape of drug discovery, development in a way that bridges the gap between patients and equitable access to medicine, particularly for underserved populations?
I can talk about the drug discovery,
Yes,
and then
I would love to hear from
I'll
you.
leave it to everybody, because I think everybody's using some form of AI and sort of bringing it to fruition. We are at the earliest stage of drug discovery.
Yeah.
So we are at the phase where you know that there's a certain protein in the body that is, known to cause a disease or disorder. It's overactive or underactive, and you're trying to tune it. So we try to make binders to that process. Typically, that process can take a few years, depending on what technology you're using. And the promise of AI is, can you cut it to few months rather than years? And that way it becomes much cheaper. So you can send these ideas to the clinic. So there, I think AI is helping us design better molecules. Those who are skeptical would say, well, there's no AI-derived molecule in clinic yet, so let it get approved by FDA, and then we'll sort of go through it. And in some ways, it's true. Maybe it's going to be a few years, maybe 3 to 4 years before the first AI-derived proteins and others will start hitting. Maybe some of them are already hitting into clinical trials in different phases, small molecules for sure. So that trend is happening, so we think we are trying to compress it. Nobody has a holy grail, because that alone is not the gating factor. You can make a binder, but there are other properties to make a medicine. You should be able to manufacture it better. There are some properties. When you give it to the body, the immune system rejects it. Can you design a molecule beforehand that is not going to be rejected? That way you make it safe. That's a huge value, because then you can cut down the failures and the cost. You shouldn't find that out after you go to phase 1 clinical trial, right? Nobody has an answer to some of these, and there's a lot of impetus to do that. In fact, we too are having conversations on how do we get access to this data and integrate it with our models and so on. But those are the kind of impetus that's happening. So starting with one property and then slowly 2, 3, but it's not a linear change. It's going to be an exponential change. That's kind of how I see it. Love to hear more from, Olga, and then Devki and Yves, and Heather.
Just maybe some addition, because we are going through maybe similar challenges right now in research or in R&D phase, when you don't have enough of data, like you just mentioned, you don't have enough of the modifications of molecules, for example, and stuff. So we are now exploring the new hot topic in AI, which is synthetic data and homomorphic encryption. My CTO would be laughing at me that I'm using these terms, but basically what is that like with the help of AI, or based on AI, you understand how to create the quality synthetic copies, keeping all the medical labels and the evolvement of the cells, for example, or biological, I'm not medical, sorry, expert, but basically you can
retain the privacy, you mean, of the person?
Not only the privacy, basically with the synthetic copy, you can try to generate missing puzzles, giving the things you want to see from the data set, or what you need to have in the data set to train the AI for the specific things. So that's pretty fresh research field so far. There are just, I think, a year or year and a half being done so far in the research field on the synthesization of the data in medical care or sector. But we see there the potential because it would help to close those gaps of missing the data in order to fuel the research, in order to move forward with the clinical studies, for example.
Okay. So we're going to have to shorten our answers now. Going forward, we have a few more minutes left. I wanted to hear from you on this topic and two more people, and then we're going to try and at least touch bases on the last two questions.
Yeah, I can give two examples of applications of AI. I was working with an eye doctor actually in Saudi Arabia who had developed an AI system to look at the eye and pictures of the eye, and from that they can derive which kind of diseases you might have in diabetes and so on. And this eye doctor said that the system was trained, of course, in a lot of courses, but it can do it now better than an eye doctor. And why? Also because of simple fact, if as an eye doctor you have to do that the whole day, at the end of the day you're tired. You start making mistakes when you do that the whole day. So this is an example where in pattern recognition AI is very good and can actually deliver better results than an eye doctor. With another example I have from Switzerland, company Roche. You know them, they're very good in therapeutics, but they also have a diagnostics company. And above those two companies, they are building a new layer to collect all the data from the analytics company, from the diagnostics company, and combine them with all the data from the therapeutic company. And then they have an enormous amount of data that they can collect and then put an AI layer above that. So that's what Roche is doing, and Roche is actually the most advanced company in the world to do that. And maybe one last note is actually in applications of AI, the healthcare industry is the industry where there are most applications of AI compared to all other sectors. And there's two reasons for that. First is enormous amount of data, and the second is big amount of money going around. Yeah?
I'd just like to add from a data privacy and sharing point of view. So once the clinical trial has finished and then the drug is marketed for approval, within my area, we actually use AI to protect the patient privacy and the company confidential information, and we use the AI to pick up and flag up terms. But I don't think we're going to lose our jobs just yet because the AI isn't quite as, quite far ahead as we would like. So we still need a human reviewer. So I find with AI, it hasn't quite answered all our problems just yet.
That's a great point. So I wanted to just go ahead and move on to the next question. Did you have something that you wanted to add?
I was just going to keep it short and sweet. It's just the time efficiency and being able to cross-reference data points and do it at a much faster rate. And there's human error, right? And so it should be able to navigate those data points very quickly.
Yeah, I think that, when it comes to AI, the only thing that I can say about is I do appreciate the deep dive, being able to do research faster. If I have a patient that is suffering with something that I did not know coming into the treatment with them, then I can do some deep research on that really quickly and get up to speed. So I think that could be a very useful tool just from a very concrete level for us clinicians out there that really want to advance in practice and even though that may not be our specialty, but we want to at least know a little bit about it in case we have a client that is dealing with that we may even refer them out, but we still want to have some knowledge of that to intertwine that with their typical clinical treatment or psychotherapy that we might be working with them on. So one quick question, how can biotech startups ensure their breakthrough therapies remain financially viable while prioritizing equitable access in patient needs? So if anyone wants to start with that, or if they have something to, thank you, Olga.
Value-based healthcare. Just one value-based healthcare. Just one sentence. It's more in Europe, I think.
Biotech startups ensure their breakthrough therapies because, the biotech industry, You know, there's so much breakthrough therapies that are going on, and we want to make sure that they're financially viable while prioritizing equitable access to patients. So we still want to look at the equitable access. Did you want to pick up on that?
I'll give a very brief, thought on that. I think biotech is where perhaps software was maybe 30 years back, 25 to 30 years back. I think there was a time when, with the infrastructures being built, there was a time for garage-based startups that actually could do something in a very short amount of time and actually make impact, whether it's Facebook and a bunch of other things. But the next Facebook or the Google is not going to be the next Facebook or Google. It's going to be biotech companies that, now suddenly can do this. Now, what used to take scientists their whole career, and you could get awarded a Nobel Prize for maybe crystallizing a protein, you can do this in computer within, the time that you finish your coffee or sip a tea. It just got the Nobel Prize recently. It's dramatically accelerated. So that means a high school student sitting in in their garage can actually reason about, with some basics, reason and think about, how do I create a medicine? This is the problem and so on. That's not the whole place yet, but I think we are getting to, we already know there's a lot of targets for which we can be making drugs and so on. I think it's going to come to a point where it will be a garage-based startup, where there's going to be a lot more competition for trying to do these things. And then once you integrate some of these safety and other measures, and the regulatory gets better, it's going to sort of funnel more. Now, how fast the regulation moves and others, we do not know. That's something that's not in the control, but that's one way I think, you can still be profitable when you have low bar, a lot more competition, and then still have an equitable access potential.
Absolutely.
Just maybe to this value-based healthcare. So what I meant by that is that, at least in Europe, there is the concept that through the value-based deals for the government, you can ensure that the innovation in biotech or medtech can reach the patients on the better financial terms, meaning that you make a deal that you provide this innovation to the patients, and the government, once seeing the result on the population, funds this further. So it's kind of a bit shortcut too.
Yeah, we need every bit of expertise we can get, because working in the field, you need to have that knowledge already on hand when you're in the real time moment. So did you have anything else to share? Let's go to the final question. So just for sake of time, would regulatory reforms like AI, sorry, this is kind of going out on me, clinical trial approvals or tiered pricing mandates help bridge the gap between patients and access? So can this be a way out, I guess you could say? So would regulatory reforms like AI-driven clinical trial approvals or tiered pricing mandates help bridge the gap between patients and access? So how can we use that? Is that possible? Did you want to start? Anyone?
Well, I can start. I'm a bit pessimistic on the regulatory front. I don't see FDA quickly making their approval schemes more easy, so I'm afraid that it still will take 10 years to develop a new drug. It may be a bit faster with AI, but not much, I believe. On the pricing, maybe there is some opportunity. What's happening is that people do voluntary licensing, for instance, to low-income countries, give drugs for neglected diseases for free, actually. So that's something that can help. But I'm a bit pessimistic on these things, actually. Yes. So I believe more in the technological solutions.
I share Eve's pessimism, but I'm also optimistic that as there's more pressure from the patients, maybe the system will change. But yes, technology is something more in your control, and it has access to that phase one-ish clinical trial, and then after that, it's a bunch that's not in hand. So
thank you so much.
Hoping for the best.
I think we made our time now, unfortunately, but the only thing that I can say is tiered pricing does seem to be something that we should be able to explore more. So thank you guys for listening. Thank you for your time. And if you have any additional questions, we'll be mingling around. You can always come up to us and ask any one of us so we can go further with this topic. Thank you.
That was incredible. Thank you so much, panelists. Now let's turn our attention to another critical issue, supporting cancer patients through one of the toughest journeys of their lives. A cancer diagnosis doesn't just affect the body, it shakes a person's entire world. Beyond medical treatments, patients need emotional resilience, mental strength, and a strong support system to make it through. But are we doing enough to address the emotional and psychological toll of cancer? Let's explore the critical subject in our next panel. Emotional support is a must, helping patients get through the cancer journey. We have a fantastic lineup of experts awaiting, so please join me in welcoming our moderator, Rev. Dr. Lisa Zensky, for this session and all the rest of the panelists. Welcome.
Am I on here? Okay, good. Thank you all so much for attending. We really appreciate the opportunity to discuss this topic. So I'll start first and introduce myself. I'm Dr. Lisa Zensky, and my experience in the cancer world, of course, as a pharmacist, I was the person who, before we had laminar flow hoods, put too much pressure in a vial of 5-FU and had it aerosolize it to my eyes. I was very young then, but nevertheless, we're going to talk about the emotional journey of the cancer patient. And my last job before, 2 jobs ago, I ran a cancer center for a hospital. So I had pharmacy report to me, lab, medical oncology, and radiation oncology and research. So it really all fit nicely under my purview. So I got to see cancer therapy from both sides. I had a minor skin cancer, I had Mohs surgery, so yes, I am also a survivor, but not nearly to the extent of some of the folks here on the panel. Go ahead, introduce yourself.
So my name is Leila Morcos-Zissis, and I'm honored to be here with these panelists, incredibly esteemed. I myself am a breast cancer survivor. I was diagnosed in November 2020, and I'm really excited that we're talking about this as I'm having a medical menopause hot flash up here as we speak. Very uncomfortable and creating some emotions over here. But I am a professional certified coach. I call myself a professional evolution expert because after having gone through what I've been through and being able to serve clients, we are evolving our clients and working with clients. So I am a coach. And I have a women's organization called Like Minded Ladies. We have chapters both in New Orleans and on the Gulf Coast. And one of the initiatives that we're doing is trying to get some cancer robes for one of the hospitals. So I'm also faculty at Georgetown University working with students working on getting their board certifications for their health and wellness coaching. And I'm also a mental health coach certified as well, and we are backfilling quite a bit because of the therapy shortage that is out there right now, as well as the stigma with therapy. Coaching has less of a stigma than therapy for some people and for some cultures. But I do have a podcast as well, and lots of other ventures in the pipeline, so I'm just excited and happy to be here. I'm happy to be alive, right? Yeah, so thank you. And happy Mardi Gras. I'm here with my bestie.
I think you just speak.
Okay. My name is Robert Chistel. I'm Professor Emeritus of Pathology, Environmental Health Science and Radiation Oncology at UCLA, previously at Harvard. And I have 16 patents and 6 companies in healthcare. It's my mission in life to make all creatures in the world healthy, beautiful, and sane. And I can treat almost all, until now, incurable diseases. And I have lots of things for cancer, and I can cure almost all mental diseases. So I think my expertise is quite up the alley for this panel. And whenever you want, I tell you all about what I do for cancer and all about what I do for all mental diseases, maybe later in the discussion. And anybody who wants to connect with me, I'm happy to connect.
Hi, my name is Rob Hedquist, and I have my own company where I'm a psychological performance coach. So I work with executives, I work with leaders, I work with organizations to help individuals and organizations shift their mindset and their perspective and move more towards the positive solutions that are out there. I'm also a breast cancer survivor as well, so I'm in the 1%, as I like to say, of men that have an opportunity to experience what so many women have experienced. And I have a long family history of breast cancer. So my mom passed away of breast cancer, and I have two sisters that have also been subject to breast cancer. One of them has metastatic disease right now. So I know the disease very well, and I know the support from a number of different angles, myself and my mom and my sister. So it's a real honor to be up here with this panel today and to be talking about this important issue. So thank you.
Hi everyone, my name's Barry Warrington. The accent's from New Zealand, but I base myself out of Miami. I've set up an integrative oncology clinic in Thailand where we supported cancer patients through a variety of modalities and helping them get a positive mindset in dealing with cancer, among other things. So my background is more in managing those facilities until our family was struck with BRCA gene, so keeping on the breast cancer flow. And my mother recently just passed away from a brain cancer, which was meant to end her life in 2 weeks, but she survived 10 more years. So when it comes to support and being on boots on the ground, it's great to be up here with the panel and looking forward to answering some questions. Thank you.
Hi everyone, my name is Soumyata Saxena, and I have a background working in cancer research. So I used to work for Methodist Research Institute Cancer Oncology. So we would basically treat kidney and prostate cancer patients. Of course, with other bladder testes, and if it has like spread anywhere else. So I used to work in data analysis, working on manuscripts. So I have publications in PubMed and NIH on cancer research. And then, so from Methodist Research, I worked also for University of Texas oncology research. And so I've seen the conventional side of cancer because I worked in oncology, seeing patients come in through chemo, radiation, drug treatments. I've seen all of it, the clinical trials, the process with the IRB and everything. And so destiny would have it, after some time I just didn't like what was happening to cancer patients. It just didn't align with my values anymore. And so I said, I want to quit that job, And after that, I got cancer. So I had ovarian cancer. And it was pretty bad. So, but because of my background in holistic science and, coming from India and coming from, vegetarian diet already with spices and whatnot, thanks to my grandma, I already had pretty good understanding of the power of food, especially plant-based diet and spices and Ayurveda. And then I had the knowledge of the conventional cancer system and how it works. So I was able to say, I don't want to take the same route, even though my ovarian cancer was pretty bad at the time. And, so I just went for the surgery. After the 6th day, we were out. The doctors wanted me to do chemo, radiation, and they were like, you will not make it for 5 years, and if you don't, I just said, okay, we will see. And I just said goodbye to the doctors. And I came home, started making the recipes like my beloved grandma used to make for me when I was a kid, when I was super healthy, going back to the Ayurvedic science of India, and also using the nutritional knowledge that I had learned in America of whole food, plant-based diet, and combining both. And my body came into balance because the doctors had told me you will not have your periods for 8 months. Doctors just say things which they are not supposed to say. They are not gods, for God's sake, So it is like, oh, you will not have your periods, you won't live for 5 years. And I said, okay, we'll see. I just went home, started cooking, home-cooked meals, and my body was perfectly in balance, and I had my periods in 2 months instead of 8 months, I looked at. And that was, I'm going to be 11 years cancer-free in May. So thank you, guys. Thank you. Thank you, yes. It's going to be 11 years. When I had my surgery, it was in 2014. 2014 May, and so it will be 11 this year. And so I just thought, I have seen enough and I know so much and I have done publications as well, so why not teach people the truth? Because we have been so denied from the truth because of the big pharma, the money that the word cancer makes. It's $1 trillion industry and the corruption. So, and I was like, this is so easy, And people don't have to lose their arm and leg to support themselves through cancer treatments, and they don't make it, and the family has to pay afterwards for them. So I started launching my YouTube channel where I started teaching people how to cook plant-based recipes with my special knowledge of Indian Ayurvedic science. Spices, we come from a culture with a lot of spices, garlic, ginger, and turmeric, and things like that. And using plant-based diet, pure ingredients, organic ingredients. So I launched that, and I launched my business, The Garden Recipe, and it goes globally, where the newsletter goes out, health, holistic articles on medicinal herbs. They're educating people on different things like fasting. So it is a combination of lifestyle habits, practices, and what you eat. Recipes go out as well. Then I run courses for women to prevent or heal cancer, and I have coached cancer patients, and I continue doing that. So I have a YouTube channel, and I have a full organization that has a newsletter, courses running, and more to launch this year. So that's what I do. Yeah.
Congratulations.
Thank you so much.
On your survivorship. That's wonderful. So the first question I have for the panel, if it's not too invasive, could you tell us a little bit about how you felt when you first got that diagnosis?
So my journey is pretty unique because I was always very intuitive from the very beginning. So as I've written on my website also, and I shared last year when I was at a health conference, I actually had a history of ovarian cysts when I was young at the college with friends eating the cheapest food and chicken and KFC, and you don't ever think twice and having like dairy milk and stuff. So I just had really bad habits. So from having a perfectly healthy body that my grandma raised me, I messed it up completely, very bad during all those years, and eating a meat-based diet and whatnot. And that's when I had ovarian cysts. And I also I have to absolutely say I had a lot of trauma. I had a lot of trauma, a lot of personal struggles, and even with my parents, not a blame game, just with my parents. My grandma raised me. So I did have a lot of trauma and stress. It was just ongoing in my life, Okay. And after the ovarian cyst, after 10 years from that, it's when I started having bleeding. So I had bleeding nonstop for 3 years, And when I say nonstop, it was like nonstop. I was working at the University of Texas, and it was just like nonstop. But I spiritually knew that this is what my body needs to do, because I believed in my body more than anybody else. Right. And I didn't tell anybody, because telling your family and friends usually means their advice, unwarranted advice, when they cannot even live their life without cabinet of pharmaceutical medicines. Don't give me advice, Dan, because you cannot even walk from here to there without panting. So don't give me advice, Dan. So, and I was living very active. I rescued dogs, and I was walking. By God's grace, I was very healthy weight, healthy skin, hair. So I was like, I'm going to let my body do what it needs to do. I was bleeding, and for me, it was a transformative experience to bleed, to see my own blood coming out and new blood forming, and God sustained me. I kept working. I was very active. After the 3 years, my cancer, it grew, okay? Yes. So, I was looking pregnant. So, and I let it grow because my understanding was my body is pushing to heal. It always pushes itself to fight for life. It's not trying to die ever, It's a natural law of the body. So basically, I just said, okay, now it has grown enough, and it was blocking my, the flow of the blood. Yeah, yes. And I just said, this is the time to go, and just what I wanted. I went to the hospital. They said, you have to do surgery. I said, perfect, go for it. So they did the surgery, took it out, and I said, then they wanted chemo radiation, and that's when it was official, like my family and friends, everybody found out, like, okay, this is cancer, Sure. I already knew it was cancer because of my intuition and knowledge. So they took it out, and my surgery was at Bantop, a wonderful staff, wonderful doctor. They took it out, and I said, after that, I just went home. 6 days, they said, you can go home if you want. If you don't want chemo drugs, you can go home. We came home on the 7th day. I never went back.
That's really interesting. That's a very clear and powerful choice that you made for yourself.
Thank you.
So let's go back to the question. Yeah. How did you feel when you were diagnosed, if you choose to talk about that?
Me?
These guys.
Oh, sure, I'll be happy to. I think that, I don't know how to describe it. You go through a myriad of emotions. Like you start with, I think, disbelief.
Right.
Is where you probably begin, and then you get into sadness, and then more disbelief, and then fear and panic. So
you're
there's
pendulating.
there's a whole myriad of emotions that occur, and I think that that's one of the challenges that you have when you're trying to provide support to somebody that's been diagnosed with cancer. Where are they at on their journey? What type of support do they need, and how do you best provide that support? You know, interesting, I mean, I had a wonderful medical team, you know, from my surgeon to my oncologist, but, you know, I was thinking about this in preparation for the panel. I don't think that at any point in time did anybody ever ask me, what emotional support do you need? What type of mental health support do you need in this journey? It just never came up for discussion, and I don't know that at the time I would have been open to it, if I'm quite honest about it, but I think looking back retrospectively, you know, hindsight being what it is, it would have been nice had somebody asked me that question, because it would have made me, at least put me into the mode to begin to think about it, because it didn't really jump out at me, hey, maybe you need to get some professional help to deal with the diagnosis and the ongoing, you know, procedures that you're going to need in order to be able to get cancer free. And so, you know, that journey was, you know, back in 21.
That's
so
not so long ago.
No, 21's pretty
Yeah.
for me anyways, it's pretty recent. So that was my experience as it relates to this. Is a myriad of emotions, and I know I had people around me that could support me, but you know, we could get into the whole discussion with regards to male versus female dynamics and how men show up and how women show up, and you know, a lot of the stereotypical kind of mental juggernauts that we all put ourselves through, so to speak. And so it was you know, it was an interesting diagnosis for me, and an interesting journey. So for sure.
Thank you. How about you, Layla?
I said I don't have time for this. That was the no. I really did it.
I like that.
No, I mean, so so my best friend and I, we started a tradition. We would go get our mammograms together every year, and then make a day of it, go cocktail, go have some fun. So the last time we did it was in 2019, and then COVID started, right? My mammogram in 2019 was totally clear. Everything was fine. We enjoyed our cocktails, had a wonderful day. Come 2020, we could not go do mammograms by ourselves. We were in the middle of COVID, so I was going to just brush it off and not even go do it. My OBGYN was like, Layla, just go do your mammogram. Went to go do my mammogram, and within 1 year, my entire left breast had to get removed. Cancer had gone into my lymph nodes. When I found out about my diagnosis, I was actually with my husband, who had just gotten diagnosed. Typical fashion for us. Got to have humor, guys, as well. That's a big strength. But he had just gotten diagnosed, and we were coming down the elevator from the hospital with a spastic esophagus. So we were leaving his gastroenterology appointment, and we got the call in the car, and it was goofy. The car was like connecting to the phone, and the phone was connecting to this, and we hear your, you know, you have breast cancer, and we're like, what? So it was just, that was my experience. And when we were driving home and just listening to my advocate, we were both numb. We just were quiet. We were in complete disbelief. And then the emotions come. You're in disbelief, then you're in sadness. You wonder if you're going to die. And then, you know, for me, it was a big double whammy, because I had gone through years of fertility treatments unsuccessfully. And I think that plus grief was the main reason that caused me to have this. And I just had a client text me, 37 years old, one of my coaching clients. She rung the bell today at Memorial Sloan Kettering. So, you know, up here, being a cancer survivor and being there for your clients is an incredibly powerful relationship.
It is.
And it feeds you and it gives to you. So that was my experience. But in a nutshell, really, what fueled me was, I do not have time for this, and I'm going to kick this shit's ass. And I did.
And she did, yes. you know, the little bit of tears that you had there made flashback to when my mother-in-law was diagnosed with lung cancer. She smoked since she was 17, and we're in the hospital room, and I took that packet of cigarettes, and she said, "I'm going to quit." I said, "How about now?" And I threw them in the trash. So she had 5 good years because her son and I decided that we would make whatever she wanted to do fun and exciting. So she wanted to go on a trip, no problem. He'll drive her to the boat, you know, whatever those are called, cruises. So having family around is helpful. I became her major caregiver, but my son had an experience. He was in nursing school, so he moved into the house with them. And, you know, when your white blood cells are low and you are really feeling crappy, he recognized that, got grandma treatment that she needed. And so I'm remembering all of those feelings that I had being her caregiver, that her son was of no use. I eventually divorced that guy. So her daughter lived in Chicago, came for a fun weekend, dragging her everywhere that she wanted to go. And I'm thinking, she shouldn't be out and about. You know, her counts are low. She could get an infection of sorts. So when that happened, I realized I needed to step up, you know, and she really relied on me. And I was with her through her last breath. And that was truly an honor to watch her pass. Her kids weren't there. I was there. So I think back on that experience. I think that helped me when I went to Wheeling Hospital. And Wheeling Hospital, West Virginia, not Illinois. One of the things that we did was develop a nurse navigator program. Did you all have navigators? Do you all know what nurse navigators for cancer are? They are specially trained in their particular disease, but they coordinate everything from labs to x-rays to you name it, even appointments with their regular doctors and dentists. Whatever they needed, they were their go-to person. And that took a lot of pressure off the person, knowing that they had someone in the medical field that they could go to and talk to. You know, a lot of times people going through cancer won't talk about it with their family. But yes, with the nurse navigators, they were able to open up and really have their feelings addressed right there. So I'm really proud of that program. I'm sure it's dismantled now because everything is different, but
on that note, my nurse navigator, she
Yeah.
actually is a cancer survivor. My oncologist had cancer. My breast surgeon had cancer.
Wow.
Yeah, and just for people who, I had stage 1, and I still had to get a mastectomy, radiation, and chemotherapy for 9 months. So, I mean, it's everywhere. It's shocking. I mean, it really is. So those nurse navigator programs are really helpful because when you are diagnosed, they start giving you books, and they give you this, and they give you that, and they give you this, and you're just, I didn't even know what my diagnosis was, I don't think, until I was well into my chemo journey. I was like, what do I have now? HER2 negative, ER positive, what is that? Like, you're just so overwhelmed.
Exactly.
Yeah.
When you get that diagnosis, I think overwhelm is one of those emotions that comes on because, first of all, if you're not in the medical field, you have no idea what's going on. And I've seen it where they have a diagnosis and the next day they're in surgery and they don't even know what happened. You know, they didn't have any time to process that. So having a contact outside of the family, I think, is also important. So would you like to speak to how your family dynamics were?
Well, my marriage basically disintegrated in the middle of it. So
I'm so sorry.
That happens.
That
My
happens a lot,
acupuncturist told me
Yeah.
that marriages end.
Yeah.
I was shocked.
So, which was really unfortunate on a number of different levels. But what I really wanted to talk about was kind of, you know, I didn't really have a good understanding of what health equity really meant and disparagement
Yes.
in the health sector until I was diagnosed with a disease that primarily affects women. And I was handed all the patient ed materials, and they were all for women. I was like, wow. You know, and so from my perspective, it's, you know, it told me a lot about how unequitable the system is from both a cultural standpoint and even a sexist standpoint, you know,
Sure.
and how we don't give enough attention across the board. And so it really highlighted that particular piece for me and really brought home the need that we have to develop decent materials for all the different individuals that may actually be suffering from any particular one disease.
Well, and I will say on that note that my business partner and I, we decided to go ahead and we're going to have a guest. All of you, we would love to have you all on our podcast, but I do have a podcast called Breast Cancer Unleashed. And one of the reasons why we did start this podcast is because a lot of the physicians, they weren't actually talking to us about the things, like they didn't have all the answers for us. There is now an integrative physician that, and I'm in New Orleans, so I went through the Ochsner Health System. They're now partnered with MD Anderson. I got all of my second opinions at MD Anderson in Houston and decided to do treatment in New Orleans because essentially their recommendations were the same. So I just lost my train of thought. That's part of cancer. I'm so sorry. What was I just talking about? The podcast. So one of the reasons that we wanted to do this podcast is because we wanted to be raunchy. We wanted to be raw. We wanted to talk about all of the disgusting things that people are embarrassed to talk to their doctors about. We have podcasts about the emotional toll on the families. We've had psychiatrists on. We've had psychologists on. And we even, you know, we go everywhere from talking about that to, you know, all of the nastiness that's going on here and CBD and all the things. And, you know, really it is for women. And I'm excited that you're the first man with breast cancer that I've ever met. In my journey, I'm 50 years old. So.
Thank you.
So, Dr. Schiestel.
Okay, so I fit in this group of
Use your microphone.
Okay, so I fit in this group because I don't have a prostate, but I choose not to talk about this at all. Now, let me tell you what I do for cancer and for mental health. So, this is my 15th patent. My chemical is an anti-cancer agent. It stops the proliferation of cancer cells and it prevents cancer. So, I have people on Lymphoma Watch and PSA Watch. None of them developed cancer yet. And so I can deal with stage 1 and beginning of stage 2. And for stage 3 and 4, it gets rid of the side effect of chemotherapy. And 33% of all people die from the side effect of chemotherapy, not from the cancer itself. Then the cancer is smaller than expected if it's cut out, because it doesn't proliferate further. And the second chemo is no problem. And it has very surprising effects. That's also why I'm in hospices right now. Because I had a 68-year-old woman with rectal cancer stage 4, metastasis all over her body. She already was thin and frail to start off with, and then she got chemo, which pushed her over the edge. She became incoherent, couldn't eat, couldn't swallow anymore, and was kind of in coma. And then they asked me whether I can do something with that patient. I told them I have no idea. Let's try something. It's a clinical trial. So the nurse put my chemical in her mouth. 2 days later, she gets up from her deathbed, goes to the fridge and starts eating and gained 8 pounds. So as long as they're still breathing, I can help them. So actually in hospices, this is absolutely wonderful because they can still talk to their grandkids. They're still hungry. They can still participate. They don't die from starving and in pain. And at some point, something gives in, either the brain or the heart, and they pass quietly and happily away. And now what I can do for mental diseases, I can cure actually all the mental diseases. Whether it's ADHD, PTSD, schizophrenia, bipolar, Huntington, Parkinson, Alzheimer, dementia, addictions, aggression, whatever you want. So anyway, anybody who wants to connect with me, I'm happy to. And I know actually the wealthiest people in the world. Thank you.
So you are the true scientist on the panel as well as...
Yes, I do clinical trials worldwide, and I ship my chemical worldwide. I just talked to a huge consortium of cancer doctors in India, and they want to invite me there. Yeah.
All right, wonderful. Keep up the good work.
Sure.
Yeah, it's definitely needed in the world.
Yes.
So Barry, what do you have?
So I was working overseas when my phone rang and Mum's got cancer. She's got 2 weeks to live. So I wasn't the diagnose of receiving, but I was receiving the news. And yeah, I think for the family, you just don't know where to go. And mine was anger, like boiling over anger. But I would say that what I learned in running the integrative oncology business is, I'm not saying that emotions cause cancer, but there's definitely not helping you beat cancer if you're keeping emotions trapped inside. So running that integrative oncology center, we saw a full spectrum of emotions come out. And I actually remember an Irish guy, and if any of you know Irish people, they like 4-letter words and none of them you can say in church. And he got up in my face and he got really angry. And then he went for a walk and he said, I need a psychiatrist. I think I know what caused my cancer. So I would say that the mental journey, the physical journey is all connected. We try in conventional medicine to separate things. In holistic medicine, we try to bring things together. And we often have a conflict there because we have this line and we have this line, and the distance between here and here can be very big. Correct. So I would say for anyone going through the journey, and unfortunately just from those statistics, if we haven't already, it will come up. Being able to be there as that support and talk out everything is very important, because it can be something so small or it can be something so big. So that's my personal
I agree with you. You know, having someone to talk to that's not your family, you know, to process all that, what's happening to you in the moment. I would agree with you that we should include those folks, the mental health folks, in things like tumor board, where we go A to Z on what are the options for this patient, and they put the pathology up, and there's lots of discussion, and it's very interdepartmental, but the nurse navigators are there, of course, but they've got other responsibilities. It certainly would be nice to have someone be available to talk things through. And I think anger is probably one of the earliest emotions. I think your response by saying, I don't have time for this. That's like an anger response.
It was so aggravating, and I went to one support group. One. It was so depressing, and I was just like, these are not my people.
Yeah.
Like, it was terrible. Like, I was like, yeah, I'm not going back to that. That was awful. They were depressed. They were in their disease. And because I know emotion, because I'm a coach, because I'm trained in this, because I know what evidence-based, and I use this on myself, you know, one of the biggest things that we all had to step into was really the acceptance of this, right? And really that internal shift. But, you know, my husband, he ended up, you know, relapsing during my cancer. He quit his job. He needed his own mental health instability. Now he's just fine and everything. But he was the one that was really even struggling more, it seems, than I was. So it's not just mental health for the patients. It is mental health for the entire family.
Yeah, we used to say at Wheeling, if the patient has cancer, the family has cancer. You know, it extends its tentacles out to everyone in the family. So it's oftentimes, if you're the caregiver, you know, this gets me to respite care, that you can really burn yourself out from that. And so one of the things that eventually I would like to do is have a respite care center where people could bring mom along who has the disease, and you take a good nap, you know? So the patient is well cared for, and you are also caring for yourself. So
I just want to add a point to that. So when I went through, as I said, it wasn't really in my case like a cancer diagnosis and going through emotions, because I already had 3 years of bleeding and a history of ovarian cyst. I didn't tell anybody. There are only 2 people who knew about my bleeding, and one was my best friend and one of my aunts, okay? Because I knew just telling and sharing this is happening would be an influx of unnecessary advice, unwarranted advice from people who can barely take care of their health and do not know health at the root level. And I was not interested in conventional drugs or radiation to kill myself. I want to live, and health is our natural state of the body. So I wanted to just keep everybody out. So in my case, I was just pulling my own wagon, and that was my peace of mind. But having worked in cancer research and having gone through this experience and knowing that how much support cancer patients need, because I would see them coming, looking fairly healthy, but by the time they would leave the chemo or our hospital, they're almost dead or skeleton-like, okay? So I didn't like the system because it was taking their money, but killing somebody who's actually pretty fairly healthy, And so, because cancer is just an imbalance, it doesn't mean you are not completely healthy, but doctors will make you feel like you're just close to your graveyard, It's like, just go and stand there, you might as well, So when I launched my business, one of the unique aspects of my work is that it's not just about, hey, eat this. I'm providing you support through the YouTube channel and teaching you, Ayurveda and the most strongest holistic science, your lifestyle habits, through my video and recipes. But I'm also providing you actual tips like fasting and medicinal herbs. But what else can I do? So then I launched spiritual section for my business, or if you were to go on my website. So each newsletter that goes out, each narrative, each article is focused on certain like emotions. For example, the power of gratitude. This is really powerful for cancer patients. It is like night and day, not just cancer, anybody going through trials and tribulations in life, like we all go through. Okay, I use empowering stories, near real life narratives, like people who I've met and how they are using their cancer diagnosis for their purpose. And because when you go into your purpose mode, or just like gratitude, it shifts your energy, because it's no more like victimhood, it's more empowerment. So it shifts your energy. And so it's in each newsletter and through my, what I teach, there's a whole section on spirituality, like mindfulness, And another thing, I don't know if a lot of people know here, one of the powerful things that I tell people is just join the EFT organization. It's like emotional freedom technique, tapping on and releasing the emotions. It really works. So you can check that out if you're interested. It is EFT.com, something like that. And
yes, I find that very helpful as well.
Yes.
The first couple times it didn't work at all, and I'm like, this isn't going to work. But when you stay with something and you have the intention that it will help you to heal. In my case, I had an adrenal tumor. I forgot about that. I had an adrenal tumor. I pushed myself so hard working as the sole breadwinner of the family that I burned myself out pretty bad. So thankfully, I went to the Cleveland Clinic, and it was a benign tumor. So I didn't want to go to Orlando Health and have the tonsil surgeon that also does gallbladders take out my adrenal gland. So advocating for yourself when you have a diagnosis, and honestly, I think it was a pheochromocytoma, but nobody gave me that diagnosis. The day before surgery, my blood pressure was 190 over something very high, like 120. And they had a conference right there in the anesthesiology. Do we admit her today and bring her blood pressure down before surgery? So anyway, it all turned out just fine for me. It has taken me a while to bounce back. But I want to get over to something that you said, Barry. You were talking about pushing emotions down. That's what I heard, but it wasn't necessarily how you phrased it. But I think you're absolutely right that we as a society, at least my generation, we pushed it all down. And I think we pushed through too much. And that's how I think I got my adrenal tumor. I wore the darn thing out. So recognizing that you're doing that, I think, is part of the healing process. So you can heal, but not necessarily be cured. And specifically what I mean by that, let's say you have a tiff with your brother and you haven't talked to him in 20 years and now you have this diagnosis and it brings you closer together. You've healed that relationship and the contact with that. There are many ways that that happens through cancer therapy. It's not necessarily curative, and thank God you all survived your cancers. But there are other healing aspects to it. Do you have anything to add to that?
The only thing I was going to add to it is I don't think that the emotional journey just stops for the cancer patient once you have your treatment's complete. So the surgery or the rounds of chemotherapy, that's not the end of the journey. That is just one portion of the journey. You have, the follow-up phase, and you have the worry and the concern. Hey, am I going to have a reoccurrence? And what does that mean for me? And what does that mean for the people around me that love me? So the emotional piece, and I really appreciated Barry's comments, is that, you continue to have to lean into that emotional piece and lean into that thought process of where am I actually going with my thoughts? Are these healing thoughts, or are these thoughts that are actually going to bolster my system to actually be in fear, fight, or flight and stimulate potential regrowth of the cancer? And so it's important, I think, from an emotional journey standpoint, when you're working with cancer patients, to understand it just doesn't end when the treatment ends. There's a whole component that needs to continue for those patients as they move farther and farther away from that initial diagnosis and interventions.
That's a great perspective because, once the treatment is over, you're kind of left hanging, and then it's the 6-month checkup. And it's, my husband has a thyroid cancer survivor, and when those scans come around, it's like, here we go, and a sigh of relief, So I understand what you mean by that. And I think we let people go too soon. I think that you bring a perspective there that we should support people post-cancer in survivorship. World Cancer Day is in February. Survivorship Day in the U.S. is always the first Sunday in June. So, celebrate yourselves, really. You did the hard work, and you made the hard choices.
I just want to add really quickly, because when I worked in Methodist and University of Texas, it was all about, because I would meet the patients, and we had like 20-page questionnaires. So I was really the first point of contact to meet with them, just to go over if they have any questions, to make sure we have good data for clinical trials, that we were working on manuscripts. So I think one of the most important things that was missing and should be is teaching cancer patients and their families certain emotional tools, to balance their emotional and mental well-being. So for example, having an EFT counselor there, it is nothing but holistic, and it works, teaching them the power of words. Words matter. I am, and whatever follows after that, is that it? If I'm sick, I am sick. If I'm healthy, I'm healthy. So teaching the power of affirmations in the morning when they wake up, teaching them meditation, yoga can be really powerful for them. I just want to act really quickly. I don't know who could be listening and who could just be benefited from this. This is a very powerful therapy that can overnight change your life and change your health and can heal your cancer. And that is having a glass of water. Because Dr. Emoto has proved that water molecules change according to our emotions, because we all are connected to the whole universe. Having a glass of water, saying powerful things to it. I'm healed, I'm whole, I'm healthy, I'm beautiful, I'm alive, I'm living a purposeful life. Leaving it overnight, for example, in the moon energy, and every single day, drinking it next day. However the water goes, if you're angry, upset, depressed, that water molecule goes into all cells, and your cells dance to it, okay? If you drink water that is empowering, because we are made up of water, so is the earth, it changes that. This is a very powerful, scientifically proven therapy to healing yourself.
That's a really practical thing that all of us here can do, whether we're cancer survivors or not. I think we're basically walking around dehydrated, especially now that we're in the desert. So I like
things
that.
to the water, it will do the work. It's that simple, you know?
Yes.
That's it.
Yes, very good. Any other questions or concerns? We're done. He's like, okay, we're done. Listen, thank you all so much. You all brought a wonderful perspective to this.
Thank you so much, panelists, for that. And I'm going to keep that in mind about the water. While science works towards a cure, emotional support remains one of the most powerful tools in a patient's journey. Now, let's pivot to another critical subject, the fight against Alzheimer's disease. Despite decades of research, early detection of Alzheimer's remains one of the medicine's biggest challenges. Keeping this in mind, in this next session, early detection and diagnosis of Alzheimer's challenges and opportunities. Our experts will explore the latest breakthroughs in biomarkers, imaging technology, AI-powered diagnostics, and genetic research that are changing the landscape of Alzheimer's detection. But with early diagnosis comes another dilemma. How do we prepare patients and families for a disease with no cure? Please welcome our expert panel and moderator, Stephanie Oden, Executive Director of Valley Silvertown, to shed more light on this next subject. Welcome, Stephanie.
I think I have a big mouth, but I'll use this anyway. So, hello everyone. My name is Stephanie Oden. As she said, I'm the Executive Director of Valley Silvertown Assisted Living in California. We are an assisted living and memory care community. I want to start off with my why this is so important to me. My grandmother was diagnosed with Alzheimer's, and she passed away in 2006. And I take care of residents that have Alzheimer's and other dementias. I am also a facilitator for support groups, and I also do Alzheimer's discussions and talks for different groups such as this. So that is part of my why I'm here. Dr. Nikos?
Hello, nice to meet you. It's a privilege for me to be here among you. I'm a doctor of naturopathy with a great research based on the human biofield. And I would like to speak about prevention before having any physical symptoms. So I am also the director of Humanopathy Academy, an academy that is training doctors on a holistic system, how they can diagnose what's hiding beneath the disease. And I will be delighted to talk to you about this also.
Thank you.
Hello, everyone. Thank you for having me here. My name is Reza Abduli. Is it turned off? I don't know. Hello? Oh, there we go. All right, sorry. So my name is Reza Abduli. I'm here from the Pulse GPM. I'm co-founder and the CEO. What we do is bring in the ChatGPT to healthcare to help and optimize the hospital operation and also improving the patient care. I'm glad to be here to be discussion about Alzheimer. I believe many of us have someone in the family as affecting this disease. We are hopefully to have some discussion to gain some information from this panel. Thank you.
And you again, sir.
Yes, me again. I'm still here. So my name is Robert Chistel. I'm Professor Emeritus of Pathology, Environmental Health Science and Radiation Oncology. And previously at Harvard. I have 16 patents and 6 companies in healthcare. And it's patented in 157 countries in the world, all countries that allow patents. I think the title should be a previously uncurable disease, because you guys didn't know about me. And not that I can cure Alzheimer's, but I can stop the progression of Alzheimer's. Should I talk about this now?
Sure.
Okay.
Yes,
Go ahead.
Why not?
Sure.
That's my 16th patent. So what the chemical does, I cannot revive dead cells.
Dr. Robert, can you move the microphone closer?
Yes. So that's my 16th patent. So what the chemical does, I cannot revive dead cells, but it stops the proliferation of dying cells. It stops the cells from dying. It's very neurogenic, my chemical, actually. It reconnects nerve cells after surgery. It's very neurogenic. That's why I can cure also mental diseases, and it actually makes you see better because your retina and your optic nerves are nerve cells. Anyway, so it stops the proliferation it stops the degradation of cells, of neurons. And then 50% of all Alzheimer's patients also have depression. I can also cure depression. It gets rid of depression within a week, the fastest ever. And then, because the progression is stopped, at some point people feel better almost immediately or within a week, and then the brain is very malleable. So other brain regions can take over, and it's a slow relearning process, and then people remember things better. So it's not a cure, but it's stoppage of, you stop the progression, and then people remember things better. Similar to what I can do for Parkinson's. People start then moving better. Yeah.
Thank you, Dr. Robert. I wanted to say, in my experience with dementia and memory care, usually by the time someone's diagnosed, it's too late for intervention. It's too late for treatment to slow the process of the disease down. So I want to ask you, Dr. Nikos, what challenges have you seen with early detection of Alzheimer's or any dementia?
Well, first of all, I would like to think about what's hiding beneath the Alzheimer's disease or dementia. And most of the times, toxicity is the main factor. Toxicity that can come through heavy metals, that can come through radiation, or even viral infections. And the other thing that is involved with any neurodegenerative disease can be also the emotional factor. I mean, if we can study the personalities of the people that are more easily to get Alzheimer's or dementia, you might see that there is a pattern. So in our practice and in our training, we're trying to guide professionals how they can address the root cause behind any disease. My latest experience is with my mother. After COVID, she had dementia, and this came very intensively and very fast. So, trying to support her, I tried prescribing her a combination of different homeopathic remedies, and she had a great improvement because the archetypes and the frequencies of different remedies can charge and can boost the patient's energy. And you can see that my mother now, she can speak, she can walk. And the only thing we did is a combination of different homeopathic remedies. But these remedies are also connected with her personality type. So we can see there is a connection between your personality, your height, your character, your mindset, and the development of the disease. And that's something we want to train people, doctors or therapists, to be aware so that they can guide it, what's behind the disease. And speaking about prevention, prevention means that if you have these protocols, if you have this research showing what type of personalities are more possible to develop dementia, that's where prevention comes. So we can have a research, and our Humanopathy Academy will be delighted to host this research so that people can study in different groups, and we can see which homeopathic personalities are connected with dementia and Alzheimer's, and then we can have much better information.
Riza, I send you the same question.
Absolutely, that's a good discussion. So as we all know, 60% of the diagnostic people to the Alzheimer has been the latest stages of the Alzheimer that has been detected. So unfortunately, many of the PET scans, lumbar reductions, and everything, treatment comes very last. And one of the major problems is we need to go by the genetic types. go to the MRI scans to understand the patient much earlier stages before it's too late, before it's the nervous damage has already happened and everything get make difficult. So by mean that, so one of the major problems, that's one of the major problems we do have. So one of the solutions is come up right now. It's using that's the perspective I do have. I just want to share with the members here. So with using the AI, so they're going to understand the MRI scan and everything. They're going to do the speech learning from the patients. They're going to detect the movement of the patient. So if there is any new movement or changes in the normal patient acting, they're going to understand it. They're going to do the alarming for the prediction of the Alzheimer. So that's the key we need, I believe, to add these technologies to our diagnostics process to make this life of the patient more expanding and more easily, and also reducing the cost for the treatment in the later stages.
I have a question. How can we go about diagnosing the correct dementia sooner? We have Alzheimer's dementia, we have vascular dementia, Lewy body, Parkinson, there's so many. What do we need to do to diagnose the correct dementia sooner so they get the right treatment?
So I believe one of the main reason is the family has already been affected. So for example, like a cancer. So we knew if you have a family member affected with cancer or Alzheimer, you have the potential to get Alzheimer. So if starting the treatment and starting doing the scan, regular scan, MRI scan, or PET scan, it's going to be crucial for you. It's going to help you to preventing, or you're not going to even have it, but just in case, to just have understanding about the future, what happened to you, to better understand situation. Start earlier, not just postpone it to the later, acting like, no, everything good, because we don't know all of a sudden it's happened and it's too late when it's happening. Because as I mentioned, 60% of the diagnostics are the very last stages, which the treatment is almost limited. We're not able to do the treatment. So regular, if you have a family members has these diagnoses, so please keep do the PET scans, MRI scans, and treatment. Share that with your doctor, so they're gonna give you the related test, so they can understanding and track any changes in your behavioral, so they can change it. They can understanding and let you know if there's gonna be something new happening, and they're gonna share with you.
Dr. Robert, would you like to add to that?
Well, the detection methods become
Closer,
more and more
closer.
The detection methods become more and more sensitive, and I have beginning stage Alzheimer patients, so there are really a whole spectrum of them, and I also have to emphasize that, at least for me, nothing is too late, right? So even if with progressed Alzheimer's, they still feel better, they live longer, and they remember things a little better. So I'm even in hospices now, okay? So, and for hospices, it's perfect. They can still talk to their grandkids, and they can still participate. They are hungry, and at some point something gives in. Either the brain or the heart, but they don't starve in pain like nowadays, but they quietly and happily pass away.
Dr. Nikos?
Well, that's a very interesting information, but the thing is, this is not prevention. This is improvement of the symptoms and improving the life of a patient. But when we research a disease from the perspective of a biofield, of the energy field around the body, which in fact is part of our existence, we can see that the disease first manifests on that energy field. So that energy field is a field that has awareness, it has a field that has subconscious information, and when we are saying that in a family that has some cases of Alzheimer's, of another, or dementia, you are most probably to have this, to deliver that kind of disease, we have to consider that this biofield in the family, we have a connection. It can be epigenetic connection, DNA connection, but it doesn't have to be only the genes. It can be in the energy. So for me, being able to detect what happens in your biofield and being able to understand if there is some kind of a biofield interaction and willing to disconnect from the body, then this is a thing that we have, and it probably can be connected to depression or a stressful life or different, or a mindset developed by the community or fear. Then we can go beyond and try to release this energy from the biofield in the body. And so we have much more possibilities not to develop diseases like that.
So, Riza, I have, what would you say to your colleagues or peers, or if you were in a room full of medical professionals and they wanted to learn how to, or not learn, but learn, well, be taught how to, diagnose sooner, or what resources are available to them so they can diagnose their patients sooner? What would you tell your colleagues or peers or medical professionals?
So that's a really good question. So right now it's happening. Right now we're using the AI. So what the AI doing is there are the models. They can understand the MRI of patients and so similar patient for many patients and the back histories many times. So the model is gonna understand the tract of any changes of the behavior of the patient. So the models we are using and implementing into the healthcare is, so since they have a variety of the data sets and variety of the different tests, from the blood test to the PET scans to the MRI scans, they can understand and give the related of the prediction for the patient. There are some hospitals currently using AR models and give them 90% accuracy of the prediction of the Alzheimer for the patient. So these are the happening right now, and so many of the healthcare services are providing this type of technology, machine learnings, and AI models to predicting of any sign of the Alzheimer for the patient. So these models, still, I just want to mention that still there is so many negative side on that, because we need to make sure the privacy, we need to make sure some of the tools of the taking the test need to be FDA approved. So these are the concerns we are still concerning for the AI models to predict in the Alzheimer, but so many cases has been happening already. As I mentioned, 90% accuracy of the predictions. These are the technologies we need to implement them to make our life much easier. And one of the I just want to mention, the AI is not replacing any doctor or medicine services. They're just empowering them, just to help them understand the situation of the patient and how we can improve the health of the patients.
Yes, we definitely still need our physicians. Dr. Robert, have you had any experience with training other physicians about early detection or, different, early detection? Have you done training? Pick up your mic.
So actually, the methods become more and more sensitive. You can have all kinds of tests for early Alzheimer's, whether those are language tests or memory tests, and they can be guided by AI or whatever. And there are self-tests, or you can do that in the clinic, to diagnose lapses in memory and repeated lapses in memory. And everybody actually probably knows themselves if you lose your keys or somewhere. And if this happens repeatedly, then might be at some point you might need some help. Not if you're young, but once you're up. So Alzheimer actually highly correlates with age. So the older you are, the more likely you are to develop Alzheimer. But yes, methods become more and more sensitive, and they get younger and early and earlier stage Alzheimer patients.
Dr. Nikos, in your mind, what would be some of the outcomes for patients and families with earlier detection?
Well, if we have an early detection, they wouldn't suffer for the disease. But the thing is that how do we detect? We detected the disease when it starts having physical symptoms, or we can detect the pattern before we have physical symptoms and be discovered. For me, we have to go beyond that and try to understand what's happening in the body, and especially we can connect a lot of brain diseases with the gut. So the gut, a leaky gut, is directly connected with toxification of the body and the brains, and then the leaky gut is also connected with depression, sadness. So if we can find a pattern before the Alzheimer's disease or dementia will develop, then we have real prevention. For me, we have to work on that, on nutrition, the leaky gut, and then the research of the emotional pattern. For example, one of the remedies I prescribe for dementia and Alzheimer's is opium. And opium is a remedy that indicates that somebody is willing to go away from the problems of everyday life. So opium as a homeopathic remedies is treating symptoms that opium can create. So you can see that there is a pattern. When somebody needs something to be detached from a very negative life that is bringing him misery, the brain finds a way to be detached, and we can see diseases like that being developed. We are living in a society that is not so friendly, and also there are a lot of toxins everywhere, radiation, heavy metals, bad nutrition. So we have all the things on the table that can provide such a disease. For me, prevention is take out all of these parameters from our table, and then we will not have the development of the disease.
Dr. Robert, have you prescribed any of the new medications for dementia treatment, like lecanemab?
Actually, I have developed my own medication. I don't prescribe any other medications because nothing else works better than mine. And the unusual thing of my chemical is that, first of all, it's the only substance in the entire world which doesn't have any negative side effects, and therefore I don't even call it a drug or pharmaceutical. And so far, since 3 years we are doing clinical trials, so far none of the patients in my clinical trial either died or even developed a second disease, because it also prevents all the diseases it treats or cures. And it's not just Alzheimer. I can cure almost any disease in the world with my 16 patents. So if you guys are interested in what I do, I'm happy to connect.
Dr. Robert, you're a very busy man.
Definitely.
I wanted to ask, Riza, do you feel race plays a part in one, early detection, treatment, outcomes? Would you address that for the panel?
So you mentioned the race?
Race.
Yes, so definitely. Unfortunately, many families, some of the treatment and diagnosis happening for the patients, like you mentioned, the PET scans, they are not easy, cheap, and they are not really easy accessible for many people all around the world. And these are the unfortunately happening and make it harder for people with different races, with different financial situation, make it difficult for them to have the easy access to this type of diagnosis, and also the next level to do the treatment. Unfortunately, that's almost 79% of the people have some sort of situation is not easy access for them to go. I earlier mentioned if you have a family member has this type of disease, you should go ahead and do the pre-diagnosis and everything, but unfortunately it's not happening and it's not easy for everyone to do that. That's the reason. Financial situation and also the cultural differences, that makes it different for everyone. But I believe with the new technology, make it more easy, accessible to everyone, and because it's already forming and shaping the new healthcare of the treatment, make it easiest and to give the other patient with different races, with different culture, with different financial situation, give them an opportunity to use this type of treatment for early diagnosis of the Alzheimer's. It's happening, but I just cross the fingers. Hopefully in the near futures, we can somehow improvement to make those gaps narrow as we can. So make sure everyone all around the world have the easy access to this type of treatment and diagnosis.
Dr. Nikos, your homeopathic treatments, are those, do you have any races that have issues acquiring this treatment, or is it available to everyone, or is it insurance-based? How do people go about getting the homeopathic treatment of this disease?
Look, we are not only using homeopathic treatments. In our academy, we are training doctors to combine different therapeutic modalities. So we train our doctors in homeopathy, because from homeopathy we can discover the personality of the person, and we train them in Chinese medicine so that the doctors can know how the organs are connected and which emotions are triggering which areas of the body. Then we train doctors to neuro-linguistic programming so that they know how to communicate with the patient. We train them about nutrition, lifestyle medicine, and all of these are tools for somebody to be able to go deeper. And when we are speaking about different races are usually have different emotional expression. So people that are very passionate can be very happy in the one moment, but they also can be very sad.
Are you talking about me? Oh my goodness.
We've
only been together for like 20 minutes.
I would love to be together with you for more, but I like people that have passion. But the thing is that when you have passion about the good things, you have passion about the negative things. And so this has a great impact on your gut and on your lungs. So you are most possible to deliver certain diseases. And you can see when people are exposed to different viruses or different bacteria, not everybody reacts the same way. So for me, going through a protocol that can detect the imbalances in your body based on your emotions, your lifestyle, your mindset, your trauma, then you can do real prevention. And of course, you have to detox your body, detox your gut, change the microbiome of your gut, as other speakers said earlier. I think this is the right prevention.
So, Riza, what would you like to see going forward in the detection and treatment of Alzheimer's and other dementias?
So, as I mentioned, making sure it's going to be easy access and accessible for everyone all around the world. I believe that's my passion and I'm looking forward to this happening. Because unfortunately, as I mentioned, so many of people, they don't have the easy access to this type of treatment and early diagnosis. So that's a goal and passion I do have. I mentioned that I hope someday soon this gap gonna be gone. No one gonna have the excuses of not having the easy access to this type of scans, treatment, and diagnosis. That's going to be the goal. And one of the other things I just want to mention that we never forget about the family of these type of people. As the last panel, there was talking about the cancer, and the people of the family have also some sort of cancer, but Alzheimer's is happening too. If you have any family member has Alzheimer's, you know how hard for their family is to take care of that person.
Yes, caregivers suffer greatly.
Definitely, because that person, unfortunately, not knows what exactly he or she is doing, but the family still loves that person. They still want to take care of that person. So we need to some sort of providing support for the family as well. I know the Alzheimer person has affected and has life-changing, unfortunately, happened to he or her, but the family needs some support as well. So we need to provide some sort of treatment or providing some sort of taking care of the family as well for them.
Dr. Robert, what would you like to see going forward?
Oh, I want to connect with everybody who has any disease or is interested in disease. Actually, it makes you happy. You can see better, you're a better driver, your reactions are better. And yeah. And you guys have the best day, best evening ever.
Can I ask a question?
Yes.
Your treatment, maybe I missed that part. How's the treatment?
It's oral.
It's
oral? It's oral. So, and there's lots of unusual things about me. So I do not make money from my patients. I refuse to make money from treating people. I give my medications. That's also why I say it's not, I don't sell my treatment. I treat people, and I only charge what it costs me to produce it and the shipping costs. And currently it's $7 per day. It's actually $7,000 per kilogram to produce it. And it's the human dose is 1 gram per day, so it's $7 per day, $7 per day. And the minimum FDA, for FDA approval, the minimum time period I can use is 4 months. So it's $840, and then you're set for 4 months. And people stay on it because it doesn't have any negative side effects, and there are additional benefits after the 4 months. And you don't want Alzheimer's to come back after that.
Definitely.
Yep. Yep.
Just another question from Doctor. Doctor, you mentioned about how depression could cause Alzheimer. I just wonder if you can talk more about this. That's a brand new information. So you mentioned that. So just wonder if you just expand that area about the depression. How could be the reason or one of the reasons of the Alzheimer?
I believe that depression has a direct impact to your lungs and your gut. And the gut microbiome is directly connected with the brains. So from an energy point of view, depression is directly connected with the brains. So I have the joy to have my son in Imperial College studying how boredom and depression is connecting with the brain cells. Hopefully we can present his research shortly. But the thing is that every disease is starting when we have a lack of energy in a certain organ. So, and when you know the connections between the organs, you can understand how are the interactions. On the other hand, I'm very much triggered from Dr. Robert. And our motto in the academy is that knowledge that is not shared, it's knowledge that has no need. Because we are going to leave this planet one time or another. So I will please invite you, if you would like, to share your knowledge in our academy, so we can train other doctors. Because what you are producing, you declare that is giving therapy to many different conditions. And I would like to see how it interacts with the body energetically.
We're making connections at Health 2.0. Making connections.
Sure,
that's why we are here.
Actually, you're absolutely right. There's a gut-brain axis. And actually, what people don't even know that 95% of all the sertraline is made in the guts, not in the brain. Okay? And yeah.
Are you going to accept his invitation?
Yes,
Dr. Robert?
absolutely.
Okay,
Absolutely.
good.
Absolutely.
Thank you.
Yes,
interesting.
Yes, absolutely.
So I have a question. There's been more in the news about early onset Alzheimer's and dementia, or younger onset. Have you had any experience with patients that were younger than 50, or and you've been diagnosed with some type of dementia? Have you had any experience with that? That's for you and Dr. Robert. Dr. Nikos first.
Well, I don't have special experience in young people with dementia, but I believe that toxicity is always the first factor. I've seen a lot of people suffering from dementia after COVID-19. So we can see that a viral infection has a great impact in the brains. And unfortunately, young people are very stressed nowadays because it's very hard to make a living in this society. So again, stress become a depression factor, and this can lead young people to develop not actually dementia. You can see that they start being more forgetful, more detached. So this is the first stages for me.
Dr. Robert?
Actually, to this, it's not that the virus caused all those problems. Partly, it's a mental problem that just locking everybody up for 2 years causes stress and mental. We stopped interacting with each other properly and stopped the proper social interaction, and thereby depression and all these things increased. And the virus actually, it's not very toxic to us. The virus, but what it does, it makes our immune system haywire. That's what COVID did. And what killed us, it's not the virus, it's our own immune system. This immune storm is actually our own immune system that killed us. And it's a very unusual virus. It's not that toxic to us, but our own immune system goes completely crazy. And what long COVID is, it's also, it's due to inflammation and autoimmune problems, and that's by our own immune system. The virus is long gone, and our immune system is still disturbed. And yeah, I can cure COVID within 2 days. I can also cure long COVID, and it also prevents COVID, which nothing else can do.
Man, there was a plethora of information up here today. So now I want to see, are there any questions in the room? Does anyone have questions for our panelists in the room? Yes, beautiful.
I
gonna
won't
be here?
leave. Yes, I'm here for all 3 days.
Go right ahead.
And I get awards all the time, yeah.
So my mother has been recently diagnosed with early onset dementia. Because of the issues, we missed all of her doctor's appointments. What is your opinion on health care available for people that are on Medicare, Medicaid? And we are having a really hard time getting her back in to see anyone. So what are your thoughts about physicians, nurse practitioners, just availability of providers in this space?
Dr. Nikos, you can answer first.
Well, I don't have any experience in this field. I cannot answer that. I'm from Greece. And things are much easier there. We are much more connected with everybody.
We're moving to Greece. We're moving to Greece, guys. We're out of here.
You
Let's
are all
go.
welcome.
Because of political reasons.
Maybe next year all we have can be in Greece.
Dr. Robert, do you have an answer for her question?
Actually, so I cannot do anything about this right now because it's not FDA approved, and you cannot, doctors cannot prescribe it right now. But any if there's no other medications that works as well or addresses certain things, then they can refer the patient to me and then I treat them. So $7 per day is not that much, but and it's about 1.5 years away from FDA approval. After FDA approval, you just pay your co-payment. Yeah, yeah, yeah.
My question though was about providers. I mean, are you all seeing that there is less? We're having trouble getting her in to see the doctor. And this is a very large facility.
Is it because he's like overscheduled or they're short staffed? We're seeing
this kind of everywhere. And so, she's my main concern.
Have you thought about mobile doctors?
They don't even have virtual space. So tell me more. How can we do? I mean, we can't even get a virtual appointment for her.
Where do you live? New Orleans? Yeah, well, I'm from California, and we have a plethora of mobile doctors that will come and do house calls and visits and establish care.
Yeah, video calls.
Hmm?
Video calls.
Yeah.
It's
Do that
done
too,
all
but-
the time. Yeah. You can treat people on the other side of the globe. Yeah. Yeah.
No, I understand
So this is my opinion, you know, when you go back home, look up mobile doctors in the area. You know, and there has to be some, especially after COVID, after the pandemic, look up mobile doctors for seniors and then go from there. Or neurologists, yes. Neurologists, I'm not really sure yet, but start with primary. Start with a primary. Like specific neurology, then try that. Try that mobile doctor for neurology. And then, that's just my opinion. Okay.
I know that happened, and one of the issue with going with out-of-state doctors and physicians, it's going to be the insurance problem. They mostly not going to cover that. But I saw so many patients, they go out of state, you know, to get the treatment. Unfortunately, I had a friend of mine has early diagnosis of cancer. After 6 months, he got the chance to visit the doctor, but the cancer got bigger and bigger, and whole body was affected with the cancer, and it was too late. Unfortunately, it happened right here in Los Angeles, California happened. And so many cases, the patient gonna go out of their pocket. They're gonna go other states for the physician to make sure they have the early access to the physician and have their advice on the treatment.
Are there any other questions? Well, I want to thank all of our panel members, Dr. Robert, Riza, and Dr. Nikos, for all of your information, all of your enlightening information, and your help in your discussion. And I just want to end that, you know, early detection is very important for diagnosis and treatment of Alzheimer's and other dementias. It helps with better patient outcomes for the patient and the families. The families get more time with their loved one with early detection. So I just want to say thank you, everybody.
Thank you. Thank you for the lovely energy. Thank you.
Have you guys been enjoying the conference so far? Good, good. I'm curious, who is come from the farthest away spot? Anyone outside the country? Yes, where are you from? Yeah. Canada, okay. Do we have anyone further away? Dubai, okay, okay. Okay, Dominican Republic. That's pretty far, all right. I feel like we might have a winner. She looks pretty, like, thinking she's from far away. Where are you from? Slovakia. All right. Well, welcome. Thanks for joining us here in Las Vegas. And thank you, panelists, for that last topic. And as the day comes to an end, it is time to celebrate once again this recognition session that is about to honor the trailblazers who are driving innovation and making a difference in healthcare and wellness. Their contributions remind us that change starts with individuals and teams who dare to think differently. Now, Tandria Collins is going to join us on the stage to help present these next awards. Please welcome Tandria to the stage. Dr. Collins is the founder, CEO, and principal of the Language and Literacy Academy for Learning, Inc. She is a Lean Six Sigma black belt in education and runs a charter school for students with disabilities. Dr. Collins is also active in community service and is a published author, speaker, and business coach. Thank you for being with us today. And as we had earlier this morning for awards, if you'd like to say a few words as a recipient of an award, please let us know. And let's go ahead and begin with our first award. Our first award goes to Dr. Abid Singh, MD, Health 2.0 Conference Excellence in Healthcare Award. Dr. Singh, MD, MHA in Healthcare, is the pro bono chief medical advisor of the We Heal Foundation. Dr. Singh has extensive experience as a practicing drug discovery and clinical oncologist physician. In his free time, Dr. Singh likes to ski, paint, play tennis, and write poetry. Congratulations on your award. Our next award is for Dr. Alicia Jones for Health 2.0 Conference Excellence in Healthcare Award. Dr. Jones is a Chief Medical Information Officer at Vitus Consulting Group with over 25 years of experience. Dr. Jones has excelled at bridging the gap between clinical expertise and healthcare solutions. She holds a Doctor of Osteopathy and Fellowship in Geriatrics, focusing on the health policy. Congratulations to Dr. Alicia Jones. Our next award is for Dr. April L. Coleman Bullard for Health 2.0 Conference Excellence in Healthcare Award. Dr. Coleman Bullard is a pediatric psychologist at Georgia Autism Center with 17 years of experience in the mental health field. Additionally, she is a school psychologist at the International Charter Academy of Georgia. She specializes in assessment of ASD, ADHD, dyslexia, and anxiety. Congratulations to Dr. April L. Coleman Bullard. Our next award is for Dr. Arcella M. Burton for Health 2.0 Conference Excellence in Healthcare Award. Dr. Burton is the VP of Government Affairs at HealthX, Inc., as a Stonewall Community Development Corporation board member. She has raised funds to house 40 homeless veterans and provide permanent housing. Additionally, she is a subject matter expert in managed care operations, value-based contracting, product management, and congratulations. Our next award winner is for Dr. Bianca Madison Villita for Health 2.0 Conference Excellence in Healthcare Award. Dr. Madison Villita is the founder and Effective Health Solutions. Alongside this, she has founded and co-chaired the Lifestyle Medicine Academy. Dr. Madison Villita specializes in preventative healthcare, life optimization coaching, neuroscience coaching, anti-aging medicine, emotional health, stress, weight management, and corporate wellness. Congratulations. Our next award is for Dr. Biplab Malo for Health 2.0 Conference Visionaries Award. Dr. Malo is the founder and CEO of Stapkin LLC, who has been practicing dentistry since 2000. Years into the practice have helped him gain deep knowledge of inflammation and bacterial infection. With his expertise, he has developed methods to prevent or treat plaque-related diseases, including dental caries, colorectal cancer, and dementia.
Thank you, everybody. Thank you, Health 2.0, to giving us this recognition. It is very important, especially for the startups and new innovators, to encourage them to go beyond their capabilities. And I do believe rewards like this will help to motivate them even more. I am working on mainly type 2 diabetes. Prevention is possible. Our mission is to prevent type 2 diabetes, and vision is to see a world without diabetes. And we need your help. Thank you very much.
The next award is for Brian Bauer, Health 2.0 Conference Excellence in Healthcare Award. Brian is the founder and executive director at Abundance Foundation, Inc. He is dedicated to addressing the growing need for accessible addiction treatment services. With a deep understanding of the challenges faced by individuals struggling with addiction, he offers essential support, including recovering coaching and community building. Our next award winner is Corinne Claire Bradley for Health 2.0 Conference Excellence in Healthcare Award. Corinne serves Milestone Senior Services as the COO, ensuring disabled and older adults remain in their community and out of institutions. Corinne is a doctoral prepared nurse with over 20 years of experience in the healthcare field. Corinne aims to serve vulnerable populations and ensure that they receive the needed services. Our next award is for DJ Laudry, Health 2.0 Conference Excellence in Healthcare Award. DJ is the co-founder and chief consistency officer at Acres of Diamonds, LLC. With 500 plus hours of one-on-one and group coaching experience, DJ specializes in mental fitness. DJ holds certifications and training in emotional intelligence, mental fitness, NLP, leadership, and human optimization, focusing on eating, moving, and sleeping. Congratulations. Our next award winner is Dr. Jeremiah Crescentia. I apologize. Let me try that one more time. This next award is for Dr. Jeremiah Crescentia for Health 2.0 Excellence in Healthcare Award. Dr. Crescentia leads medical coding and audit at Cure Medical Centers, bringing her 2 decades of experience in clinical practice and revenue cycle management. Her career path has been diverse, starting as a general practitioner and evolving into roles focused on revenue cycle management operations and healthcare quality.
First of all, I'd like to thank you, Almighty God, Jesus Christ, for giving this award. And the next, for sure, Health 2.0, for recognizing me. And I like to, basically, this award and honor goes to my better half, my mentor, my backbone, my husband who travel always from there to me, and my old age parents who are watching through live. You know, basically, I'm born and brought up in a small village over there in the southern part of India. So my parents, they have put on their all blood and everything to bring me up to this stage. So for sure, I'm grateful to them. And always my friends and families was always there for me to support with their prayers and everything. And finally, guys, I want to say only 2 things. And before that, my organization, Cure Medical Center, the top management of Cure Medical Center, who has always believed me and who always given me a platform to perform. And finally, I want to say only a couple of things for you. Just one thing is, please take care of what you eat and what you feed to your children. That's very important because food is your medicine and medicine is your food. And second thing, very important thing, please value your family and friends and the relationship, whatever you have. Actually, your relationship can heal any kind of your mental trauma. And we are having a lot of discussions over here, this Alzheimer's disease, dementia, whatever may be the cancer path or whatever may be, everything could be healed by a good and well-matured enough family and friends. So please, take time to talk to your families, your friends, and please do value them. Thank you all.
Our next award is for Joshua D. Zuza for Health 2.0 Excellence in Healthcare Award. Joshua is the senior principal scientist at Medtronic, alongside being an engineer and medical device innovator. He has varied expertise spanning ophthalmology, urology, neurology, and gynecology. Leveraging this expertise, he designs cost-effective solutions and enhances healthcare access and quality in low-resource settings across developed and emerging markets. Congratulations to Joshua. Our next award is for Dr. Christopher Ruse for Health 2.0 Excellence in Healthcare Award. Dr. Ruse, PhD, LMHC, is the CEO and owner of Evolve Care Counseling. With a rich background as the former director of counseling internships, he offers clinical expertise, empathy, and insight. Dr. Ruse tailors therapeutic modalities, including psychotherapy and hypnotherapy, to meet clients' needs. Our next award is for Kira Montago for Health 2.0 Excellence in Healthcare Award. Kyra is the owner of Kyra Holistic Living and naturopathic doctor specializing in yoga and holistic living practices. She was trained in Spain, the UK, India, Venezuela, after growing up in the Dominican Republic and the UK. Kyra has abundant energy and is passionate about her life-work practice. This next award is for Lisa Driggers Millam for Health 2.0 Conference Excellence in Healthcare Award. Lisa is the founder of American Women's Empowerment and a national speaker at the forefront of what women need to be heard. She lives in Georgia with her husband, and Lisa has 4 grown children in which she helps them to pursue their dreams. She loves to read, write, and paint. Congratulations to Lisa. This next award is for Dr. Maria Rodriguez for Health 2.0 Conference Excellence in Healthcare Award. Dr. Rodriguez is the CEO of Care Counseling Center, a best-selling author, a renowned licensed professional counselor, and a mental health expert. With a master's in clinical psychology and a PhD in general psychology, she has spent over 2 decades empowering individuals, families, and immigrants facing emotional challenges. Congratulations to Dr. Maria Rodriguez. Our next award is for Dr. Nikos Chatsabalas for Health 2.0 Conference Excellence in Healthcare Award. Director in Humanpathy Limited, Dr. Chatisbasi is an experienced neuropathic and functional energy medicine practitioner. His expertise spans biofield engineer, photonic energy, homeopathic frequencies, and quantum technologies. He actively researches and develops new solutions that harmonize modern medicine and alternative therapies.
Thank you very much. I'm Nikos Hadjibalasis, and the academy is called Humanopathy Academy. And it's all a teamwork, so I want to thank all my colleagues because we are doing that all together. Thank you very much.
This next award is for Dr. Noreen Galari for Health 2.0 Conference Excellence in Healthcare Award. Dr. Gallery is the CEO and founder of Innerglow, a brand of nutraceuticals backed by research and clinical trials. She is also a board-certified dermatologist with lasers and cosmetic surgery fellowship. She graduated summa cum laude as the #1 medical student from Jefferson Medical College. Our next award is for Dr. Pamela Cipriano for Health 2.0 Conference Excellence in Healthcare Award. Dr. Cipriano is the president and founder of the Practice of Health and Wellness. She is the first nurse practitioner in Connecticut to establish an independent practice. Today, she specializes in Lyme disease, co-infections, chronic inflammatory conditions, and preventative medicine, helping patients regain health beyond medication alone.
Hi, I'm Dr. Pamela Cipriano. For nearly 10 years, I have worked tirelessly to help my patients in my private practice return to a state of wellness. Finding their health again has been very important to me. I'm very emotional and very passionate about what I do, and I really appreciate being honored with this award. So thank you.
Our next award is for Professor and Dr. Robert Scheitzel for Health 2.0 Conference Excellence in Healthcare Award. Professor Dr. Scheitzel is the owner, president. Schitzel. Let's try it again. Okay. This next award is for Dr. Professor Robert Scheitzel. Okay, well, Professor Dr. Scheitzel is the owner, president, CEO, and CSO of Protecta Skincare Inc., Microbiofarm Inc., Radmid Inc., and ImmuneRight Inc. His mission is to prevent and cure diseases in all creatures while enhancing their beauty and simplifying life. He holds 15 patents and has developed 5 innovative products. 16? Okay, my paper says 15. All right. Congratulations on that award. Our next award is for Stephanie Auden for Health 2.0 Excellence in Healthcare Award. Stephanie Auden is the Executive Director of Valley Silverton Assisted Living. She has over 20 years of experience in healthcare and management. Recognized for her advocacy, she received the CALA Advocate of the Year Award in 2018 and 2019. She was honored by Riverside City Council for her contributions in senior care. Congratulations, Stephanie. This next award is for Trauma Academy Northwest, LLC, for Health 2.0 Conference Outstanding Organization Award. The Trauma Academy Northwest, LLC began with a vision to offer education and consultation for many, including educators, daycare staff, law enforcement, and more. The company is expanding now to provide sensory toys for schools and families. On behalf of the organization, we have Abraham Reichlin, the owner and founder, to receive the award. Okay. The next award is for Venkat Kudali for Health 2.0 Conference Excellence in Healthcare Award. Venkat currently heads the Business Intelligence Department of Carty Cancer Center. He has over 2 decades of experience in diverse sectors, including 6 years in the healthcare sector. In his current role, Venkat implemented several decision-making dashboards, analytical reports, and successful automation that impact cost savings for the organization. This next award is for Vital Wealth Pharmacies for Health 2.0 Conference Outstanding Organization Award. Vital Wealth Pharmacies is a group of pharmacies that provide comprehensive pharmaceutical services and products. They are known for their wide range of medications, health and care products, expert advice, and the production of special medicines. On behalf of this organization, we have Stephanie Wall, the pharmacist, to receive the award. Abraham Reichlin for Health 2.0 Conference Visionaries Award. Clinically trained in social work, Abraham is the owner and founder of the Trauma Academy Northwest, LLC. He has successfully worked with children, families, and adults in various settings. He brings knowledge and experience to training, consultation, and outpatient therapy programs. Congratulations to Abraham. The next award is for Akiam. For Health 2.0 Conference Outstanding Organization Award, AKIM is revolutionizing therapeutics with Yada ML Squared, the world's first AI-driven trillion protein screening platform. By unlocking undruggable targets where antibodies and small molecules fail, AKIM pioneers next-generation protein therapeutics for cancer, immune disorders, and beyond. We have Eswar ER, the co-founder and CEO, to receive this award on behalf of the organization. This next award is for Fatma Gulsurat Paul Aviana for Health 2.0 Conference Excellence in Healthcare Award. Fatima Gulsurat Pahlaviana is an accomplished physician and research based in Tehran. Holding an MD from Tehran University of Medical Sciences, she has extensively contributed to HIV and AIDS and infectious diseases research. With multiple publications in peer-reviewed journals, Fatima's medical practice includes roles in emergency medicine and private clinical settings, complemented by a passion for advancing medical research globally. The next award is for Molly McElwee Malloy for Health 2.0 Excellence in Healthcare Award. Molly RN CDCES is the VP of Metabolic Health for Locus, where she overlooks the integration of diabetes and metabolic health for the EMR. Before this, she was the senior MSL for the Tandem Diabetes Care and Clinical Outcomes Manager for the Behavioral Sciences. Congratulations, Molly. The next award is for Ryan Zulmot for Health 2.0 Conference Excellence in Healthcare Award. Ryan is a co-founder of TruePoint Healthcare, who pioneered grassroots healthcare initiatives in the post-acute sector before excelling in military healthcare. With a national footprint, Ryan specializes in launching startups, driving financial turnarounds, and implementing value-based care approaches. Congratulations, Ryan. This next award is for Gabriel N. Daikong for Health 2.0 Excellence in Healthcare Award. Dr. Gabriel N. Daikong, the DOO of CM Fit Global Health Consulting, brings expertise in public health, biostatistics, and clinical research. With a doctorate in public health and leadership experience in health education, he advances community wellness initiatives.
Hello, everybody. I would like to thank Jesus Christ and God, Elohim, and the Holy Spirit to have given me this opportunity, and I would like to thank everybody who have worked hard to organize this. Pretty much in life, you just have to focus on what you care more, what you have been blessed to give to the people. You don't have to worry about what people think of you. You have to worry about what you believe the divine purpose was put in you to change society. We are here, I'm here today with my organization to forward healthcare into the new era with AI, the landscape of AI into advancing medicines, biotech, medical device, and pharma by preventing care and sorting out cure like vaccine, as well as therapeutic pathway through AI. That is what I'll be doing moving forward with my organization, looming as well new investor and new ideas to make it a better place and change the course of healthcare forever, I believe, with God's blessing. Thank you very much.
Our next award is for Brian Leginsquist for Health 2.0 Conference Excellence in Healthcare Award. Dr. Brian Leginsquist, DPM, is a pediatric surgeon specializing in foot and ankle surgery with over 13 years of experience in Salt Lake City, Utah. He has earned his Doctor of Medicine degree from Ohio College of Medicine and completed his residence in Intermountain Medical Center. Congratulations to Brian. Our next award is for Samyata Saxena for Health 2.0 Conference Excellence in Healthcare Award. Samyata Saxena is the founder and CEO of The Garden Recipe and The Garden Pooch, offering anti-cancer recipes, holistic health tips, and inspired healing for humans and dogs. A cancer survivor and former cancer researcher, she advocates natural healing over toxic conventional treatments.
Hi, I just want to say a big thanks to the Health 2.0 team and all the wonderful people who clapped for me earlier when I shared that I'm 11 years cancer-free, and also who clapped for me this time. I just want to say if you guys need any support or your loved ones need any support, please check out the gardenrecipe.com website. You can find me through that and let your loved ones know about it. There's a newsletter that goes out that supports the holistic healing journey from the root level for cancer survivors, cancer patients, or anybody who's struggling with any disease, you know. Last but not least, a lot of my supporters will be watching this tomorrow who has been with me since day one when I launched the Garden Recipe, going through this journey. So I just want to say a big shout out to my supporters who have been so loyal. And I know we are small right now, but one day the Garden Recipe will be world famous, because all of us have to fight this corruption system of the big pharma and the cancer industry and the drugs, the medical mafia. And we have been lied way too much about how to heal our body. Yeah, we have been lied big time about how easy it is to heal ourselves because there's no money in it for the cancer industry in it. So we need to get together like these events, as well as have our followers and fight for all of the rights back and go back to nature, what nature has given to us. So one day, I hope the world knows about the Garden Recipe, and I can teach them the truth that it's very easy to heal from any diseases and take back the rights that the governments and this Monsanto and all of these pharmaceutical companies have taken from us, So let us stay united. All right, thank you.
Okay, thank you to all of our award winners for those excellent speeches. And a huge thank you to our presenter here presenting the awards. Thank you so much for helping us. Now, your dedication and achievements are a beacon of inspiration, pushing us all to reach higher in the pursuit of healthcare excellence. Let's give another big, well-deserved round of applause to all our award winners. As we conclude today's stimulating discussions, let's look forward with anticipation to the new opportunities on the horizon. Mark your calendars for the next gathering in Dubai of 2025 and in the USA and in Singapore in 2026. Be sure to visit the 2.0 conference exhibit booths near the registration desk to learn more about our upcoming events. Now, chat with your representatives to secure your place early and ensure you are part of our future innovations. Now, before we wrap up today, I want to extend a heartfelt thanks to our silver sponsor, Centrifuge Inc., and our bronze sponsors, VitaWelt Apocanthin, Region Global, and Dr. Weiss Wellness for PLLC for their support. Let's keep the momentum going into the evening, share your ideas, exchange stories, and enjoy the vibrant atmosphere that this incredible city gives us. I'm excited to see what tomorrow brings, and I look forward to another day filled with inspiration and groundbreaking discussions. We'll see you all at the happy hour.